Good evening to all of you. So, today we'll start with the aphorism. I think we have done till 153 and we'll start with aphorism 154. So, today we'll talk about the homeopathic aggravation, that how it happens. Few aphorisms we will do it today, few we will do in the next part. Regarding the homeopathic aggravation, there are many things which are there, that how much the aggravation should be, how long does it go. So we will talk about those few things also, that how to understand that this is a homeopathic aggravation. This is not something that the disease is getting aggravated itself. So we will talk about that also today. Because once you see a slight aggravation, especially in the chronic cases, a slight homeopathic aggravation, it gives you confidence very that the medicine is good, the medicine is right, it is working as it should be. In some cases you don't get aggravation, or directly the amelioration starts. There is always a question mark there, that okay, if it has started directly with the amelioration, then maybe. But those cases also happen, although rare, although very few, where the dose is perfect, the potency is perfect, patient is not very overly sensitive, so that slight aggravation is not noticed by the patient also, so he does not report you back about that thing. So those kind of cases are also there, those kind of experiences are also there. But yes, if it is there, even Dr. Kent writes that, if there is slight aggravation, the homeopath gets a confidence that the medicine is good, medicine is right. So we'll talk about those things also. So let's start with the aphorism 154. ऋषभ, हो रही है स्क्रीन शेयर?
नो सर, मैं दोबारा करता हूँ 1 मिनट। यस सर, अब हो रही है।
Okay. So aphorism 154. If the if the antitype constructed from the list of symptoms of the most suitable medicine contain those peculiar, uncommon, singular, and distinguishing symptoms which are to be met with in the disease to be cured in the greatest number in the greatest similarity. Now there is this process. Many times now it is less that I get this question, but in the initial times when I would go somewhere like to some other countries, like I went to USA or Brazil or Thailand also, I would meet some doctors. There was this common question, with me. They would ask that you don't take much symptoms, like you don't take much rubrics in the case. When you're repertorizing, when you're analyzing, you don't take much of the symptoms. So that answer is in these aphorisms 154. Even next there will come an aphorism which will clarify this thing, but there is also this thing, this aphorism, that if the antitype constructed from the list of symptoms of the most suitable medicine contain those peculiar, uncommon, singular, and distinguishing characteristic symptoms. So we have made a list of symptoms. First we have taken the totality of the symptoms. We have talked about it. We have done a case taking, which was very exploratory. We have asked about everything, and we have collected all the data. Now from this data, from this case, we have to see which symptoms are very peculiar, uncommon. They're very singular and distinguishing. So those symptoms are called characteristic symptoms. And now I have to pick characteristic symptoms out of the case, out of the whole totality, whole data. I have to see which symptoms are uncommon, they are distinguishing, they are very peculiar, very rare. I have to collect all those symptoms which are to be met with in the disease to be cured in the greatest number and in the greatest similarity. So I have to find an antitype. Antitype means my any constitutional simillimum or acute simillimum, the simillimum, the medicine which is similar to my case, and it should be similar to these characteristic symptoms of the case. Again, if the antitype constructed from the list of symptoms of the most suitable medicine contain these peculiar, uncommon, singular, and distinguishing characteristic symptoms, which are to be met in the disease to be cured in the greatest number and in the greatest similarity. So all the characteristics, almost all the characteristics are covered under this, and it is completely similar or greatly similar or maximum similarity has been obtained in this manner. This medicine is the most appropriate homeopathic specific remedy for this morbid state. That remedy will be a homeopathic remedy, a homeopathic specific remedy for this morbid state, for this condition in this case. So many times we are just taking the symptoms which are very common, which are very undistinguished, very, you see those cases, those kind of symptoms. If we, in almost all the cases, for example, anxiety about health. Um, I have read someone's book, some homeopath's book. In almost all the cases, he takes this rubric. Because if someone comes and asks that, doctor, will I get better? He will take the anxiety about health. That he has asked me a question. But that is a very common thing. When a patient comes to a physician, he wants to ask that how many days it is going to take. Will I get better? What will get better? How will I come to know that the medicine is right? These are very commonly asked questions. A patient is coming to the doctor with his sickness, so he is worried about sickness. There is nothing uncommon about it. But now there came a patient a few days back. I was discussing the case today with some of my students. So there came a case a few days back, a lady around 57, 58 years old lady. She was having this hemangioma, a big hemangioma in the spine, over the spine region, which was pressing the spine. And because of that, she was getting weakness in the legs. Like, there was this symptom that when she picks up her foot and places it, in her mind she has done it, but actually it has not happened. Actually, it has not happened. The nervous system did not comprehend that information, did not got that information, but in her mind she has taken the step. So she had developed this tendency for misstep, where she will get imbalanced, and then she will know that I have not you know taken the step. So she came, she gave first for an hour, she gave this case to one of my assistant doctors. Then she was with me for 15-20 minutes, and we talked with her. I was taking her case, and during the whole time, during the whole time, and I think she has not taken homeopathy for this thing before also. She was referred by someone and she came. During the whole case taking with one of my assistant doctors or me also, she didn't ask these questions. That, what do you think? Have you seen these kind of cases getting better? She never asked. She never asked what is the prognosis of my disease, like what will happen. Will I become better or will I not become better? My symptoms, they will get better or not? Because she has come for medicine, so she didn't ask it anything. So that part is uncommon. That is something which is peculiar, because everyone, even a patient who is coming with cough and cold, like just now I got a case before starting the lecture, and a girl, she's suffering from cough and cold, and she's asking that how long will it take the medicine to that I get better. Because the patient has come to become better, they have come to you so that you can give some medicine and they can get better. But she was not interested in asking that thing. So that is something which is peculiar. That is something which I will take hold of. that okay, my medicine should match this behavior or this part of the. Otherwise, she's very intelligent. She's anxious about many other things. Like she's in her office work, she's anxious about many things which is happening. It is not that she is not known to anxiety, but in this particular case, we didn't see any. She came to take homeopathy because the doctors, the surgeons, they advised that this cannot be operated. So she opted for some other medicine. But when you go from one system of the medicine to the other, you are again there is more apprehension whether this thing will work for me or not. So the whole case, the disease also, because it is not a small disease, and she came alone. She didn't accompanied any of her. There was no family member, no friend. She came alone, even in this condition, from a different city, which is around 40 kilometers from my place. So she came alone. She didn't came with anybody, and she had a very good, strong will. She was intelligent. She was telling everything very good. There was no. I would not. She was an extrovert lady, so she was not timid. Also, she was not indifferent to her health. Also, she was not someone who has a dull intellect that this question would not occur to them. So that becomes very strange thing. That why she did not ask about it. So these kind of characteristics we have to get hold of in the cases. The disease, if it be not one of a very long standing, will generally be removed and extinguished by the first dose of it without any considerable disturbance. So the diseases of not very long standing, uh, that will be removed or extinguished in the very first dose which you will give to the patient. You will not even, especially acutes or just the diseases which are just started. Now, like I always tell you that, okay, I have read about this aphorism that only one dose that will cure the disease of a very beginning of not very long standing, and without any considerable disturbance, without any this thing. If now this thing with the one dose or the first dose, sometimes you have a question that only one single dose, very small, 2 3 globules, will they do the thing. But then when you see the things happening in front of you, you try this thing, and then you see the things happening. Whenever I read this aphorism, I remember a lady very many years back, like might be 10 years back, when this lady came, and she was married for 1.5 year. She was trying to um, have a baby, but it was not working. So finally, they went to a doctor, and this doctor, he wrote some tests for thyroid because she was gaining weight also from past 3 or 4 months, and she was having some other symptoms, this dryness of skin. So he said, okay, get your this thing checked. So when the test came, the TSH, it was around 500, the units. Because usually when you see, it is around, okay, if it is increased 15 20 30, okay, within that range. But there it was 500. That when she went to the doctor with the report, he saw and he threw the report on the table. This was how she explained that he threw the table. That, what is this? He said that, I don't think that it is right. It was a report of his own hospital, his hospital. He had a private hospital, the doctor, and the reports were carried in the hospital. He said that, I don't believe this report. I will refer to you to some other laboratory. Get it checked from here. So he referred, and the same report came, and he was like, "Oh, we cannot. I don't know what to do with this thing. I have never had a. You just start with this Thyronorm, and then we will think about what we can do." So he gave her around 200 or 250 this mg of micrograms of Thyronorm, thyroxine, and she told her to come after 1 week. I will think about. Now this lady, her mother was treated by me. She already. So the mother, when she talked with the mother, the mother said that, don't do anything, just go to him. So she came, and I was also shocked to see that I've never seen this kind of a report. Although there were no, like the pathological symptoms or something like this. No, she was just having overweight and she was not able to conceive. There were no symptoms like, but still, your mind, there is some anxiety and this thing. And, but the things, the philosophy is clear that I have to see the symptoms. So I said, okay, let's see what we can do. So we took the case, everything, and we went on. We gave her the remedy. We gave her pulsatilla at that time because the whole constitution, the whole things, it matched. So she took pulsatilla. I gave her medicine and then placebo also. And I told her to come back after 1 month and get the test done after 1 month. We'll see what happens. So she didn't came. She didn't came after 1 month. But I had this thing, this curiosity was there in the mind that, what would happen? Let's see. So 2 months she didn't came. I thought that she might have started some treatment somewhere. Then after 2 or 3 months, her mother came for her medicine, the mother's medicine, and okay, I took the follow up, and then I was hesitatingly asked her that, "Oh, your daughter came at that time. So how is she?" She said, She's okay. You gave her the medicine after within 20 days or 25 days she conceived, she got pregnant." I said, "What?" She said, "Yes, she got pregnant with that. So we thought that because of the pregnancy, now you have to take some this supplement, some folic acid and this thing, and you don't, and you tell us that not to take any medicine with this medicine. So we stopped the homeopathic medicine and we started taking the folic acid and the iron supplements and this thing. So we said that when she will get better, that pregnancy will be this thing, she will have a baby, then she will continue the treatment." So I said, "But how is the thyroid? Like, did you got TSH checked?" She said that she recently, her doctor, the gynecologist, said that you have to get the TSH done. It is normal. I said, "Normal?" He said, "Yes, but you didn't told, like I asked that, you didn't told that she had this TSH around 400 and 500." She said that she told the gynecologist, but gynecologist said that it might be a wrong report. The test was not done properly. Because now I know I would have also believed it for the first time, but because it was done from two different labs, without any this thing, so it was very you have to, okay, if it is done from two labs on the same day, then it has to be that thing. But like I told you, that if it is of not very long standing, even the conception and this thing, with one dose of pulsatilla, the first dose of the pulsatilla, everything was resolved. There was no other because the other medicines were not going on. That is the biggest criteria, because again in the next aphorisms, Dr. Hahnemann will talk about the same thing. So those situations, the natural disease, there is no other medicinal disease present along with the natural disease. So the symptoms, they go so fast, and this case, it always comes to my mind that so quickly everything resolved, everything went away, vanished. So aphorism 155, I say without any considerable difference, disturbance. Like he used this word here in the aphorism 154, he uses without any considerable disturbance. The disease will be extinguished without creating any disturbance. So now about that, Dr. Hahnemann is saying, I say without any considerable disturbance. For in the employment of this most appropriate homeopathic remedy, it is only the symptoms of the medicine that correspond to the symptoms of the disease that are called into play. The former occupying the place of the later, weaker, in the organism and thereby annihilating them by overpowering them. But the other symptoms of the homeopathic medicine, which are often numerous, being in no way applicable to the case of disease in question, are not called into the play at all. So he's saying only when you are giving, for example, you're giving sulfur for few symptoms of sulfur. Now sulfur has vast number of symptoms. Sulfur has the ability to produce vast number of symptoms, which we have seen in provings. So many symptoms. Now you see in a case that there are only few symptoms. Among those vast symptoms, there are only few symptoms. So here he is trying to explain that when you will give the sulfur to the patient who is similimum to sulfur, only it will only impress or it will only remove those symptoms in this case which are present. Because from the proving, now we are coming from the proving to applying the medicine. So from the proving, there is this thing in the mind that whenever I give medicine, sulfur will bring out all its symptoms, you know. So he's trying to explain that no, it is not that all the symptoms will come once you give the medicine, because of the minuteness of the dose, because of the smallness of the dose, and because you are not repeating it again and again. And here, there we see there is a way that you have to repeat by increasing dose in the prover, and then it comes a point when the symptoms start coming, then you have to stop it. So here in the patient, we are not repeating it. We are just giving one single dose, very small, minute of dose. There we can have given a little bit more so that the symptoms could come easily. But here we are giving very minute amount of doses, very small. So all the symptoms will not come in these cases when we are giving it to the sick. Only those symptoms come into play. He used the word comes into play, which are already similimum and present in the patient. So the patient growing hourly better feels almost nothing of them. So you will see in acute cases, especially the every hour the patient is getting better and he is not having any kind of these symptoms, because the excessively minute dose requisite for homeopathic use is much too weak to produce the other symptoms of the medicines. So because of this excessively minuteness of the dose is not that strong that it will produce all the other symptoms that are not homeopathic to the case in those parts of the body that are free from the disease, and consequently can allow only the homeopathic symptoms to act on the parts of the organism that are already most irritated and excited by the similar symptoms. So it will only work on those symptoms which are already present, only on those parts which are diseased. It will not act on those parts which are not diseased because of that weakness of the dose, thus changing the morbid affection of the vital force into a similar but stronger medicinal disease whereby the original malady is extinguished. So this is how it basically acts in a diseased state, the medicine. So it will replace the older natural disease, constitute itself on the patient for a small time, and then the vital force will take care of the, because of the minuteness of the dose, the this effect of the dose or the medicine, it also vanishes away, and this is how the disease is completely extinguished in this case. So this is again another reason that when we are giving it to patient, the larger dose, why it should not be given, first of all because it can produce many symptoms in some sensitive patients. Repetition of dose, why it should not be done, although there are separate paragraphs for it which will come, the aphorism will come. But he has started giving us an idea about those things. He has started giving us some links into what we should do and what we should not do. There is, however, almost no homeopathic medicine, be it ever so suitably chosen, that, especially if it should be given in an insufficiently minute dose, will not produce in very irritable and sensitive patients at least one trifling unusual disturbance, some slight new symptom whilst its action lasts. So he's saying that, but when it comes to the patients who are very sensitive, very irritable in their physical and dynamic part, however carefully the medicine is chosen, how much minute the dose is, there are sometimes that one or two trifling or unusual disturbance or some new symptoms they come up because of the sensitiveness of the patient. Although I have taken into this view that the dose was very minute, although I know that the medicine is very similar, but then again in some cases one or two slight new symptoms they will come. Recently it has come. I had many times this experience, but recently I had, so I will share that thing. A lady came with a very she had a lean constitution. She had this some problem about the eruptions in this part of the face, and very sensitive, very emotional lady. And I took the whole case. She was into the profession of teaching, and the remedy which was indicated was ignitia. So I gave her ignitia, like very minute dose, only 1 or 2 globules of the medicine, because I knew that she's a very sensitive person. So I gave her medicine. Next day she called me, the second day. Doctor, I am having this very strong hiccups. Hiccup. This was happening. And it suddenly started. I am in the school and it suddenly started. And I have never had this hiccups. Said that I have heard about it, but this is the first time I am feeling it. That I have seen my some people having the like this, but I never had. And it suddenly started. I was teaching, and it suddenly started, and I have to stop my class in between. And this thing came, and this is very. I'm very afraid. I'm very anxious why this is happening to me. So then it struck to me that okay, this is the that part of sensitivity of the patient, that some symptom of ignitia has come. So I told her to wait, and because I have given her as the placebo, so I told her to take 1 or 2 doses of that medicine in the interval of 15 or 20 minutes, because I also knew that this symptom will pass away very soon. It is not going to take much longer. So after that she didn't call me, and I had given her medicine for, I told her to come after 1 month. So she came recently. In between she called also a few days back also with some other problem, and she had this cold at that time, and I asked her about this thing, that how are the hiccups now. She said that it just remained for 10 minutes at that time when I took the second dose of this. She said the medicine, but I have given her the placebo. She said that when I took the second dose of the medicine, it vanished, it subsided, it never came back again. So this thing can happen also. Although medicine is very suitably chosen and she's getting better, I was telling that now the follow up came that she's much better. Her everything is much better. But in very some few hours after giving the medicine, or in 1 or 2 days, some symptoms might come up which basically are of the homeopathic aggravation, but they belong to the medicine. That is not some new disease. That is what Dr. Hahnemann will explain. For it is next to impossible that medicine and disease should cover one another symptomatically as exactly as two triangles with equal sides and equal angles. Because he is saying that it is impossible that all the symptoms of the medicine and all the symptoms of the patient, they will be always there and they will match exactly. It never happens. Most of the characteristic symptoms should match in a similar remedy. So they never match each other like two triangles with he's giving an analogy, but they never cover each other with like a two triangles with equal sides and equal angles. So there is somewhat, and something is there different, something in the medicine is different. This is always going to be there. But this, in ordinary circumstances, unimportant difference. He's saying that it is an unimportant difference. We don't need to think about it in the ordinary circumstances. Will be easily done away with the with by the potential activity of the living organism. He's saying that this is very small thing, this new symptom coming out, and it will easily be taken away by the energy, by the vital force of the living organism, and is not perceptible by patients not excessively delicate. Even the patients who are not excessively delicate, who are not very sensitive, these kind of symptoms, they come and go, and the patient do not even realize that thing. They don't even report about that thing. The restoration goes forward, notwithstanding, to the goal of perfect recovery. Even with this kind of something coming up, the patient will keep getting healthy. They will reach the perfect recovery, if it be not prevented by the action of heterogeneous medicinal influences. Like I told you, Dr. Hahnemann will talk about this thing, that in case of that this hypothyroidism, the lady who could not conceive, the major influence was that she was not under any kind of medicinal influence, because that is a very big obstacle to recovery and cure. So there was no heterogeneous medicinal influences upon the patient. By errors of regimen, there were no errors or nothing wrong was done in the routine, in the food, in the lifestyle, or by the excitement of the patients. There were no excitements, no this thing, if it is not there any kind of excitements, so the patient will recover to perfect recovery, to perfect health, when the medicine is given which is right. Even though if some one or two trivial symptoms come up, new symptoms come up because of the homeopathic medicine, but even then those symptoms will go away also, and the patient will go to the recovery. But though it is certain that a homeopathically selected remedy does, by reason of its appropriateness and minuteness of the dose, gently remove and annihilate the acute disease analogous to it, without manifesting its other unhomeopathic symptoms, that is to say, without the production of new serious disturbances, yet it usually immediately after ingestion, for the first hour or for a few hours, causes a kind of slight aggravation where the dose has been somewhat too large, however, for a considerable number of hours, which has so much resemblance to the original disease that it seems to the patient to be an aggravation of his own disease. So he's saying that although the patient, the medicine, very well selected remedy, homeopathically selected remedy, because of the appropriateness, because it is the right remedy, and the medicine is also minute, the dose is also minute, it will remove and annihilate the acute diseases. All the acute diseases it will remove. But in the first hour or some, many times for few minutes after giving the medicine, there is slight aggravation. It has to be slight. It should not be more than slight. If your medicine is right, but the dose is too large, like in the brackets he has given, that the dose has been somewhat too large, this aggravation will not be slight. It will be for considerable number of hours. And if it is an acute emergency, then it becomes a very big problem, because the patient does not have the that kind of energy to you know uh, have this kind of aggravation for many hours, which is so much resemblance to the original disease. Okay, so only those symptoms which are there already there, for example in acute, if there is the symptom of fever, there is symptom of weakness, there is symptom of dullness, there is some stupor going on, when you give the remedy, right remedy in a very minute dose, the patient's attendants, they many times they say that, doctor, after the medicine I think the things are decreasing, oh sorry, increasing slightly. There's slight increase in the things, the stupor has increased, the fever is increased, but there is a slight difference. But sometimes when the dose is unique, many times it happens, but this kind of change, it is not seen if the person or the observer is not very sharp, like the patient or the patient's attendants, if they are not very sharp, this kind of homeopathic aggravation, it's sometimes they passes in front of them and they don't know about it. But it is in reality nothing more than an extremely similar medicinal disease, somewhat exceeding in strength the original affection. So because we have given the medicine, the same similar disease producing medicine, but because it is slightly strong in strength, there will be slight aggravation of the symptoms because it is strong. This just shows you that your medicine is stronger than the natural disease. So now I was going to add something to this thing, that when you have to, when we can see that whether it is the aggravation of disease or aggravation of symptoms, these are two different things. when the disease is getting, for example, you have given some medicine and the disease is getting aggravated, the natural disease is getting aggravated. In that thing, basically, the patient himself, his all the things, especially his approach, especially his attitude, especially his energy, they go bad. The energy will decrease more. The patient will be more, you can say, lack of spirits will be there. He will be less vigorous. So there we can see, no, that no, there is this is the aggravation of disease. But when it is a homeopathic aggravation, the symptoms are aggravated. Very strangely, you will see that the patient seems better. The symptoms are aggravated, the headache is increased. I have given a case of a man with headache also, who came to me. He said, Doctor, he came to me with this migraine problem. He said that my symptoms are aggravated. The migraine is strong. It is remaining, it is giving me more pain. But somehow I am feeling good. I am feeling that I'm okay. I said, how come like you have pain? He said, I don't know. It is a very strange thing. Like always with the pain, I am in pain. My head is in pain and I am in pain. But right now my head is in pain, but I am feeling more okay that no, I will become better. So and then he went on to becoming this the migraine. It was gone. So this there is a difference. This you will see the change in the energy of the patient, the way or the attitude, even in the acute cases. I simply in the acute cases I ask the patient that how are you? How are you feeling? If they say better, even the symptoms are not better, if they say better, then it is good. If they say that then I'm not better and he is not also looking better, then the medicine is wrong. Because the first thing the patient will start telling you is that I'm feeling better. Although the symptoms being there, within few minutes, they will start saying that I am better. This slight homeopathic aggravation during the first hours a very good prognostic that the acute disease will most probably yield to the first dose. So it is a very good prognostic stage, the slight homeopathic aggravation, but it has to be very slight. Is quite as it ought to be, as the medicinal disease must naturally be somewhat stronger than the malady to be cured if it is to overpower and extinguish the later. So we come to know that with the first dose, now the disease will yield, although it was a very strong disease. But we know that my medicine is stronger because of this slight homeopathic aggravation, that my disease is stronger than the natural disease. So it will annihilate, it will completely cure the natural disease. Just as a natural disease can remove and annihilate another one similar to it only when it is stronger than the later. So this is the application of that therapeutic law of cure which we read in the initial aphorisms of the organon. So this is that practical application of it, that how we know that now my medicinal disease is stronger by this slight homeopathic aggravation. So many always tell the patient that after the dose, even if you are having, the symptom they are increasing or this thing, let me know if they are decreasing or increasing after the dose. Let me know about it. Whenever you come or in the acute disease, just let me know after an hour or 2 hours how it is. So from there you can get an idea that whether your medicine has acted and the medicine is right and it is stronger than the natural disease. The smaller the dose of the homeopathic remedy is, so much the slighter and shorter is the apparent increase of the disease during the first hours. So again, very clear this thing, you know, that the more smaller the dose is, the more shorter and slighter will be the aggravation in the first hours of the disease. So now, how much smaller the disease, whether there is some part of the dose, like is there any quantity, like if I go smaller, and then comes a point that it becomes weaker than the natural disease? Is that it? Is there something like this? that the homeopathic dose becomes so small that it becomes weaker than the disease, and even though being the right, it will not work. So this question also comes in the mind, that how small the dose is. So we'll try to discuss it next time, because the answer is in the next aphorisms, that when is the dose too small that it will not act. Although there is a hint that, this never happens. This never happens, that the dose can be so small that it can be weaker than the natural disease, although being right. But we'll talk in detail why it happens. Well, that the dose can, if we are talking about the smallness or the minuteness of the dose, then there has to come a level, because in our material mind, the dose is a material part. When you keep decreasing it, then there has to come a point when it is not sufficient enough to overpower the disease, because that is with the other systems of the medicine. For example, if you are giving some metformin in 500 mg to a patient of this diabetic patient, and he's going better, and if you decrease the dose, like you come down to 250, you come down to metformin 100, then the disease will increase. It will not be stronger than the disease which is present there. So that material notion is there in mind, and this question always comes, that how small, like this is the point and we should not go below this. So how small? So we will talk about it in the next uh, lecture, when we will talk about in the next week. So again, if there are any questions, you can, I think there is something in the chat, let me see. Antitype. What is antitype? Okay. Antitype is basically constitutional homeopathic medicine. So Dr. Hahnemann has used that word antitype for it. So any other questions? If there are, you can send the question and we can talk about those questions. We can do this. And always, like I always say, that please go back and give a reading to the, because we are not doing many aphorisms. We are just doing 4 aphorisms. If the aphorisms are small, it may go to 6 or 7, but if they're large, we'll, so during the rest of the 6 days, just read one aphorism one day. And because once you get an idea about what is written to it, the link will settle down. The aphorisms are like I told you, that they're like stairs. We have to go every stair up, and we have to understand it, so that we can go to next stair. We cannot skip the stairs, we cannot jump to the last stair. So we have to go, place our foot on each stair, so that we can climb effectively. So similarly with the aphorisms, every aphorism is a stair, and we have to understand that stair, so that we can understand the next part. So they are all linked. They are all linked with each other. So we cannot. That is why organon cannot be read or understood randomly. Like randomly, some aphorism comes up, and I tell you, and this thing, without the, that what is the concept going on? What is the context behind this aphorism? It has to be attached with the other things. So during the whole week, just had just, because we have to understand. So just read one aphorism, try to understand the meaning, and if there is something which, the questions they come up, then we can discuss those questions, because the questions will also come up when you give it a reading. Then there will be some question, that why not, why this, why that. So many times when the questions are not there, I think either I am telling it very eloquently or beautifully, or I am not, sometimes these things come, that, okay, I am not able to take the message. So whatever. But the meaning is that, that just you yourself also go and give it a reading, the organon. That way it will come more, it will be more understandable, and you will go more deep into the understanding of the organon. So with that, I will take your leave. Thank you and have a very good night. Thank you. So I hope all of you had a very good new year. A few days back, Dr. Arin, he asked me some questions regarding the potency and dosage. So I told him that we will be discussing it today. But Doctor, I would like to tell Dr. Arin that we have put that thing into the topic of the workshop in the Thailand this time. So we will discuss in detail because it is a question of many doctors who wanted me to talk about this dosage and potency, that where how we should give it. So it would be better that if we discuss it in front of everyone. So we will discuss it in the this year's workshop in February. So there we will discuss it in detail. So we will continue with the organon. We have done till aphorism 148 last time. So we will continue with aphorism 149. So from here on, we will start going more deep into how to analyze the cases, what we should do in what kind of cases. Those aphorisms they will start from this point onwards. So we'll start with aphorism 149. So aphorism 149. When the suitable homeopathic remedy has been thus selected and rightly employed, the acute disease we wish to cure, even though it be of a grave character and tended by many suffering, subsides insensibly in a few hours, if it be of recent date. So when a suitable homeopathic remedy is selected, a remedy which is homeopathic by character, by nature, which fits the whole case, which covers the totality of all the characteristic symptoms, when that remedy is selected, then and when it is given, any acute disease, even of the grave character, any kind of acute emergency also, if it is of a very grave character, that remedy will start will it will subside, it will get better within few hours if it is of recent origin, in a few days if it be of a somewhat longer standing. If it is of somewhat longer standing, like few months or 15 days or 20 days back some problem started, then in few days it will become better, along with all traces of indisposition. There will be no indisposition, no symptom which will be left behind. All the parts where the disease was there, everything will go away. And nothing or almost nothing more of the artificial medicinal disease is perceived. And even when the cure is done, any traces of artificial medicinal disease, the disease which was produced by the homeopathic medicine, that will also not remain there. There occurs by rapid, imperceptible transitions, nothing but restored health and recovery. So, disease of long standing and especially such as are of the complicated character require for their cure a proportionately longer time. So, if the diseases are of longer standing, there is some complications to the disease, they will require more longer time. More especially to the chronic medicinal dyscrasia so often produced by the allopathic bungling. So that is why many times in many cases when some medicines are going along, like someone is taking some medicine for the diabetes from a long time, or some hypertension remedies, or some remedies for correction of the hormones, in those cases it will take more longer times. Then those cases where the medicines are not going on, the patient is not taking any other medications. So when because there is a medicinal disease also which is running along, and with the passage of time it becomes more conjoined. Many times in the patients who have been taking insulin from a long time, because of the effect of the insulin, the glucagon also starts becoming low, the another hormone. And in that cases you will see these episodes of hyperglycemia. So those hypoglycemic attacks in many cases of insulin dependent diabetes are because of the long this taking of insulin. So the suddenly this blood sugar will suddenly drop low. So in such cases, in those medicinal dyscrasias and those medicinal diseases where the disease is basically now become more complicated with the natural disease, it require a much longer time for their recovery. Often indeed are they incurable in consequence of the shameful robbery of the patient's strength and juices, the principal feat performed by the allopathy in its so-called methods of treatment. And he's saying that in such cases, if the patient is completely devoid of the vitality, there is no energy left, and there are so many things going on, in those cases sometimes he goes to the extent of saying that these diseases or these conditions may become incurable. Dr. Hahnemann in whole organon, whenever he's talking about the natural diseases, the diseases which are occurring naturally and are not, they have not been none of the bungling is done. They are not complicated. Dr. Hahnemann has never written that they are not incurable. He's saying that you can cure the patient for the whole of the disease can go from the patient's existence, from his system, from his body. But only few times he has used these words incurable, and only in context to this thing, in context to when the medicinal disease is also mixed or complicated with the natural disease. Only in those cases, only in those parts, whenever he's talking about this thing, he uses this word that sometimes these things they become incurable. Footnote to aphorism 149. But this laborious, uh, sometimes very laborious search for the selection of homeopathic remedy most suitable. Last time also when we stopped at 148, I told you that 149 is a more of an emotional uh, aphorism, because Dr. Hahnemann during his time he has felt so many things. He 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 was a very conscientious person. He worked very conscientiously on the things. For him, like I was talking last time also, that these words were coming not out of anger but out of the sympathy, out of the compassion which he had for the sick human beings, for the sick humanity. He had this compassion towards them. And because of that compassion, he felt this need to say these things which he is going to say, which he is saying in these aphorism and footnote. But this laborious, sometimes very laborious search for a selection of the homeopathic remedy most suitable in every respect to each morbid state is an operation which, notwithstanding all the admirable books for facilitating it, still demands the study of the original sources themselves. He's saying that there are many admirable books. There are books which are written on these topics nowadays by the doctors, but this is a very laborious task, finding the right remedy. It is a labor which a physician has to do. Interrogate the case, investigate the case, take out the symptoms, then choose which are the characteristics. Are there any other things to that thing? You have to see, what is the natural disease, how the phenomena is going on. You have to see so many things. So you say that it is a very laborious task. Still demand the study of the original sources themselves, the provings. The original sources are the provings. So it also demands the study of the original sources, and at the same time a great amount of circumspection and serious deliberation, which have their best reward in the consciousness of having faithfully discharged our duty. And it also requires very circumspection, that I am there has to be this sense along with doing your duty, we have to have this sense that I'm not doing anything wrong. The procedure which I have known, the things which I know, I'm not going out of those things, and this duty has to be discharged very faithfully. How could this laborious, care demanding task, by which alone the best way of curing disease is rendered possible? He's saying that this is the best way of curing the diseases. This is the best way of curing the patients. It requires faithfulness, it requires labor, it requires a conscientiousness in them. Please the gentlemen of the new mongrel sect, who assume the honorable name of homeopathists and even seem to employ medicines in form and appearance homeopathic, but determined upon by them anyhow, quid in bucum venit, and who, when the unsuitable remedy does not immediately give relief, in place of laying the blame on their unpardonable ignorance and laxity in performing the most important and serious of all human affairs, ascribe it to homeopathy. So he has given the name to these kind of physicians, a new mongrel sect. Mongrel sect is basically cross-bred dogs. The dogs which don't belong to the original breed, but they are of two different breeds. So they are called the mongrel sect. So Dr. Hahnemann in this footnote, he basically gives the example or basically relates them to those kind of crossbreeds, whom he says that they have taken the name, honorable name of a homeopathist, that I am a homeopath. And they also give the medicines which appear homeopathic. They are not homeopathic because for homeopathic it has to be similar. But they have the appearance of homeopathic medicines, the way they employ them. But if those medicines do not give relief to the patient, then rather than taking the blame on their knowledge or on their ignorance, or that they have not faithfully discharged their duty, they put all this blame on the homeopathy, that homeopathy does not work in these cases. Many times I have, you know, asked the students, they are told by many teachers or that the homeopathy does not work in the gallstones, it does not work in some cerebral cases, it does not work in that or this. So he's talking about the physicians who are basically taking the name of homeopathy, but basically blaming. He was more concerned with the blame on the homeopathy. See, it was his discovery, but he also had this thing in mind, like, he said that from my experience, I can say that homeopathy works. I have seen all kind of cases getting better with homeopathy. So if pulsatilla can work in the hands of one physician and does not work in the hand of the other physician, then the pulsatilla or the homeopathic medicine or the homeopathic system is not to be blamed. The blame lies on the knowledge of the physician, which they accuse, which they accuse of great imperfection. And moreover, they would say that there are many imperfections in this science. If the truth be told, its imperfection consists in this, that the most suitable homeopathic remedy for each morbid condition does not spontaneously fly into their mouths like roasted pigeons without any trouble on their part. So he's saying that only imperfection which lies in homeopathy is that it does not give medicine automatically to those people who does not want to work, like they don't want to um, do this laborious task, they don't want to put their effort in it, they just want that somehow, like a roasted pigeon, some food item, it should come and fly and go into their mouth. So they know, however, from frequent practice, how to make up for the inefficiency of the scarcely half homeopathic remedy by the employment of allopathic means. So he's saying that the homeopathic remedy which they have given is not simillimum. It is not similar to the case. That is why it is not working. So then they blame the homeopathy, the system, tell about its imperfections, and then give an allopathic remedy for the work which they were not able to do. the labor which they were not able to put in, that come much more handy to them, among which one or more dozens of leeches applied to the affected part, or little harmless venisections to the extent of 8 ounces, and so forth, play an important part. So they will apply leeches, or they would do venisections, like cut and let the blood come out, and they will say that it is a harmless venesection, there will be no harm, even if they are taking 8 ounces of the blood from that particular person. Should the patient, in spite of all this, recover, they extol their venisections, leeches, etc., alleging that had it not been for these, the patient would not have been pulled through. And they give us to understand in no doubtful language that these operations, derived without much exercise of genius from the pernicious routine of the old school, in reality contributed the best share towards the cure. And if the patient pulls out, if he recovers in spite of all this thing, then they will say that it is because of the venisections and leeches. If we would have not done this, then the patient would have been dead. But if the patient die under the treatment, as not unfrequently happens, means frequently happens. Now if the patient dies, which frequently happens with this thing, they seek to console the friends by saying that they themselves were witness that everything conceivable had been done for the lamented deceased. Who would do this frivolous and pernicious tribe the honor to call them after the name of the very laborious but salutary art, homeopathic physicians? They say if the patient dies, then they will tell the friends or the family that they themselves have seen that everything which could be done have been done. So Dr. Honeyman is saying that how these people, they can call themselves homeopathic physicians. What kind of, they are doing this thing very carelessly, very frivolously, and this is basically hurting the patients, and still they have this guts, still they have this honor in them that they will call themselves homeopathic physicians. May the just recompense wait them, that when taken ill, they may be treated in the same manner. So it is more like a curse, or but it is a way of the nature, way of the universe, that whatever you sow, you will reap the same thing. So he's saying that whenever they get sick, let the recompense, the justice wait for them, and they should be treated in the same way as they have been treating their patients. So the thing to take from this aphorism, the thing to take from this particular footnote, is how religiously the duty or the work should be done, especially when someone is basically putting the most worthful thing, most most important thing, the health or the life of oneself, into your hands. I see it is many times we do not get the right remedy on the first meeting, second, third, fourth. It is okay, that is a different thing. That that just tells us that we don't know yet the level of the education, or the level of the knowledge which we should have, that is not there. That is okay, that is okay. But once we say that we are homeopaths, once we say that I'm a physician, I should adhere to the basic meaning of being a physician. I should adhere to the basic task of being a homeopath. With 100% of my knowledge and the things I know, I should perform in that way. Yes, I would strive. We should strive that we should become more knowledgeable. We should know more. Will study more. We will have more experiences, and then, go with those things. But the basic thing, this whole thing, this is not a part of being homeopath. Dr. Vijayakar, he used to say that the limit and the scope of homeopathy is homeopath himself, the knowledge of the homeopath. What you can cure depends upon our knowledge, what we can cure. depends upon how deeply we have understood our subject, how deeply we have understood our principles, how deeply and how much conviction, how much belief we have in this thing. Because once you start believing in it, once you start seeing patients getting better in front of you, then there is nothing left that you cannot believe. There is nothing left, because experience is the most prime thing. And once that has happened with you, then even then if you go back and say that it, then that is what he's talking about here. That once you have experienced what, once you have done it, once you have known it, that these things can be done, and then you are unjustly, from any kind of selfish reasons, if we are doing that, then he has given the name of the new mongrel sect to such homeopaths. If a patient complain of one or more trivial symptoms that have been only observed a short time previously, the physician should not regard this as a fully developed disease that requires serious medical aid. A slight alteration in the diet and regimen will usually suffice suffice to dispel such an indisposition. So if there are some trivial symptoms, very small, in the morning I had this some flu like symptoms for hardly 15-20 minutes. So those are trivial symptoms because of the cold weather, because of from get going from a he, uh, hot room towards the external surroundings of the cold, you can have some trivial symptoms, but that is not a fully developed disease, neither acute neither chronic. So that does not require any kind of medical aid, no medicine should be given for that. Only just an alteration in diet and the regimen and something in the routine will basically cure that indisposition. We call those things as indispositions. The things which don't require medicine, even if the patient is little anxious about it, we can give placebo to them. But if the patient complain of a few violent sufferings, the physician will usually find on investigation several other symptoms besides, although of a slighter character, which furnish a complete picture of the disease. But if there are some violent sufferings, there is some cough which is going on, and you can see, you can hear that the patient is suffering, then that requires our medical attention. That requires that we give a medicine to the patient. But when we are going to give the medicine for that suffering, when we go for the case taking, we will find that there are many other symptoms which are although slight character, but they are there. The cough is not the only thing. There might be slight fever also, there might be slight pain in the throat also. You may feel that there is a little hoarseness of the voice. There may be some characteristic about thirst, some thermal, some sweating, some generals. So when we take all these things, that will complete the picture of the disease. The worst of the acute disease is so much the more numerous and striking symptoms is it generally composed, but with so much the more certainty may a suitable remedy for it be found. He is saying that worst of the acute disease, that in acute disease, what is the worst acute disease? Where there are numerous and striking symptoms. There are so many symptoms, and all the symptoms they appear striking. It is composed of. But the good thing about this thing is that the more the striking symptoms are there, the medicine which we will select, we will be more certain that it will work. Because when all the symptoms, all the striking symptoms are covered by a suitable remedy, we are very much confirmed, we are very confident that this medicine will work for sure. If there be a sufficient number of medicines known with respect to their positive action to choose from, and if we know sufficient number of medicines, because at that time of Dr. Hahnemann, he had proved lots of medicines, but he still felt that it is not sufficient. But now we have a very big array of medicines from where we can select. Among the lists of symptoms of many medicines, it will not be difficult to find one from whose separate disease elements an antitype of curative artificial disease. So, from all that list of symptoms, we have to match them with the antitype. Antitype means basically the similar of the curative artificial disease, very like the totality of the symptoms of the natural disease. So those totality of the symptoms, all those list of symptoms of the medicines, they must match with the symptoms of the natural disease, may be constructed, and such a medicine is the desired remedy. And when we find that remedy, that is the most similar and the most desired remedy. In this search for the homeopathic specific remedy, that is to say, so now many times, this specific remedy, homeopathic specific remedy, this is taken out of the context, that in homeopathy there are specific remedies for specific diseases. No, there's a specific remedy for that condition of the disease of the patient in this specific case. That is what the specific remedy means, the homeopathic specific remedy. When he's saying homeopathic, that means a similar remedy, completely similar to the whole totality of the case. That is homeopathic, and it is specific for this particular this particular case. So when we are searching for this homeopathic specific remedy, that is to say, in this comparison of the collective symptoms of the natural disease with the list of symptoms of known medicines, in order to find among these an artificial morphic agent corresponding by similarity to the disease to be cured, the more striking, singular, uncommon, and peculiar signs and symptoms of the case of disease are chiefly and most sorely to be kept in view. Now, what kind of symptoms have to be kept in view when we are searching for the homeopathic remedy? The symptoms which are striking. I've striking means that it will strike you. Recently, few days back, a patient came, a lady. She's a tailor. She sews clothes, and she came for her problem of hypothyroidism and many other problems she had. So when her case taking was being done, during the case, she told, when we were asking about her sleep, she said that it depends. It depends upon the work. For example, I said that okay. He said that if I have done good work in that day, I have done very good work during the day, I feel that I should sleep. It is okay for me to sleep. But if I have not done good work in the day, or I have done less work during the day, I feel that she was talking that, when I have not done work, I don't deserve to sleep. Deserve to sleep. Sleep is something which is, a part of you. It comes. It is not something which you deserve or which you don't deserve. She said, if I have not done some work, I think that I don't deserve to take rest when I have not worked. What is the need for rest for me? So something strikes you. No one talks like this regarding the sleep. Okay, there might be sleepiness, there might be sleeplessness, but what it has to do with the deserving part? So it strikes you something which is peculiar, something which is strange will always strike you. And you stop, okay, let me think about it, what it is. These kind of symptoms become the characteristic symptoms. Today also there was a case of a girl who was suffering from skin disease. So she had this, the mother said that she's always hungry. Like every 15-20 minutes, she wants to eat something. But she does not eat a lot. Like she will have a cookie, or she will put some, fruit into her mouth, and she will eat a little part of the fruit. But every 15-20 minutes, she's always searching for something. Now again, if a person is obese and he is eating like this, okay, we can understand. If a person is lean and he does not eat much, okay, we call these symptoms as common symptoms. Okay, no problem. But a lean person eating like this, and it is not a very canine hunger. She does not eat a lot. Like when she's in the school, she does not do like this. But as soon as she comes home, she will be, searching for something to eat. And the whole day, if it is a holiday, the whole day goes like this. She'll be searching for something to eat. So again, this becomes very singular symptom, very uncommon thing, very peculiar thing. But every 15 to 20 minutes, she wants to eat. This is nibbling hunger. We have a rubric appetite nibbling. They just want to nibble. It is not hunger. It is more of an appetite that needs to be uh, appeased after every few minutes, after 15 minutes, 20 minutes. They just want to appease that appetite. So these kind of signs and symptoms, when they come, along with the other characteristic signs and symptoms, along with the other things, they basically tells us about that they are very helpful in the search for homeopathic specific remedy. So that I always say this thing, when you are going through the case, always have this thing in the mind that I am looking for things which are uncommon, which are peculiar, which are striking, which are singular. And if something like this comes to me, I will stop there. I will put it down uh, separately in a separate part in my case, and I will think about it when I have to analyze the remedy, when I have to find the homeopathic remedy, are chiefly and most solely to be kept in view. So they are the chief entry points to a case. They are kind of indicative points to for some remedies, these kind of points. For it is more particularly these that very similar ones in the list of symptoms of the selected medicine must correspond to. And these symptoms are the symptoms which the selected medicine should contain in order to constitute it the most suitable for affecting the cure. The more general and undefined symptoms, the loss of appetite, headache, debility, restless sleep, discomfort, and so forth, demand but little attention when of that vague and indefinite character. When the symptoms are of vague character, very commonly found with most of the diseases, and they don't have any kind of characteristic about them, then they don't demand much attention. If they cannot be more accurately described, as symptoms of such a general nature are observed in almost every disease and from almost every drug. So these kind of common symptoms, they are found, these general symptoms, they are very frequently found. This weakness, this debility, this loss of appetite, sleeplessness, some kind of pains, they are very commonly found in most of the diseases until and unless they are characterized. They don't hold any value. Footnote to aphorism 153. Dr. Wong Bohingason, who has already distinguished himself by his labors in connection with the new system of medicine, has lately increased our obligation to him by the publication of his important little book setting forth the characteristic symptoms, more particularly of the antisoric medicines, entitled this thing, the appendix thereto containing the antisyphilitic and the antipsychotic medicines at the end of the second edition of his the repertory. So here Dr. Hahnemann is basically thanking Dr. Boeing Hassan for creating this repertory, and the word repertory was not yet given to it. Dr. Hahnemann has used the word the appendix. Very important word to understand, because nowadays the repertory has become more important than the materia medica. I have many times the doctors, they would say, okay, what rubric you have taken. But Dr. Hahnemann, he just, even Dr. Boeing Hassan, who created the repertory, who made repertory, but he had said that this is an appendix to the materia medica. Appendix is, for example, in the last part of the majorly the books, the big books, there is an appendix where there are keywords along with the page number. There are keywords along with the page number, that the information about this keyword is given at that page, or given in that page. So the rubrics, they are like the keywords, and the remedies, they are like the page numbers. The keyword of mildness, okay, there is pulsatilla. So go in the materia medica of pulsatilla and read about this mildness, how, what kind of mildness is there, what kind of yielding is there. The keyword is hysterical, the page number is ignitia. That go into the materia medica and read about the hysterical part of the ignitia. see the characteristic of that hysteria, because hysteria again is a common thing, very common, but the characteristic part of the Ignatius hysteria is given in the materia medica. If that matches with the patient, then you can give ignitia. Otherwise, don't give ignitia in every hysterical case. Asafoetida has a different kind of ignitia. A gastric, sorry, has a different kind of hysteria. A gastric hysteria. In ignitia, it is more emotional hysteria. In Apis, the hysteria is different. In Pulsatilla, the hysteria is different. So this index, this appendix, is basically this meaning, that if there is disappointment from love, that is the keyword, and there are the remedies which are considered to be as the page numbers. And these remedies have this thing, but see the characteristic, how it is developed. Go to the repertory, materia medica, and see it. So this reverse kind of thing, which is there, kind of understanding the medicine from the repertory. I'm not saying that it cannot be done, it can be done, but after you have a lot of experience in materia medica, then it can be done. If someone is starting to understand the remedy only from the rubric, it is not possible. Then there are chances that we will make many, many, many mistakes. Yes, but once you have a sound knowledge of natrimure, once you have a sound knowledge of sulfur, then we can go through the rubrics, what more rubrics are there in sulfur, and try to make a this conjoin it with all the things you know about the sulfur, where it fits in. Then that becomes a more of a good thing. But only going from repertory or going from the meaning of the rubric and going for that is not I I don't think that is not the right way to learn homeopathy or learn materia medica. So today we will stop at aphorism 153. Next time we will continue from aphorism 154. So I always give importance to how we should study. What is the best way to study? And that is why this organon, it helps you to understand how you have to go into the analysis of cases, also what is more important to take in the case, but also how you have to approach your materia medicas. That is very important. How to understand the materia medica, how to approach the materia medica. So with that, I will take your leave for today. Thank you. Thank you very much. Please go through these aphorisms once again. And if you find any thing which is not proper in understanding, we can discuss. You can send the questions and we can discuss it. And again, the topic of dosage and potency, we will take it in the workshop in Thailand, which will start, I think, from 15th of February. We will take it there so that every doctor, all the doctors who are there, they can go through that. So we'll be starting with aphorism 160. But as the dose of a homeopathic remedy can scarcely ever be made so small that it shall not be able to relieve, overpower, indeed completely cure and annihilate the uncomplicated natural disease of not long standing that is analogous to it, we can understand why a dose of an appropriate homeopathic medicine, not the very smallest possible. So we have to give a small dose, but homeopathic medicine or the dose of a homeopathic remedy can never be made so small that it will not work. Means it will never be basically less than the power which it can exert on the human organism. So in these aphorisms, like when we are talking about homeopathic aggravation, there are many theorists why I'm giving the word theorist, because that idea cannot be put actually into motion, because it cannot be seen, that process cannot be seen. So when Dr. Hahnemann is saying that there is a power of disease and then there is a power of medicine, so according to the therapeutic of law of nature, the medicinal power should be always above the disease power. So then there are some theorists who basically started arguing at the time of Dr. Hahnemann, even till day they are arguing that let's make a homeopathic medicine so dilute, so small, so small that its power almost matches with the power of the disease or even goes below it, so that it does not produce, if it goes below, it cannot work according to the theory. But if it is just similar, then maybe there is no homeopathic aggravation. The first point against these kind of theories is that if they are similar, then they will not act, because again there is a third this point in that therapeutic, that if they are of same power, then and similar also, they will not do anything, they won't do anything. It has to be higher than this. So the next thing is that homeopathic medicine, even if you keep diluting it, whatever you do, the dynamic nature, because I have discussed this earlier also, that the quantum or the quantum physics or the dynamism does not work like a material world. If we start putting the material concepts, like for example, if I have some drink, some sweet drink which is too strong, I'll add some water to dilute it. So that means the power of sweetness, it has decreased. That is in the material world. That is the law of material world. But the same thing does not go, or the same thing does not apply to the quantums or the energy world. The physics there is completely different. Whatever comes in contact with that quant, it starts gaining the quality of that quant. It is not a quantitative thing. The energy part is not a quantitative thing, it is more of a qualitative thing. I have given earlier also an example that if you go and sit near a sad person, if you even if you are a very happy person and you sit near a person who is sad, who is in melancholy, you start sitting with him, you know you you start getting that quality of that person. It is not about the quantity. He, even if you are getting sad, his sadness is not decreasing. There is no material shift. If I put in the material world, in the Newtonian physics, if I put one thing from here to there, then here the quantity decreases and here the quantity it increases. But that does not happen in the quant. Even if you are having this sadness, if you are taking that sadness, that person's sadness is not decreasing. It might be increasing. It might be at the same, but it will not decrease. So it is more of a shift of the quality in the quant or in the energy world, in the energy field. But the same does not happen in the. So thinking about the dynamism from the part of mechanical physics, that is a very wrong way to see it. So that is what the theorists do. So to counter that thing, Dr. Hahnemann is saying, because in experience also, whatever you do, even in the, there will be coming aphorisms around 275, 280, where Dr. Hahnemann will say that even if you are diluting it, you are basically the energy of the medicine after dilution, it increases, it does not decrease. So don't think that if you are diluting it or if you are giving in water, then it will decrease. No, on contrary, it will have more parts to be affected. The surface area, it will increase. So the homeopathic medicine can never be made that small that it does not affect. The first thing is this. So whenever it will affect, it will have an appropriate homeopathic aggravation. So that is what is being told in this aphorism 160. We can understand by a dose of an appropriate homeopathic medicine, but it will produce this homeopathic aggravation only when it is appropriately homeopathic, means when it is a similima, then only it will affect in this way. Not the very smallest possible, does always during the first hours after its ingestion, produce a perceptible homeopathic aggravation of this kind. So just few hours after the ingestion, it starts showing these homeopathic aggravations, this increase in the symptoms. In chronic disease, it may take some days. It can start on the same day. It can start on the next day. It can start after few days in chronic diseases. In acute diseases, it starts on the same within few hours, within the same hour when it is given. You will see slight homeopathic aggravation which is perceptible to a person who has good senses, and he also knows that this might happen. So footnote to aphorism 160: this exaltation of the medicinal symptoms over those disease symptoms analogous to them, which looks like an aggravation, has been observed by other physicians also. So Dr. Hahnemann is saying that these symptoms, this medicinal aggravation of certain symptoms, it has been seen by other examiners also, other physicians also. That he is saying that I'm not the only one who has seen this thing. Other physicians have also seen. They might not be able to apprehend or comprehend it basically, that why this has happened, but they have noted this thing in their journals, in their whatever the essays or this thing they have submitted, published. Has been observed by other physicians also, when by accident they employed a homeopathic remedy. What happened? That they employed a homeopathic remedy by accident. For example, when a patient suffering from itch complains of an increase of eruption after sulfur, his physician, who knows not the cause of this, consoles him with the assurance that the itch must first come out properly before it can be cured. So, uh, one of the physician, when he gave sulfur to a patient who might have had this eruption like sulfur, and when he received this medicine sulfur, the itch increased. There was increase in the eruption, and the physician, he did not know why this happened. So he had to console him. He had to give a logic that it has to first come out before it can be properly cured or properly gone. He knows not, however, that this is a sulfur eruption that assumes the appearance of an increase of the itch. The facial eruption, which the viola tricolor cured, was aggravated by it as the commencement of its action, Leroy tells. So similarly, there was this physician Leroy who told that this facial eruption, which has a peculiar kind of a facial eruption, which was basically similar to the eruptions of viola tricolor. So when this remedy was given, it aggravated. But he knew not that the apparent aggravation was owing to the somewhat too large dose of the remedy, which in this instance was to a certain extent homeopathic. So the remedy, it was given in large dose, and the medicine was homeopathic. The the thing with the dose is, the more large you give the dose, and if it is a homeopathic remedy by chance, then the aggravation will be severe. The more stronger dose, the more severe the aggravation will be. License says in some of the journal, there's another physician Lyson who said the bark of the elm cures most certainly those skin diseases which it increases at the beginning of its action. So he went a step forward than the previous physicians, where he says that this is a kind of sign that the bark of elm, it cures most certainly those diseases where you always see that increase in the beginning of the action. So he came to this point that bark of elm may uh, give relief to in other ailments or other skin diseases, but where in the beginning it increases the disease, it is most surely that it will cure that skin disease. Had he not given the bark in the monstrous doses usual in the allopathic system, but in quite small doses requisite when the medicine shows similarity of symptoms, that is to say, when it is used homeopathically, he would have effected a cure without or almost without seeing this apparent increase of the disease. So he said that if he has given in a very, very, very small dose, so he could have affected the cure even without or almost without seeing this apparent increase. Many times this homeopathic aggravation, it is too transient to even The patient does not much complain about it. The physician, if he's not a very good observer, will even not know about it, this kind of homeopathic aggravation, because of the smallness of the dose. Right remedy, homeopathic remedy, and a small dose, and you will not see those kind of homeopathic aggravation, because many times we think that 1 m or the potency, the 10 m, if we give them, then that will cause the aggravation. You will see when we will go through the whole organon, that nowhere Dr. Hahnemann has written this word that the increase in the potency might give you a bad homeopathic aggravation. Because this is a concept which has been going, many physicians, many good physicians, they have refrained from giving higher potencies because of this thing. I don't know from where it came, that if you give a higher potency, then the homeopathic aggravation will happen. If you give large dose, if you give multiple doses of any potency, the homeopathic aggravation will come. It is about the dose. If we give, for example, 10 drops of the dilution to someone, it's a too strong a dose. We are advised, that one drop of a homeopathic drop, one drop, it can basically medicate 500 small 10 number globules, one drop. And out of that, we have to give one or two pills. you know so you know if you give 10 drops, then it is around 2 2500 times more stronger than the smallest dose which basically is advised. 2500 times stronger. So then that homeopathic aggravation which will be caused, then you either give 30 or 200 or 1 m or 10 m, that will be the homeopathic aggravation which will be too much for the patient. If we are giving in crude form, in mother tinctures or some, then also, because it is too crude form for the patient, too large a dose. So in those cases, you know so then the physicians who have seen some kind of, rather than decreasing the dose, they start decreasing the potency, keep increasing the repetition and start decreasing the potency, but that does not solve what homeopathic medicine is meant to solve. Because the more we decrease the potency, we cannot invade in the deeper part of the bodies. We cannot go up level. It will be very superficial potency, acting very superficial in the whole economy. So we have to understand this. Yes, homeopathic aggravation is good symptom, but it is a symptom which will be very, very small. I have already that it might be aggravation of the symptom, but the patient starts getting better as a whole. His journals will improve, his general outlook to the things will start improving. So whenever there is a strong homeopathic aggravation, always look whether the dose was large or not, rather than the potency. So aphorism 161. When I hear limit the so-called homeopathic aggravation, or rather the primary action of the homeopathic medicine that seems to increase somewhat the symptoms of the original disease to the first or few first hours, that is certainly true with respect to disease of a more acute character and of recent origin. So because in the last aphorism, Dr. Hahnemann has told that this aggravation will be for first few hours. So in that context, he is basically giving the next part, that when I'm saying for first or few first hours, it is basically in the cases of acute diseases which are of recent origin. This is certainly true with respect to diseases of a more acute character and of recent origin, but where medicines of long action have a malady of considerable or of very long standing, where one dose consequently must act for many days. We then occasionally see during the first 6, 8, or 10 days the occurrence of some such primary actions of the medicines, some such apparent increase of the symptoms of the original disease lasting for 1 or several hours, whilst in the intervening hours amelioration of the whole malady is perceptible. So he's saying that when I'm talking about the first few hours, I am talking about the cases which are acute and are of recent origin. But in the chronic cases, which have been there from long time, in those cases, when one dose is given and we let it to act for days, then we see that on the first 6, 8 or 10 day, even, you know, you can go more, sometimes 12, 15 days also, depending upon how long the disease is, what kind of treatment the patient has been taking. This action, the symptoms of the this increase in the symptoms, it is seen, for few hours in the days, but in the time of the day when it is not aggravated, they will feel much better in the general part. This is what, I was talking about. I have given few examples when we have talked about this homeopathic aggravation last time also, that there was this patient who had increase in the headache, symptoms of pain in the head. But he said that I am feeling better because that headache or that heaviness of the headache was for few hours in a day, for few minutes in a day. But in the general, the other part, when he was not having headache, he felt better. Generally, commonly, the feeling, the first thing is, even Dr. Kent writes that the first change which you will start, even Dr. Hahnemann in the coming aphorisms, when we go into that, I will point out at that time that the first change you will see is in the mental part, in the disposition of the patient. They start feeling better. Many times the patient cannot tell you when the remedy is right, and they are going through the aggravation part, physical aggravation part. They cannot tell you what is right, but they will say that I am feeling better. Symptoms are there, everything is there. I will not say that it has gone, but I am feeling better. This is a very common statement which is given by the patients in the clinic, that I am feeling better. So that is a sign for you. Many things in their demeanor, many things which they used to worry about, they stop worrying about those things. Many times they might not notice, but that when the worrying goes away, when those kind of, some unnecessary negative emotions go away, the patient automatically starts feeling better. So after the lapse of these few days, the amelioration resulting from such primary action of the medicine proceeds almost uninterruptedly for several days longer. So once this few days, this aggravation has gone on of some symptoms for some part during the day, when it has gone away, those aggravation has gone away, the amelioration is more continuous. It goes uninterruptedly for very, very long days. In many cases, I have seen for many months, it keeps on going. Even I gave the example of one lady in the recent Thailand workshop, that I saw her after 2 years. Someone would come to the clinic, take the medicine, and she would keep taking it. Medicine means it was SL. So, not even repeated one dose for past one. I think the patient suffered from rheumatoid arthritis. So even, like, the amelioration is going on. Once a patient is well, the amelioration keeps going on. Footnote to aphorism 161. If the action of those medicine to which the longest duration of action is proper quickly expires in acute diseases. Now, this is another part about the homeopathic aggravation, that many times we think that, for example, sulfur has a very long duration of action because it is a polycrest remedy. It has a deep action and very prolonged action. So we think that, okay, if we give sulfur in an acute disease, because there are kind of practices. Dr. Hahnemann, I always say that he was a man who had a very, who was beyond his time, who thinked in a way which was beyond in his time, and he had answered all those questions, all those ways of practicing which people started doing, which was wrong, and he told in the aphorism that this would happen and it will be wrong, don't do this thing. People still did it, people keep doing it. Now the similar thing, the materia medica was divided into acute remedies and chronic remedies. It was divided. Now these remedies can only be acute because they have a short duration of action. These remedies can only be chronic because they have a long duration of action. So the materia medica was divided. So it happened afterwards, after Dr. Hahnemann. If those doctors have given some thought to this footnote to aphorism 161, they would not have done this thing. But just to ease the way of prescribing, that in acute, just think about this remedies. In chronic, just think about this remedies. Just to ease the way, they just did this thing. So here Dr. Hahnemann is saying even those medicine who have longest duration of action is proper quickly expires in the diseases. But even in the acute disease, if a sulfur is given, its action will quickly expire. It will not give a prolonged aggravation because it is a longer period of action. That prolonged aggravation will not be given. It will act in the same way because right now the sulfur is acting on the acute disease, only on the acute symptoms which the body has recently presented. So the same sulfur will be acting as a acute medicine with a smaller action. And if you give aconite in a chronic disease, like I discussed a case of urticaria of a middle-aged man who had this urticaria from past 7 or 8 years, and maybe next time when because we will be going for the materia medica part more in the future. So next time maybe we will talk about the aconite in the chronic part, how to recognize the aconite in the chronic part. Okay, so when given in a chronic case, it acted like a chronic disease. It's I gave I have that case with me. I will show that case also. I will show the prescription part, that when I gave aconite, I did not repeat it aconite for 3 months. Although in our mind, we have this aconite has a very short action. Yeah, in acute cases may be seen that you need to give aconite twice or thrice, but that basically depends upon the violence of the disease. That depends upon how powerful the disease is. Or if you are giving a low potency where a high potency is required, then you might have to repeat it again and again. So it is better to give the patient the required potency. But the same medicine, in my experience, it has worked for 3 months. Even then, afterwards, because some old symptoms came up, that was the need the aconite was repeated again. So similarly, Dr. Hahnemann is saying that if the action of those medicines to which the longest duration of action is proper quickly expires in acute diseases, the action will be of shorter nature. It will quickly expire. Most quickly in those that are most acute. The most acute the disease of more recent origin, the more quickly the primary action of the remedy will expire. It is proportionately long lasting in chronic diseases, and the same medicine will have a more longer action in the chronic diseases which are of psoric origin, and hence it happens that the anti-psoric medicines often do not show any such homeopathic aggravation in the first hours, while they do so later and during various hours for the first 8 or 10 days. So the same medicine, sulfur, who has shown very quickly the reaction, or sorry, the action in first few hours in an acute disease, might not show for many days that reaction in a disease which is of chronic nature. So even the action of the same remedy, it basically depends upon the what kind of ailment is going on. I will not use the word disease because then disease we relate with the name of the disease. But whether it is chronic or whether it is acute, so we have to understand that the same medicine may have very quicker action when the disease is acute, and a prolonged or a delayed action when the disease is chronic. So we have to wait. Just because sulfur gave very quick relief in an acute case or in an acute episode, do not expect the same thing of the sulfur in a very strong, very chronic case, a case which is 30 years old, 40 years old. Don't expect the sulfur to do the same within few hours or within few days. It might even take 1 or 2 months in some cases where the disease is more rigid. There is so lack of reaction in the body. The sulfur will also take some time to react. I'm just giving an example of sulfur. It is not about sulfur, it can be any medicine. So sometimes happens, owing to the moderate number of medicines yet known with respect to their true pure action, that but a portion of the symptoms of the disease under treatment are to be met within the list of symptoms of the most appropriate medicine. Consequently, this imperfect medicinal morphic agent must be employed for lack of a more perfect one. So this fifth aphorism of Organon, it came out in I think 1833. So whatever Dr. Hahnemann is writing, he's writing in that part of the time, in that part of concept of the time. You know, it is transpiring at that time, whatever he is writing. So I think around 1833, because I was making a list today in the Materia Medica Pura also and the chronic diseases. I think he had 70 to 80 remedies with him. Okay? So he was having only those 70 to 80 remedies to give from. So he's writing this aphorism at that time that sometimes happens owing to the moderate number of medicines. He knew that I don't have a very wide array of medicines with me. There are so many medicines which are yet to be proved. So I don't have that much medicines with me right now. So owing to that fact, yet known with the respect to their true pure action, that but a portion of the symptoms. So what happened is, he's saying that sometimes only a portion of the disease or the portion of the symptoms of a patient who is we have to treat, you can only find a remedy which basically matches the portion, which is just similar to some portion of the symptoms, not to the whole malady, not to the all characteristics of the case. So consequently, we'll say that this is an imperfect medicine, but still, because we do not have more perfect one, so it is better to give this imperfect medicine to that patient. But what will happen after giving it? He also cautions us against that thing. In this case, we cannot indeed expect from this medicine a complete untroubled cure. He's saying that such a medicine will never give you a complete cure and it will not be untroubled. Means don't expect aphorism 2 that it will be a gentle cure, it will be a permanent cure, or it will be a cure where the patient might not be bothered somewhat. For during its use, some symptoms appear which are not previously observable in the disease. Because when such a medicine means a remedy which is partially similar to a part. Okay. So now this will be a learning in understanding when we have given a medicine, whether it is a simillimum or partially simillimum. Okay. So we'll get to that part. So what will happen is, for during its use, some symptoms appear which are not previously observable in the disease. So there will be coming of new symptoms. Some new symptoms will come. Accessory symptoms of the not perfectly appropriate remedy. So from where are these symptoms coming? Because the remedy was not perfectly appropriate, it was not perfectly simillimum. So some of the symptoms of the medicine, they are produced in the patient. This does by no means prevent a considerable part of the disease, the symptoms of the disease that resemble those of the medicine, from being eradicated by this medicine. So he's saying that although these new symptoms are coming, although the medicine is not perfectly simillimum or similar to the case, but it will cure, it will considerably remove that part of the symptom which it was similar to. Okay, it has produced some new symptoms. It has not removed completely the symptoms which were already there, but some part of the disease or some part of the symptom, some symptoms of the whole disease, they will be eradicated by this medicine, thereby establishing a fair commencement of the cure. So it will start the cure, but still this does not take place without those accessory symptoms which are, however, always moderate, then the dose of the medicine is sufficiently minute. But he said that it will never happen without the accessory symptoms, the new symptoms coming up, the symptoms of the medicine, although they will be very moderate because we have given a very small dose. But if you give a very strong dose in such a case, then those accessory symptoms will also be very strong. So another reason to give a very small dose, that even if the dose is partially similimum, not properly. So even if the some new symptoms are coming up, although there will be aggravation of the symptoms which are similimum, but then some new symptoms are also coming up, they should not be of greater strength. So to avoid that thing, we also have to give the minimum or a very minute dose. So we can add this to the another reason. So from here we come to this part that we can understand our follow up. When some new symptoms are coming up, whether they are coming from the oversensitivity of the patient, the first thing, because there also it can come in idiopathic patients. When a patient is oversensitive, he might bring out one or two symptoms of the medicine, but they subside also very quickly. In this case, the accessory symptoms that take longer to subside, or sometimes, but I have seen that some portion of them remains also. It becomes part of the, because Dr. Hahnemann will be talking about this in the coming few aphorisms. I think if possible we can talk about those aphorisms, or we will talk about them in the next time. But yes, this happens that few of the symptoms they remain also, and they start becoming a part of the disease, the original disease. So next time we have to take those symptoms also and the other symptoms from the old part, and then find a new remedy. But in his case, what he is saying is that I am doing this because I do not have the proper medicines which can basically, you know, cover the whole scenario. But nowadays, many people, again, because when I have listened to something, when I heard about some concepts which are prevailing in the homeopathic community, so I think it is my duty, according to the organon, from the point of view of the organon, to caution the doctors, the students about this thing. Many people they say that it is justified in the organon to do some zigzag method. Give medicine for one portion of the medicines. Once it is removed, then give for the another portion. Once then it is removed, then that is not given anywhere. They'll go through the aphorism. It is not given anywhere. This is the part which they take out of context. But the context or the properness is because Dr. Hahnemann has said that I do not have those many medicines which I have wanted. Otherwise, this condition would not have been there. Now, the medicine so well proved after Dr. Herring and others who had done provings, Dr. T.F. Allen, we have so big array of medicines that we should not even think about this thing, that that zigzag, that remove one portion, remove the other one, the remove the third one. We are, it might happen. I am not saying in our knowledge we might be lacking in our knowledge. I am talking about the intention. I'm not talking about someone's knowledge. There are so many cases which I have experienced, that I have given a partially similar in many cases, but that I will relate, or I will say that that is because of my knowledge. But if we are keeping an intent that this way the cure can be done, or we can give relief to the symptoms, or the patient, can I can have a control over the patient, that he should not go away, then I am talking about the intent. All through the organon, I will be talking about the intention. What kind of intention, with what kind of intention we are going into practice. So here I'm just clarifying that what kind of intention we should have. Right now we have there's so many medicines, so our intent should be to find a complete simlimum which should cure the case. And beware that if we see such kind of things happening, some accessory symptoms which are coming and remaining, we should be wary that my medicine was a partial simillimum, it was not a complete simillimum. I should go back, I should study the case again and come up with a more simillimum remedy that can cure the case. But yes, I will know that I was wrong here. I missed something. I missed something in the case. So the small number of homeopathic symptoms present in the best selected medicine is no obstacle to the cure in cases where these few medicinal symptoms are chiefly of an uncommon kind and such as are peculiarly distinctive characteristic of the disease, the cure takes place under such circumstances without any particular disturbance. So if a homeopathic symptoms, some medicine has homeopathic symptoms which are small in number, but then you have a case where it fits completely. Cure, no obstacle. So just because some homeopathic medicine has not given many symptoms, when a medicine was proved, it was not has not given many symptoms, that never becomes an obstacle to the cure. Okay, that just means that we have to find, like, sometimes when I'm telling about some remedies, like few days back we were talking about I think there was some medicine which we were talking, I it just got, I told the students who were there that when this medicine is required, no other medicine comes close to, even moving the case, because those are the medicines which have very few number of symptoms, but those symptoms are so characteristic that they are not present in any other medicine, or very few remedies contain those kind of characteristics. So just because there is a small remedy or a few number of symptoms are there, that does not become that this medicine should never be given, or it becomes an obstacle that we don't have a very big picture of the medicine. So he's saying that in the cases where there are few medicinal symptoms, but those few medicinal symptoms are of uncommon kind and have peculiarity which is characteristic of the disease. So they both match, they are both similar. The cure takes place under such circumstances without any particular disturbance. The cure will take place if you have a smaller remedy and a disease whose basically particulars, they matches, the peculiars matches with the uncommonness of this remedy. But then next part, in context to that part, if however among the symptoms of the remedy selected, but if we have selected a remedy and its symptoms are that there be none that accurately resemble the distinctive characteristic peculiar uncommon symptoms of the disease, case of disease, if the remedy corresponds to the disease only in the general vaguely described indefinite states, some nausea, some debility, headache, and so forth, and if there be among the known medicines none more homeopathically appropriate, in that case the physician cannot promise himself any immediate favorable results from the employment of this unhomeopathic medicines. So he's saying that, so the remedy which we have selected, it has nothing characteristic to the disease, but it just matches the vague symptoms which are commonly found in almost all the diseases, like nausea, some kind of weakness, some kind of headache, some kind of other aches, or some kind of lassitude in the body. So he says that a physician cannot promise himself. He should be very wary, because he will most probably he will not get any favorable result, any amelioration from this kind of unhomeopathic employment of the medicine. So such a case is, however, very rare owing to the increased number of medicines whose pure effects are now known, and the bad effects resulting from it, when they do occur, are diminished whenever a subsequent medicine of more accurate resemblance can be selected. Now, many times, it is commonly said that the homeopathic medicine cannot have bad effect. Now, this is the aphorism 166. We have to read it very carefully. Such a case is, however, very rare. So he's saying that this case, which he has described, this 165, he's saying this case is very rare because we have this increasing number of medicines now. Every day, medicines are getting proved. Even in his time, he's saying that the medicines are getting proved. So this kind of cases are becoming very rare, where we will not know about the characteristics of a remedy. We are proving the medicines, new medicines are being proved. So we are getting new characteristics of the medicines. So this case is very rare, whose pure effects are now known. So we have known the pure effects, and the bad effects resulting from it, when they do occur, are diminished whenever a subsequent medicine of more accurate resemblance can be selected. So when it is a partially simillimum and a bad effect results from it, when it is not completely accurate and a bad result, some accessory symptoms are coming. So we cannot say that the after homeopathic medicine, you know, especially if the doses are large, if we are giving even in the small doses, those bad effects can be seen, especially where the medicine is a partial simillimum. But yes, if you give a very small dose, that effect will be of a smaller character. But we should be very quick in understanding that this is somewhat wrong. New symptoms coming means something wrong is happening. So either a patient is idiosyncratic or the disease has moved to the more bigger phase. So we have to have our parameters very. This is nothing. See, this is not to create fear. It is caution. Caution should not be confused into fear, because if we don't have a parameter, if we don't have a compass to where we have to go, then we will not even know where we are going. So these kind of aphorism, they are like a north star who are basically guiding us in a moonless night, on a moonless night, where the north star is. So these aphorisms should be used or should be understood in that way, that okay, this kind of symptom if they have, okay, I should stop, at least not repeat that remedy again, because now I know that it is a partially similar, no? So don't repeat any new this remedy, but go for a remedy which can be more accurate, which can more accurately resemble the whole thing, the new symptoms also, the old symptoms also, the characteristics of all those similar complete part. So thus, if there occurred during the use of this imperfectly homeopathic remedy, first employed accessory symptoms of some moment, then in the case of acute diseases, we do not allow this first dose to exhaust its action. So he's saying that in an acute disease, if you have given a medicine, it is an imperfectly homeopathic remedy. Imperfectly homeopathic, very beautiful word. Some part of it is homeopathic, but it is imperfect, not perfectly homeopathic. Some part is homeopathic. So imperfectly homeopathic remedy, what will happen is that as soon as they start showing that accessory symptoms, we should not wait, that let the action of medicine basically be complete. We do not allow this first dose to exhaust its action nor leave the patient to the full duration of the action of the remedy. As soon as you see that these accessory symptoms have started coming up, for example, a patient was in acute stage, he didn't had any taste of mouth, normal mouth taste, and suddenly after the medicine, something might have decreased, but he started developing a saltish taste, or his bowel movements were completely normal and he suddenly started developing diarrhea, or the appetite was okay and he suddenly started getting more increased appetite. That is some symptom which is accessory. It has a new symptom, and we should not wait for it to continue, or wait for some time that let the homeopathic aggravation resolve. No, but we investigate afresh the morbid state in its now altered condition. So whatever the altered is, we have to see in this condition and add the remainder of the original symptoms to those newly developed. So the original symptoms plus this newly developed symptoms, we have to trace a picture, a new picture of the disease, and start finding a remedy, start investigating in a again new manner. Now again coming to the same part, because I try that you do not forget the context, that this is in context to the time when the remedies were less, only few remedies were there. So this is to that context. Okay, nowadays our intention should be that at least in acute this should not come. My knowledge should go up that part, that this state should not come. But yes, if it comes by lack of my knowledge, then yes, this is the path which I will choose immediately, that I will take note of the all whole symptoms and try to go for a more perfect remedy. We shall then be able much more readily to discover among the known medicines an analog to the morbid state before us, a single dose of which, if it do not entirely destroy the disease, will advance it considerably on the way to be cured. So then taking that picture, that complete picture, we have to give a medicine which is analogous to the morbid state, which is similar to the morbid state among the known medicines, whichever we know. Okay, among those medicines which are present in our materia medica. So he's saying that it might not entirely destroy the disease on itself because it might not cover the whole portion again at that time, but it will advance it to considerably to the way to be cured. But yes, it will start the curing part, it will start the amelioration, it will start the an action which we will know that it is going towards cure. And as we go on, if even this medicine be not quite sufficient to effect the restoration of health, examining again and again the morbid state that still remains and selecting a homeopathic medicine as suitable as possible for until our object, namely putting the patient in the possession of perfect health, is accomplished. So he's saying that we will keep doing this exercises, examining again and again, interrogating again and again which symptoms are left, which symptoms are left, which are there, which have come up, which have left, and keep giving the homeopathic medicine suitable as possible, so that we can slowly and slowly take the patient towards health. Now, this is completely in a different scenario. The whole scenario when we had known less medicine, the provings of the materia medica of very few medicine was there. Now using this part to whatever that practice is, using this part to say that this is a right way, to give it as an evidence of the wrong intention, that is what I consider that that something which is not good. It basically kind of showing a wrong way to the homeopaths and the students. So that is why the knowledge of organon is very important to us, so that at least we can know that what is wrong. Right, we will learn. When we have left all wrong, the only thing which will be left will be the right part. So at least to know that this is wrong, this is not the right way. So for that we need to know the organon. So organon is not about, it is, I think that we, after you go through the organon, even in the end, you will, if someone asks you that, okay, what is a organon to a homeopath? There will be, I think, the words are very few. We have very less words that we cannot describe what organon is basically to a homeopath. Whether it is a guide how to practice, whether it is guide how to refine a remedy, or what not to do, or how to live also, what needs to be a homeopath, it, it is an endless thing. There is no perfect definition which can be told what organ is to a homeopath. There is, I think there is also, like homeopathy, it is also a limitless thing, organon, what it is. But whatever you feel, when we are going, it is all about feeling. I've spoken about this again and again, that feeling what Dr. Hahnemann is telling us, listening through his mouth, listening through his words, feeling that thing, that okay, he's telling us, one aphorism, and you can, when you feel, you can take out so many meanings out of it. That in this part, he has told us what not to do. He has given us the definition, the characteristics of what you will see when you have given an unperfectly homeopathic remedy, means a partial simile. It is not completely similar to the case. What you will see in the patient, what those symptoms mean, what does a large dose will do to the patient, what does a small dose do to the patient, why small dose should be given. We have not even gone to the part of dose, it is completely in the end. But you realize that when you go to that part, you have already known how much dose you should give. He has already told you all those aphorisms. So organon is all about absorbing inside. We have to absorb it. You cannot remember it. It has to be absorbed with emotion, with that feeling. So, okay, we will stop at 168. And please go through the aphorisms once again, 160 to 168, because they are very important aphorisms. Because the thing is that they tell you what not to do, they tell you what to do if in case you have a wrong this thing. And to see the homeopathy, the way you want to practice it is your intention. You can practice anyway, but it will define your intention, whether your intention matches Dr. Hahnemann's intention or not. That is the only way that can be seen through organon. Even in my case, even in others' case also. If you want to see what kind of intention a homeopath carries, it can only be seen what organon tells us from knowing that thing. So even when I look at myself, when I am seeing a patient, when I look at myself, when I see my unconscious part at that time, when I am seeing the patient, just before coming to the organon class, I was having this online some patients in Thailand. So even when this becomes, when you go through it again and again, it is a practice. It becomes an unconscious part that a question comes to your mind when a patient is sitting in front of you, that what do you want to do? So that defines the attention, that what do you want to do? What answer comes at that time? Whether I should think about what I want as a financial part, whether I should think about what I want as some kind of social or respect part, or that deeper meaning, the first aphorism that no, I just want to cure this patient. That is the only. So once that intention is set, the whole thing starts building upon it. And the organon started with the definition of intention, that the only aim or the mission of a physician is to cure the sick. The first thing was the intention. That intention of a physician should be that my patient should be cured as it should be. I'm not going to relieve his symptoms. I'm not giving the medicine to suppress his symptoms. I'm not giving even to treat the headache or stomach ache or some kind of apathy or cold and cough. My intention is to cure my patient as whole, as complete as he is. My cure should be that complete as my patient is. So the first aphorism, it puts the intention in our mind. So it should go more deep in us. When we think about it, it will go more deep, and it will become an unconscious habit. When a patient is in front of you, sitting in front of you, you will question yourself. The question will come, what do you want? And your intention will speak that I want to cure. And then the whole thing starts matching. So that is the purpose of understanding organon. It produces that is why I'm saying that in words it cannot be defined what it means to a homeopath. So you just have to feel, and you just have to see in yourself that what changes the study of organon brings in you. Before you started studying organon, how you are, and after you have completed studying organon, how you are. You will see that you are not, at least not that person which you were when you started it. So with that, I will take your leave. Good evening to all of you. So today we will be starting with the aphorism 169. We have done till aphorism 168. So today we'll be doing from aphorism 169 to 178, almost 10 aphorisms. The aphorisms are small, so we'll go by easily through them. Today we will start with the how to see the one-sided cases. Okay. There will be first the basic, like I have told you that when Dr. Hahnemann will go through these aphorisms, there will be one basic rule which will be going on there, and then there will be sub rules according to different kind of situations. But that basic rule, that basic part, the basic principle, that remains all through those things, those aphorisms or those guidings. So it will never be contradicted by any other aphorism, so that will always remain. As we go through more, we'll go with it. So we'll start with the presentation. So aphorism 169. So we have been talking about that when about the insufficient amount of remedies, and these aphorisms are concerned with that. But there will be some little things which I will take along with that when we will go through these three or four aphorisms. I will go one by one. If on the first examination of a disease and the first selection of a medicine, we should find that the totality of the symptoms of the disease would not be effectually covered by the disease elements of a single medicine. So Dr. Hahnemann is saying that when we have taken the case of the patient, when we have done the first examination of the disease, and now we are going to the selection of the medicines, and we find that one single medicine is not able to cover the whole totality. Okay, so there is some part which belongs to one medicine, some part of the case taking or the case belongs to some other medicines, owing to the insufficient number of known medicines. But this happens because there is insufficient number of known medicines. So again, in that scenario, not today, this will be a rare of the rarest events in today's case. If we talk about today, the number of medicines, the known power of the medicines we have. Okay, so what he told about that thing at that point of the time, but that two medicines contend for the preference in point of appropriateness, one of which is more homeopathically suitable for one part, the other for another part of the symptom of the disease. It is not advisable, after the employment of the more suitable of the two medicines, to administer the other without fresh examination, for the medicine that seemed to be their next best would not, under the change of circumstances that has in the meantime taken place, be suitable for the rest of the symptoms that then remain. So he's saying that you have a medicine which is more closer to one portion of the symptoms, then you have a second medicine which is closer to the other portion of the symptoms. So after you have given a more homeopathic remedy, means the one which covers more symptoms, once you have given that, it is not advisable to give the other remedy once that remedy, the earlier remedy, has finished its work. It is not advisable, because he says that whenever an action of a medicine act, when a medicine acts and the action comes to the conclusion, when the action is basically comes to the end, then you have to take the case taking again, you have to examine it as a fresh case, see what symptoms are left, see what new symptoms have come in, like we discussed in the last aphorism also, conjoin all the symptoms, and then go for a new medicine which we have to prescribe. Because of the change of the circumstances, he uses the word the change of the circumstances, because there might be some accessory symptoms which have come, there might be some new disease symptoms which might have come, and then adding it to the rest of the symptoms, we have to go for a new medicines which might not be the other medicine which we have thought of before. So we have to see the case taking and the prescription is all about following the steps. There are certain steps, there are certain basic rules which needs to be followed. When we say that we basically prescribed on the totality of the symptoms which are in present of us, and we prescribe a remedy which has a power to basically create those symptoms, to basically produce those symptoms. So when a medicine has acted on a patient, it has acted partially, like we have discussed In the last discussion when we had on the organon about the aphorisms previous to this one, that when we talk about a partial acting medicine, so the partial acting medicine means that it will cure some symptoms and may produce some symptoms. In that case, some new symptoms might come, which might go on their own or which may remain back there. So when we are talking about the totality of the symptoms, so now we have a different totality as compared to the previous examination. So we have to go on this new totality. We have to analyze these new symptoms from where they have come, how they have come, and what are the characteristics of these new symptoms, and then come to the new remedy. In which case, consequently, a more appropriate homeopathic remedy must be selected in place of the second medicine for the set of symptoms as they appear on a new inspection. So the same thing, we have to find a second medicine which basically also apply to the set of the symptoms now which are appearing on our new inspection, on this new fresh examination. What are the symptoms remaining and what have been added to that? We have to see those symptoms and give a homeopathic remedy accordingly. Now here he uses the word change of circumstances. I will just like to add something to this, not from the organ but from experience or from the things which I have read or gone through. Change of circumstances. For example, today I was discussing a case with one of my assistant doctors, that there is a boy who was not able to gain height and who was not able to gain weight. He had lack of appetite. He would have a weak stomach, gastric disturbances very easily. He will be prone to getting this diarrhea or vomiting after eating something which does not suit well with him. So after taking the whole case, we prescribed him Calcarea Phos, and he started doing well with the Calcarea Phos. He was a meek, timid child who would not speak, was, very anxious and afraid of doing. So after the Calcarea Phos, when everything was going well, he started becoming more confident and he started gaining his height. He started gaining the weight also. Now he's appropriately at the height, sorry, he has gained the appropriate height according to his age. Weight is okay, the appetite is good. But from past few months what I could see was that his disposition is changing. you know he is becoming more confident, he is becoming more outspoken. The father also says that he's become more angry and more obstinate as compared to before. So when I inquired with the father that was he like this, like when he was very small, like right now he's around 13 14 years old, 14 or 15 years old I think. So I asked that when, so the father told that when he was 6 or 7 years old he was like this, like he was a very obstinate and cranky child up to the age of 8 or 9 years, and then his mother, she died, and after that he became a very fearful and afraid children, and very this child who will not speak with anyone, who was afraid of father, who was afraid of the strangers, who was afraid of his teachers and friends. He would cry. Okay? So he changed at that time. So this change of the circumstances, many times, because I get this question a lot of time, that when you prescribe a constitutional remedy, is this the remedy for whole of his life? Like whenever he gets under some kind of problem, you can give that remedy, or when the cure is going on, you just stick to that remedy? It may be not. Many times there are very strong circumstances, the change of circumstances, which might change the disposition of the person, which might even change the course of the disease. For example, if this child was suffering from a set of symptoms from past 8 or 9 years, suddenly after such kind of event, the whole set of symptoms changes. For example, this child, if he was suffering from this bad tonsillitis or tendency for cold and cough, after such kind of incidents, the whole symptom will change to some gastric disturbances. That set is completely gone, and a new set has come where the child is not gaining weight, he is not eating properly, he is having gastric symptoms, he is having some mental symptoms which are of fear, of insecurity, and all those things. He's not the same child. So when you prescribe the remedy and he goes back to that place, again at that place you will see that you will need a new remedy because a new set of symptoms have come, a new kind of disposition have developed, which was not there when you prescribed the first medicine, and you will need a new remedy. So right now, according to whatever his symptoms are, we prescribed him lycopodium. But the main thing to understand is that this change of circumstances can basically change or produce new kind of symptoms, or or produce a completely new kind of set of symptoms, a new kind of disposition also. So yes, in some cases the constitutional remedy can remain the same where this kind of change has not happened, but in some cases there might be change which had been there before. It might come up and you need to change your medicine accordingly. So this is just a piece from my side. This is not related to this aphorism or the further aphorisms, because this was recently discussed and I thought it is important to share it with you. So aphorism 170. Hence, in this case, as in every case, where a change of morbid state has occurred, the remaining set of symptoms now present must be inquired into. So, whatever the remaining set of symptoms we have after this kind of prescription which we have made, where we had not a perfectly simillimum remedy because of the lack of the knowledge of the medicines, because of the, in his case, lack of the medicines. He had few medicines. In our case, lack of the knowledge of the medicines. So without paying any attention to the medicine which at first appeared to be the next in point of suitableness, another homeopathic medicine as appropriate as possible to the new state now before us must be selected. So now what we have to do is that we have to see this new state. Some part of the whole state is gone, but some part of the disease or the set of symptoms is left with us. So this symptoms or some additional symptoms, whatever the state is in before us, we have to see that thing and we have to choose a homeopathic medicine which is appropriate to this state without paying attention to the other medicine which we have thought earlier. Many times what happens is this is again, we have to take it as a caution. I had been doing this thing. So from my personal experience, sometimes I wasted my time in this thing. In this thing means when you are going for this, your the first case taking is done, you have some remedies in your mind. In my case, I would write few remedies, that these are the remedies which I thought about, and why one of the is more appropriate is because it contains this particular part or this characteristic, and I think that this is the more appropriate remedy. So I would prescribe it. If it seems to be partial, if it comes out to be partial, I will go to the second remedy or third. So that is a wrong way. Whenever you have to change the remedy, think of the case as a new one. Like recently, because after this kind of experience, I came with an exercise for myself and I found it useful, and I told in the last workshop also, in the camp in the Thailand, that when some certain set of symptom are not working with you, like they are not giving you some medicine, you have a picture of a patient in your mind that he is this thing. Like for example, he's a responsible person, he has gastric issues, he is sensitive to cold, he is hot or thirstless, and this is the remedy which I have to prescribe. Next time, if the medicine does not work properly, don't go again with those set of symptoms. Those set of symptoms did not work for you for the first time, they are not going to work for you the next time. Go with something new, try to find more characteristic symptom. When we select a partial remedy, partial simillimum, that just only means that we have seen the case very superficially. We need to go more deeper into the case. That is the only thing which we need to understand from that kind of follow up. That we need to go more deep into the case. We need to find a proper remedy. With all that knowledge which we have to always try that we need to find a proper remedy. That's it. If it should so happen, as is not often the case, that the medicine which at first appeared, so he's saying that if it happens, it does not oftenly happen, it does not happen very frequently, but if it so happens that the medicine which at first appeared to be the next best seems still to be well adapted for the morbid state that remains, so much the more still it merit our confidence and deserve to be employed in preference to another. So after taking the another examination, if in that case the other remedy, the second remedy, which was less homeopathic in the case, it seems to still merit in this new examination, we find it that no, it covers the all the symptoms, and even the new symptoms, they are come under the this the whole array of the symptom, they basically fall into this remedy, then we will be more confident in our prescription, and then that is the medicine which should be given to the patient. But he gives a caution that it does not oftenly happens, because when a new symptoms come up, or some of the old symptoms which are characteristic, they are gone, then most of the time it happens is that that remedy does not seem to be the right one. So the thing is, whether it is the right one, whether it is not the right one, that can only be uh, understood if we take the whole case again, if we take a new examination every time when we are left with the symptoms. So in non-venereal chronic diseases, those therefore that arise from sora, we often require, in order to effect a cure, to give several anti-soric remedies in succession. So in chronic diseases which are not basically of venereal infection, means basically of soric origin, they are not of psychotic or syphilitic origin. So in those cases, he is saying that in many cases we might need antisoric remedies. We often require antisoric remedies, several antisoric remedies in succession. Now, there is one some doctor who basically advocates that this aphorism. He will just show this aphorism that see in 171, Dr. Hahnemann has said that we will need several antisoric remedies in succession, and because we have not read the aphorisms before that, we also, after seeing that, we also come to that conclusion, or it basically sets in our mind that it is okay to give medicines like that, on partial symptoms, on first cure this symptom, then cure these symptoms, then cure that symptom, then cure that symptom. This is strictly about that time where he has mentioned again and again in every aphorism of his, okay, that I don't have much tools with me right now in the form of medicines. It will not be for the for the future. This thing is not for the future, when you will have a lot of remedies and they are well proven and you know about it. There are a lot of materia medicas telling about those medicines. So this thing is basically because of the time that he did not, because he was the only person who was doing it at that time. He was the only person who was proving the medicines and writing down the effects of that, along with that seeing the patients, along with that writing the book, and he was not a person that just from one or two provings he will write down the materia medica. No, he was a very, very thorough person. The remedies, you will be very many of you doctors who have read about these journals or the informations given by Dr. Herring or Dr. Kent, many of you might be knowing, but I am just telling that the remedies which Dr. Hahnemann proved, when the later on the same remedies were proved, the doctors, they were very surprised to see that there were no more peculiar or characteristic symptoms to add to those provings. They could not add anything to that. Even a remedy like euphorbium, we have very less thought about it. It is given in the chronic diseases, It is one of the antisorics. That remedy was so well proven by him that no one can even add to that remedy after that. And you can check with the provings and the materia medica afterwards. There is nothing new which is added to that thing. So he was a person who was very thorough. He would not publish anything, he would not write about anything until and unless he was 200% sure about that thing. And we can see through his whole literature, when we go through that, how thorough that man was. So he will not write this kind of aphorism without a context to it. So reading this aphorism 171 without context to it, then it may appear okay, we can give many remedies in succession. So that is why many homeopathy, okay, after this give this remedy, after this give this remedy, after this give this remedy. That is not a succession which he is talking about. Every time he has told us that take a fresh examination and then see. These aphorisms we can use in our prescription when we are partially prescribing, means we have not intentionally but accidentally prescribed partially by because of our knowledge, because of our less understanding of the case and the materia medica. Then we can use this information. This information is very important, how to deal with those cases, because these things happen, new symptoms come up, old symptoms certain are removed and certain are there. But in his case, the partial similimum was going because of the few medicines. In our case, the partial similimums are going because of our less knowledge. So for that, we have to increase our knowledge and see very this thing in a very observant manner where we are doing wrong in such cases. Yeah. So several antisoric remedies in succession, every successive one being homeopathically chosen in consonance with the group of symptoms remaining after the expiry of the action of previous remedy. And everyone should be chosen homeopathically in consonance. Okay, it should be homeopathically similar to the group of the symptoms which are remaining after the expiry of the action of the previous remedy. When the previous remedy, its action has expired, it has ended, then whatever the remaining symptoms are, they should be seen, and an antisoric must be given for that, which may have been employed in a single dose or in several successive doses. The previous remedy, it might have been employed singly or many successive doses. It does not matter, but what matters is that whenever the action of a remedy, it basically ends, then we have to see, make a new examination of symptoms and then prescribe accordingly. A similar difficulty, the similar part, now this is not owing to the less amount of medicines but too few symptoms, okay, in those cases. So we will come to that part. From here the one-sided diseases, they will start. A similar difficulty in the way of the cure occurs from the symptoms of the disease being too few. When we have very few symptoms, a circumstance that deserves our careful attention, for by its removal almost all the difficulties that can lie in the way of this most perfect of all possible modes of treatment, except that its apparatus of known homeopathic medicine is still incomplete. He reminds again and again that the apparatus of known homeopathic medicines, the homeopathic medicines which he know at his, which he knew at his time, it is not complete, are removed. So he's saying now the similar difficulty that I have few medicines, but then there are symptoms which are not covered by these medicines which I have. So there is a similar difficulty in that part also, that when the symptoms are very few symptoms are there, so there also we have to see very attentively, and our difficulties can lie in the most perfect of all possible modes of treatment are removed. So they can be removed if we can just carefully be attentive to the symptoms which are present, try to understand them, what they are, and try to find the characteristic. He will talk about that. The only diseases that seem to have but few symptoms and on that account to be less amenable to cure are those which may be termed one-sided. So he termed these diseases to be one-sided diseases. One-sided means that they basically display their whole in just one or two principal symptoms, very few principal symptoms, because they display only one or two principal symptoms which obscure almost all the others. So there are only one or two principal symptoms which in the coming aphorisms he will say that, but they will be violent. There will be symptoms which will be violent or principal that they obscure, they just suppress all the other symptoms and they show themselves. They belong chiefly to the class of chronic diseases, and they also belong to the class of chronic diseases. Like I had told about a case, and I have shown also that case of a man who had chorea, and in the chorea there was this jerking, the jerking chorea. He that was also this kind of case. There was no other symptom, no other problems, no pains of any kind. I because before giving a rare remedy, I am always very, in a manner very careful, or you can say cautious or fearful also, that I am not a big fan of giving rare remedies, the remedies which are not, which don't have a great deal of symptoms. So in that case also I was not in favor of giving that remedy, but there was nothing else. There was nothing else. I tried a lot to find some characteristic symptoms in his mental picture also, in his physical picture also, in his journals also, everything in his pathology also, but there was nothing else. So those are the one-sided cases where you don't have any other symptom, but one or two symptoms. Like also there was this girl who suddenly went into unconsciousness, and in her unconsciousness she was constantly scratching herself, scratching her very badly. Her eyes are closed, like this, and she's scratching herself. What happened? No one knows. She suddenly went into this thing. No one can tell what happened. So we didn't had a causation, because causation was there with the patient only, and she was not in a state to tell. So we just had this one symptom of this, brutally scratching herself, and I gave her belladonna. Just I rubbed the belladonna around her lips, and I think within 10 to 12 seconds, I'm not even talking about a minute, just 10 to 12 or 15 seconds, she came back to her consciousness, and she was sitting and asking what happened to me. So because in those cases where these one symptom or two, that is the only way at that time the disease can show itself, so they will be very characteristic, very peculiar, and very outstandingly being shown. Because they display only one or two principal symptoms which obscure almost all the others, they belong chiefly to the class of chronic diseases. Their principal symptom may be either an internal complaint. So this principal symptom might be, for example, some internal complaint like a headache of many years duration, a diarrhea of long standing, or an ancient cardialgia, some pain in the heart, or it may be an affection more of an external kind, or it can be on the surface like on the skin. Diseases of later character are generally distinguished by the name of local maladies. So the diseases of this kind, one-sided disease, which come on the physical part, on the skin part, they are known as the local maladies or local diseases. So he will be discussing those later on. In one-sided disease of the first kind, it is often to be attributed to the medical observer's want of discernment, that he does not fully discover the symptoms actually present. So again, the the same thing which I was just talking about some time before, when I told you that I am very cautious about giving such remedies. So I have to go through. So the same thing is that many times we may think, for example, if the patient is not giving the information, or sometimes the physician is not into that state where he wants to ask something more, because of our nature also. Sometimes if a physician is more reserved, more timid in asking some things, and he's not conveying his questions properly to the patient, or his message to the patient, so he might not be coming up with the whole information. So he says that in that case it appears to be one sided, but it is because of the medical observers want of discernment, lack of that initiation, or lack of that the way to get out the symptoms. Because in those cases symptoms are there, but the patient sometimes he does not, or she does not understand how to reply to our questions, or sometimes they are skeptical that why we are asking so many questions, or sometimes they don't even understand what is the purpose of this thing. So we have to make them understand that in homeopathy it is necessary to find such kind of symptoms or go to more depth, so that we can come up with the medicine which can be accurate and be given, so that the patient can get cured. We have to educate the patient, because many of the patients they are coming to homeopathy, or the real kind of homeopathy for first time, where they are giving a case of their the whole history is being asked, the whole of the symptoms are being asked. Today I had a case. I prescribed him 10 days back. He was having this problem of diarrhea from past 1 month. He was taking antibiotics, not getting better, so he came 10 days back. I prescribed him the remedy, he was better. So today he came, and then I started asking him more, that okay, tell me. So he was like, okay, no, don't give me the medicine for these symptoms. It is okay. I can bear with that. So I had to educate him that you can bear it with that, or you don't want me to concentrate on them. It is okay, but they all are interrelated, and to find a better medicine, I have to ask about them, because sometimes the information to finding a remedy may be present there in those symptoms which you are having, which might not be of importance to you, but they might be of importance to me in finding my remedy. So in that way we have to sometimes educate the patient also about the necessity of a case taking. So from that part we can then come to this thing that okay, this was not a one sided disease, there were symptoms, the patient was not telling us, or we were not going deep enough, or we were not understanding the patient in a more deeper manner, so that we can come out with these symptoms. So not fully discover the symptoms actually present, which would enable him to complete the sketch of the portrait of the disease. So there, in that part, we have to go with more patience and more time, give the case more time, give the patient more time, so that he can come up with those symptoms. There are, however, still a few diseases which, after the most careful initial examination, present but one or two severe violent symptoms. Now he used the word violent symptoms, while all the others are but indistinctly perceptible. So he said that, but still there are few cases when you have done a very careful examination, when you have asked about everything, and still you are not able to come up with anything. So these two or one severe violent symptoms which are present there, they are the only symptoms which you have to prescribe upon. In order to meet more successfully such a case as this, which is of very rare occurrence, we are in the first place to select, guided by these few symptoms, the medicine which in our judgment is the most homeopathically indicated. So like I told you in that case of that jerking chorea, I have to give him, I think, teucrium. We prescribed him teucrium, I think, because that was the only remedy which covered that thing. And next aphorism came true to me after prescribing that medicine, although I knew about this, but for me it came, like I told you, that these words will become truth for you when they will happen in your experience. They are true according to Dr. Hahnemann's knowledge. He has written it, no doubt in that. But to become truth for you, because there are some things which happen in front of you, and then they give you confidence and conviction in what you are doing. So after prescribing him Tucrium, he came to be a completely normal person. He was like that, I even don't know if I had chorea. I had this kind of problem. So it will no doubt sometimes happen that this medicine, so sometimes happen that when the medicine is given, selected in strict observance of the homeopathic law, because we have selected the medicine in a strict observance of the homeopathic law, we have not deviated from that law, that basic law of similia similibus currenter. I have found a remedy which was very similar to that violent symptom in both the cases, the belladonna also and teucrium also. So it was strictly in observance with that thing. So what happened was, furnishes the similar artificial disease suited for the annihilation of the malady present. So he said that it basically produces the similar artificial disease, and the malady present, the natural disease present, is basically annihilated and cured. And this is much more likely to happen when these few morbid symptoms are of very striking, decided, uncommon, and peculiarly distinctive characteristic. And it will happen more oftenly if the symptoms which you are seeing, those one or two symptoms, are very uncommon, very peculiar, and very distinctive. And in both the cases, why these cases um have produced, a kind of this posted a stamp in the mind or the memory, because in both the cases the symptoms were very strikingly peculiar. We have seen many chorea cases, but not that kind of chorea. That was a characteristic of that disease which was being shown. That was a characteristic of that patient which was being shown when she was, scratching so violently herself. You have read about that violence of the belladonna, of that suddenness of the belladonna. Suddenly she fainted and she was in this state. So in those cases, in those kind of one-sided diseases, where you just have one or two symptoms, but they are of violent character and they are very striking, very uncommon, and very peculiar. And then third case also, which I have told, I think last time, about this tuberculinum girl, when she had this attack of migraine, when she had this attack of headache, she would, very very hardly she would bang her head in the wall. Only that way she would get somewhat of relief, not by pressing it, not by applying anything, but just banging her head in the wall. And she got cured with tuberculinum because it had that kind of uncommon, peculiarly striking symptom. So this is about the one-sided diseases. The one-sided disease where we have very few symptoms, only one or two violent symptoms, and we have to prescribe on that. We should not misjudge a case who have a proper symptom, but because of the patient or because of our knowledge we are not able to bring out the symptoms. So those symptoms should not be considered as one sided. Those are not one sided. There is ample amount of characteristic symptoms present there, some kind of sensitizations which are present there, but we are not able to get that because of some obstacle in our this case taking part. So we have to remove that thing. We have to make patient more comfortable. We have to guide them. We have to tell them about the importance of this thing and why it is important to cure them. So with that, uh, we will be talking about from aphorism 179 onwards in our next discussion on next Wednesday. So any questions if you have, you can send me about, because now we are going through this practical part of the case taking, organon. So this is very important to know the different circumstances in which the patients come, different kind of diseases, different kind of diseases, different kind of observations which we can do in these kind of cases, what we have to keep in mind, what to do, what not to do, because on every important turning point in the organon, Dr. Hahnemann has advised a caution that do not do this. So we have to be keep that thing in mind, that do not do this. Like I told you today, that don't think about the old remedy when you are thinking about the next prescription. Don't do that. You will be wasting the time. Okay, just go for a new examination, try to see what medicine comes up and give that medicine. Just keep it simple. Don't Organon is very simple. Homeopathy is very simple. It is based on very simple laws. A laws, if I make some, I we can make a layman who does not have any medical practice, who does not have any medical knowledge, and you just tell him about these laws, you just explain him this thing, and he will say yes, it makes some sense, it makes some sense, because this has been seen by everyone, this has been experienced by everyone. So homeopathy is very simple. We does not need to complicate it. We does not need to do something, which can make our lives or homeopath's life more difficult. So just we will just keep it simple, simple laws, simple things, okay, simple reminders, simple cautions, with what we can do, what we should not do. So just keeping that thing in mind, we will just, if we keep practicing, we are sure to get the results. We will surely get the results. And the more I get response from some of my students and the doctors which I have talked with, from this, from whenever I have started, I have seen that the more they have kept their this clinical part simple, they have get more results out of it. They have sticked to these guidances, they have stick to the organ, they have stick to the simple ways of learning materia medica, understanding it more deeply, and they are getting very good results in all kind of cases. So just we just need to follow just once. We don't have nothing to lose, maybe something to gain, but nothing to lose if we follow whatever advices Dr. Haneman is giving us in the organon. So we will just try to follow them and see what comes to us. So with that, I will take your leave. I will again advise you that you go through these aphorisms in the coming week. If there is any kind of difficulty, if you find something which is confusing or something which you find it, you can ask the question on the group. You can send the question personal to me also, or to Dr. Jonkol, and we will take up that question in the next part. So with that, good evening to all of you. So today again we'll discuss about the next aphorisms of the organon. I hope there is no doubt or any questions regarding the aphorisms which we have already done. But still, if there is something that you want to discuss, or you want me to explain on something more, then you can always send me the question or the query or anything, and you can send it in the group, and we can talk about that, or try to clear the doubt in a more better way. So last we have done till aphorism 178. Today we will start with 179. So aphorism 179. So till now I'll just give a small this thing, that we are now into the practical part of the organon, where Dr. Hahnemann has given us giving us the different scenarios where we have to understand that how we have to give the medicine. So the first scenario was that we have taken a case and there are sufficient symptoms, but we don't have sufficient amount of medicines, which is not the case today. Okay, so that scenario we cannot say that will exist today, because we have number of sufficient remedies. Maybe there are few, very very few or little remedies which need to be proved in a more extensive way, but I think we have sufficient number of remedies to say that yes, that scenario may very rarely fit in today this homeopathic part. Then we come to the next part, where the symptoms are less, which Dr. Hahnemann has called as one-sided diseases, where the symptoms, although we have done our best, but we cannot come up with the symptoms which are needed for the prescription of a remedy. So in those cases, the first thing is, which we have discussed last time, that okay, with the few symptoms which we have, I will and talk about 178 once more, it will no doubt sometimes, the word used is sometimes, that in such a case where the symptoms are few, but yes, the symptoms are very violent and uncommon and striking. They're very characteristic. In those cases, in those some cases, okay, it will no doubt sometimes happen that this medicine selected in strict observance of the homeopathic law furnishes the similar artificial disease suited for the annihilation of the malady present. So, in some cases where we get very striking symptoms, very uncommon symptoms, very peculiar symptoms, which belong to one of the medicines, and that medicine is given, so it basically has that power to artificially produce the disease which is suited for the annihilation. Okay? So it will remove the disease from the body and the patient will come back to the health, but it happens sometimes, and this is much more likely to happen when these few morbid symptoms are very striking, decided, uncommon and peculiarly distinctive. Okay, but and this will only happen in those cases where these few one or two symptoms, they are very striking, very peculiar and very uncommon. Okay, uh, I just had an opportunity to prescribe to a lady. She's around, I think, 85 plus years old, and she suddenly had this, although she is suffering from this chronic disease, but she suddenly in the night she had this sudden increase of the blood pressure. So there were not many symptoms which were there. There was slight spasticity of the hands, there was this increase of the blood pressure, but these are the common symptoms which you see in this, some kind of seizure or some kind of this, that the palpitation, the heart rate is increased, the blood pressure is increased, there is slight, spasticity or something like this. But when I saw the video, because with whenever uh, you are into this state where the body is in a heightened excited state, there will be some face expressions which will tell you about that turmoil which is going on inside. But on her face, she was very calm. She had this chest congestion also. She was very calm, as if nothing. Uh, on the contrary, usually her face is a little bit more. If there is some problem with this, there is some agitation or some kind of, that there is some pain or the suffering when you look closely. But at this time, the face was completely calm, very calm face. You know, we have this symptom of tranquil, as if a person is in a state of tranquilness, complete peace, complete, no suffering at all, although we can see that the body is suffering. So when this kind of symptom, now this was a scenario which represented basically a one sided disease. Now in that kind of scenario, when you don't have many symptoms to prescribe on, but you have a very striking symptom, a very uncommon symptom, and a very characteristic thing, that in this state usually the patient should be agitated. There has to be something, on the face, some expression of pain, some expression of not being better, not being healthy. There has to be that expression. But here is this expression, that of very calm and peace. And I prescribed her opium, and she got better under that prescription. So when that kind of case is there, then yes, the medicine will act. But coming to 179, so that was sometime. 178, the word was sometime. But more frequently what happens is, however, the medicine first chosen in such a way will be only partially, that is to say, not exactly suitable, as there was no considerable number of symptoms to guide to an accurate selection. But frequently, yeah, mostly in such cases, the thing is that this medicine will be partial, and because we don't have much number of symptoms, so we are just giving a remedy which we find according to us is most homeopathic. Okay, but we have to understand that this might prove to be a partial remedy. So what will happen after the partially given remedy, as we have discussed before also? So in this case, the medicine which has been chosen as well as was possible, we have chosen as well as we could, but which for the reason above stated is only imperfectly homeopathic, will in its action. So earlier the partial remedy or imperfectly homeopathic remedy was chosen in the earlier aphorisms because we did not had much number of medicines at that time. Now the imperfectly chosen medicine or a partially chosen medicine is because we do not have enough number of symptoms to prescribe on. So in this case, when we have taken a remedy, when we have given a remedy, when we have chosen a remedy as well as we can, what happens is, will in its action upon the disease that is only partially analogous to it, just as in the case mentioned above in the aphorism 162, where the limited number of homeopathic remedies renders the selection imperfect. So Dr. Henneman is also relating with that aphorisms 162, where the remedy is basically partially analogous, partially homeopathic, produce accessory symptoms and several phenomena from its own area of symptoms are mixed up. So it will produce the same kind of result, that some accessory symptoms of the medicine, they will come up, they and they will get mixed up with the symptoms which were already there, are mixed up with the patient's state of health, which are however at the same time symptoms of the disease itself, although they may have been hitherto never or very rarely perceived. Now this is very important thing, a differentiation from that prescription and in this prescription. So I'm just going to remind you about those aphorisms from aphorism 162 onwards. So there we had good number of symptoms, but we do not have the medicines enough which could cover, or we have not known at that time. Dr. Hanneman said that I don't know about much medicines. Like I have told you also that hardly there were, I think at that time when he wrote that edition of the organon, I think he just had 65 to 70 or 80 remedies, and he was telling us about that situation, that okay, I have enough number of symptoms, but I don't have a remedy which covers all the characteristic symptoms. I don't have that remedies. So at that time when he will give some medicine which was very close or similar, the, that medicine will remove those symptoms, add up some of its own few, and once the action was over, then he said, okay, we will take the rest of the symptoms, we will then again prescribe one more remedy which will cover these symptoms, and then they were removed, and then he was left with some symptoms, and then some third or fourth remedy will be given. In that way he used to do this thing at that time in that case. But here the problem is that the symptoms are very less, the number of symptoms or the characteristics are not present on which a medicine can be prescribed. So this scenario can happen today also, and it happens in many cases. I've seen many cases where this kind of thing happens, and I'll give you a few examples as we go along. So in this case, when a well chosen remedy is given, what happens is, after the remedy is given, sometimes when it is not completely similar, when it is partially similar, it will come up with some accessory symptoms and some other symptoms which are of the patient and the disease, which were very less perceptible, which used to be very little in its intensity, but they will increase after that prescription. For example, I had a lady who came in the state. She would just complain about weakness. I have weakness. I get dyspnea. She was around 50 years old, I think. But she would like, I don't feel like I have the energy from past 1.5 month, and I'm deteriorating. So when we took the case, okay, any other symptoms, and many times with this kind of thing, the patients are also not in a state to tell you the symptoms. which they can or which they feel, but they cannot tell you clearly. Dr. Hahnemann also gives the same example in the coming aphorisms. So I will tell you when we will reach there. So she was saying that okay, I have this thirst is okay, appetite is okay, little less. So no characteristic symptom was coming out of the whole this thing. So what I could understand is that she was feeling sleepy and she was dull in the mind and she was not able to give her symptoms properly. She felt weakness. So I gave her some remedy. So what happened after was that once she got remedy after 15 days, she came back and she said that, oh my God, that I am having a very bad headache. The whole cervical region and this part, it is getting very much this, like there is some swollen thing inside, there is some swelling inside, and it feels like, that it will burst out. And then she told about that I am also having this gastric symptoms and this thing and that thing and that thing. So then I started inquiring that, it's comes to you that from where did this all symptoms came suddenly? Because when we talked about the history, she never told that she used to have headaches, she used to have this. She said that, oh, these symptoms, they were very, very mild symptoms as compared to my weakness. They would sometimes come, not come. I never bothered about them. They never bothered me, these symptoms. But the most bothering part was weakness. So this is what happens in these kind of patients, especially who have this lack of reaction undergoing them, their states. So when you give some this remedy, which you feel is okay, it is not completely homeopathic, but yes, it matches some state which is there. So the symptoms, they will come up. Sometimes the symptoms of the medicine, they are mixed with the symptoms of the disease also. So what we have to do in those cases, some symptoms which the patient had never previously experienced appear, or other he had only felt indistinctly become more pronounced. So those symptoms which were never there, like the accessory symptoms of the medicine, they will come up, or he will start feeling those symptoms more pronouncedly in a more intensified way, which were very less intensified in the beginning, or he didn't had felt it, those symptoms very strongly. So let it not be objected that the accessory phenomena and new symptoms of this disease that now appear should be laid to the account of the medicament just employed. So he's saying that we do not object to this thing, and it should not be objected that these accessory symptoms or the new symptoms which have come, they basically belong to the medicine, and they have come because we have employed this medicine. We have given this medicine, and that is why these symptoms have come. There is no doubt in that thing. So he has cleared that thing already, so that this thing does not confuse you in the how we have to go ahead. They owe their origin to it certainly, but they are always only symptoms of such a nature as this disease was itself capable of producing in this organism. So now here he adds something to that. He says that okay, they came because we gave the medicament, we gave that medicine, but the body was in a state of lack of reaction at that time. The body was not able to produce or tell in a greater way how it is feeling, what are the sensations, what are the functions which are impaired. So this medicine helped to bring out that picture of the disease for us. So all those symptoms which are coming, or which are we are seeing after giving this medicament, yes, they appear, they belong to the medicine, they belong to the action of the medicine, they have come after the employment of that medication, but they are the symptoms which the disease was itself capable of producing in the organism also. Otherwise they could not have come, and which were summoned forth and induced to make their appearance by the medicine given. So they came because this medicine helped in reducing that lack of reaction. It reacted. Now the organism is reacting. This medicine made him to react. And now with that reaction, he is showing, the organism is showing, the man is showing that where he is diseased actually, owing to its power to cause similar symptoms. In a word, We have to regard the whole collection of symptoms now perceptible as belonging to the disease itself. So in these cases of one-sided cases, when such a state happens after the medicine, many symptoms come up. So these all symptoms, they basically belong to the disease itself. Many times when a patient is in a very weakened state, like in some organic disease, the disease which is acting upon the organs, and you give some medicine to bring him out of that lack of reaction, some carbovet, some sulfur, some opium, or any other remedy which basically is similar to that state which he is going through. The symptoms, they start increasing. The patient, okay, he complains about it, that I didn't have these symptoms after the medicine, as before taking your medicine, but now they are increased. But that is an opportunity for us to understand this thing, that now I can give a medicine in a more clearer way. Now I can actually see what is happening, what is going on inside the body. So this kind of thing should not be taken as an aggravation. It is more of a clarity which is produced to us. It is a way of the vital force telling us, okay, these are the places, or these are the things which are altered, or the sensations or the functions, they are altered, and give a medicine which is similar to this state, and the patient will get cured. Because now the disease is perceptible to us. Earlier, it was in a state of latency. It was just showing some general symptom of weakness, and not able to produce a complete reaction which it should produce. So as the actual existing condition, and to direct our further treatment accordingly. So we will take this symptom, this new symptom which have come up. Some are new, some is basically part of the old disease which were not perceptible, which were less in intensity, but now they are more in intensity. Many times this happens in the cases where the patients are suffering from some kind of schizophrenia, or some kind of psychiatric diseases. Many times after giving a remedy which might be partial, some physical ailments, they come up. And that is a very good sign, because the body is showing that these symptoms are very less perceptible, but this is from where the disease has transferred to the mental disease. And now we should consider these symptoms and give a medicine more accordingly. There's a footnote to aphorism 181. This is a footnote to this word, new symptoms of this disease that now appear. So he's saying that, well, if the symptoms are not produced because of the error in the regimen, a violent emotion, or some tumultuous revolution in the organism, such as the occurrence or cessation of the menses, conception, childbirth, birth, and so forth. So, as I have said, that Dr. Hahnemann is very careful. He's a very careful person. He will give you each and every scenario which you have to consider. So he's saying that, okay, all these changes, patient was in a latent stage. There was a stage of lack of reaction. He was not showing much symptoms. It was a one-sided disease. But suddenly the symptoms start coming up. So he says that after giving the medication, you also have to take a note that these symptoms are not coming out of these, something like this has not happened, that some violent emotion came, or some other kind of error in the regimen. For example, he had eaten a lot, or there was some overexertion in his this routine, or some other kind of acute something which happened to him, or cessation of the menses suddenly stopped, or there was conception, or some childbirth was there. So these are the other events which can cause a person to come out of latency and show some symptoms. So we have to compare that nothing like this has happened, and then we can be very sure that these are the symptoms of the original disease which are being shown out, because now that lack of reaction is broken, and this medicine which we have given, it is basically trying to help us, trying to show us a more complete picture of the disease. Thus, the imperfect selection of the medicament, which was in this case almost inevitable. So, we have selected an imperfect medication. We know that. But in such cases where the symptoms are not there, it is inevitable. We can't do anything about it. We have to select a medicine which is as perfect as to the situation in front of us. So in this case, almost inevitable, owing to the too limited number of the symptoms present, serves to complete the display of the symptoms of the disease. But it still served us, it still helped us in a way that it brought us the symptoms which were hidden inside. It brought out those symptoms. So many times the patients they come and they ask, doctor, I have heard that when you take a homeopathic medicine, it will bring out the symptoms. Bring out the symptoms when they are in this stage of latency, in this stage of lack of reaction. Otherwise, if there are already symptoms which are brought out, the patient is already suffering from many things, then it will not bring out something new. It should not bring out something new. Then if it produces some kind of new symptom or new this thing, or it aggravates something, then that will be because of the wrong medication we have given. So in that case, it is not a blessing in disguise. In this case, it is a blessing in disguise, because yes, imperfect selection was there in this case, but there were not too much symptoms. So this helped in facilitating or bringing out all those symptoms so that we can choose a right remedy now. So we have to understand both these scenarios are different, and we should not get confused in it. And in this way facilitates the discovery of a second more accurately suitable homeopathic medicine. So it will help us. In this way it helps us to find a more suitable homeopathic remedy. So whenever therefore the dose of the first medicine ceases to have a beneficial effect, in these case beneficial means the symptoms have come out, the symptoms have come up. If the newly developed symptoms do not by reason of their gravity demand more speedy aid. New symptom means the accessory symptoms. The accessory symptoms are not very grave. Okay, they should never be grave. Grave means they should never be violent. They should never be so violent that they are affecting the health of the patient, deteriorating him. And it never happens if we are giving very minute dose of the homeopathic medicine. If we are giving very small dose of the homeopathic medicine, this will never happen. If the newly developed symptoms do not, by reason of their gravity, demand more speedy aid, if they become grave because of the large doses, then our whole concentration will go to those symptoms that we have to, kind of relieve these symptoms where the antidotes come in. So all that theory of antidoting the remedy, it came because of this over or large doses, overly prescription of the doses or the large doses. So that is why they started needing an antidote for that thing. Because when you will give a medicine, for example, Lyco was given, the Lyco's symptoms or the accessory symptoms are so violent that you had to antidote those things. So in that thing, the whole picture was lost. Because in such cases, when you want the expression of the disease and then you get some symptoms which you need to antidote, then the whole picture is lost in between. But here also he is saying that it will never happen, which however from the minuteness of the dose of homeopathic medicine and in very chronic cases, the cases which are very chronic, is excessively rare. It is very rare phenomena that it would happen. A new examination of the disease must be instituted. So what we have to do is, when this symptom comes up, we have to start examining the disease. We have to take the case again. We have to see for more characteristic symptoms. It must be instituted. The status morbi, as it now is, must be noted down. So however this is the state of disease in front of us, it should be noted, and a second homeopathic remedy selected in accordance with it, which should exactly suit the present state, and one which shall be all the more appropriate can then be found as the group of symptoms has become larger and more complete. So we'll take the case again. We'll see what characteristics we have found after this thing, and we will find a remedy which will be more closer to this part. In cases where the patient, which however happens excessively seldom in chronic but not infrequently in acute diseases, feels, yes, and this was the scenario which I was talking about, that Dr. Hahnemann will tell us about this. So in cases, it happens very occasionally in chronic diseases, but yes, still can happen in acute diseases, that there will be some patients who feel very ill. They feel that they are very ill. Like I told you about that lady, that she was, I am feeling ill, I am having weakness, but we could not find any cause of the weakness. There are no other symptoms which can tell us about why she is feeling like this. Although his symptoms are very indistinct, the symptoms are not very distinct, they are not very strong symptoms other than this feeling that they are ill. So that this state may be attributed more to the benumbed state of the nerves. So this state happens, like I told you, that lack of reaction. There is benumbed state, a numbed state of the nerves, that they cannot tell, or they cannot come out with the exact sensations, exact particularities, exact information that how they are feeling, which does not permit the patient's pains and sufferings to be distinctly perceived. So because of this benumbed state, the patient is not able to understand how he is feeling, where the pains are, what kind of pains they are, whether they are pains or weakness or some other kind of irritation. They are not able to understand that thing. So this torpor, this is a state of torpor. This torpor of the internal sensibility is removed by opium. So many a time, that is why opium is a very good remedy where this kind of lack of reaction occurs. And I have given to that patient opium, the example which I was giving of that lady who was feeling weakness. And in its secondary action, the symptoms of disease will become more distinctly apparent. And it happens in these cases who have been patient have been suffering chronically from a long time because of some kind of medicines they have been taking, because the disease is progressing in a very slow way. So they go into a state where the disease becomes one sided. There are no clear distinct symptoms. Patient cannot tell us about it, we cannot observe it more clearly. So in those states we have to give a remedy which can bring out the symptoms of the patient. But don't think only opium is the remedy for these kind of states. There are many remedies depending upon what kind of uh, symptom, or small symptoms, or less intensified symptom the patient is suffering from. So, in like manner, after each new dose of medicine has exhausted its action, the state of the disease that still remains is to be noted anew with respect to its remaining symptoms, and another homeopathic remedy sought for as suitable as possible for the group of symptoms now observed, and so on until the recovery is complete. So everywhere time we have to see, whenever the action of the remedy is exhausted, when the remedy has worked completely, we have to again take the case, we have to see the symptoms, and then prescribe accordingly in these kind of diseases. So this is about the a general picture of the one-sided diseases. In the coming aphorisms, there will be two portions of one-sided diseases. Like first will be the local diseases in the form of skin. Then there will be the mental diseases, which are acting on the organ of the mind. So in those two particular parts, Dr. Hahnemann will give us more guidelines in how to deal with those things. But this is a general outline of how we have to go when the diseases are one-sided, where the symptoms are very few, and we could not get to a remedy because the symptoms are very few and not much characteristic. We don't have much characteristic in them. So we will stop today at aphorism 184, and in the next time when we will meet next week, we will start with the local diseases. So these are the two scenarios which should not be confused. One, where Dr. Hahnemann had few remedies. I am saying Dr. Hahnemann, not us. Dr. Hahnemann had few remedies, which is given in aphorism 162 onwards. And then where the symptoms are few, that is a completely different picture. Okay, so we have to be very clear where we are standing in all those things. So again, with that, I will again urge you that during the week, just go through these aphorisms, try to understand this distinction between these two scenarios. And again, if there is some problem, if there is some question, some query, anything which you want to discuss or which you want more clarity on, just let me know and we can talk about that thing in the next class before starting the organon part. So with that, I will take your leave. Thank you, good night, and enjoy organon. Thank you. Good evening to all of you. So there was some technical problem with the Teams, this app. So we'll start with our today's aphorisms. Today we are going to discuss about the intermittent fevers. We have discussed last time about the intermittent diseases. We started with that part. We discussed about the alternating states, which are to be categorized as the intermittent. What kind of diseases or what kind of states are to be characterized as the intermittent. So before going into this state, because we will be talking about how to treat them or how to uh, deal with such diseases or with patients who are suffering from such diseases. During these aphorisms, there will come a point that we have to treat it in a way, like I'm just giving this example ahead of starting this thing. I just want to clarify this thing before we go further, because many times we get confused that if we are dealing with the mental diseases or one sided diseases or acute diseases or this intermittent fevers or some epidemic fevers, that we have to change our way of analyzing the case, or we have to change our prescriptions, or there are certain set of symptoms which are only required for the chronic diseases. There are certain set of remedies which are required for this what we say. uh, just give me a minute, please, just 1 minute. Okay, so we were talking that this might sometimes come as an idea that we might have to give some certain medicines, or we have to change our this way of prescription. The basic rules, they always remain the same. The basic principles, they remain the same. The basic way of case taking, it always remain the same. Yes, but according to the different cases, the preference of symptoms, or what kind of group of symptoms we have to give preference, that may change. For example, in the mental diseases, we did that we have to get acquainted or understand in a complete manner what kind of mental state the patient is in, and then we have to add to that the physical symptoms which have been going on. Okay, in some acute episodes, like even the acute mania state, Dr. Hahnemann has told us that, okay, take that state only, what is happening at that state, prescribe accordingly, and then move on to give an antisoric or a constitutional medicine. So the basic principle of prescription, or the basic principles, they remain the same. There are certain, what we call as the tuning, like we tune into a certain radio frequency. So that kind of tuning, that needs to be adjusted according to different cases, according to different classification of the diseases. Okay. So during this journey of the organon, in this practical part, that is what Dr. Hahnemann is getting us acquainted. If you can remember aphorism 3, where he says that we have to adjust according to each individual case. This is the adjusting, where we need to adjust our thinking pattern. Okay, the basic thinking, the basic thought process remains the same, but we have to adjust that, okay, this is the that kind of case, this is a case of alternating diseases, now I have to think in that way. This is a case of intermittent fevers, now I have to think in that way. I have to remember what I should give importance in this case. I have to take the whole case, and then out of all the information, what I have to give importance, what my prescription should cover. In this case, what is to be seemed as important. So that is a very important thing to understand when we are prescribing. Okay, every case which is coming episodically, like we discussed last time, it is not an acute case always. Okay, it has a chronic tendency to it. There is a sora which is underlying the whole state. So we have to understand that thing. So that was very clear in the last aphorisms. But in 235, now Dr. Hahnemann is going to say something again about certain cases where the intermittent fevers are like this. Okay? So that is the classification which we have to understand. And then we have to moderate ourselves. We have to adjust ourselves depending upon the case, depending upon the patient in front of us. So with that, we will start and we will talk about this thing while we are discussing the aphorisms. Okay. So in the last part, we have talked about where the fever is not coming. Now we are discussing those intermittent diseases where the fever is there. So with regard to the intermittent fevers that prevail sporadically or epidemically, not those endemically located in the marshy districts. So one part we have kept out, that where the fever is endemic. Nowadays, it is rarely seen in the urban localities or even in the countryside, because many measures have been taken to to guide the people regarding the surroundings, regarding the locations. But still, it can happen in one or the other case. But we will talk it about in a later manner. Here we are in this aphorism, we are going to talk about the intermittent fevers which are sporadic or epidemic. Like if there is some epidemic intermittent fever, or sporadic, like sometimes in some season, some cases of dengue they start coming, or some kind of remittent fever they start pouring in. Then what we have to do, we often find every paroxysm likewise composed of two opposite alternating states. So what we call as the intermittent fevers, how we have to classify, where the paroxysms, the two opposite alternating states are coming, cold and heat. There is a state of chill, then there is a state of heat, or when there is a state of heat first, then chill. Okay, so two alternating opposite states are coming, more frequently still of three, and more frequently there is three states, one is of chill, cold, heat, and sweat. So those we will call as the intermittent fevers, where there are alternating states, or there are different states to the whole episode. Therefore, the remedy selected for them from the general class of proved common not antisoric medicines must either, and the remedies of this sort are the surest, be able likewise to produce in the healthy body two or all three similar states. So we have to find a remedy which has this tendency to be similar to these states, either two states or the three states. Now, here it is written common, not antisoric. Okay, that you do not have to choose an antisoric remedy. Let's get clear about this. For example, there is a case coming to you because regarding this thing, Dr. Hanneman is going to talk in the next aphorism. He's going to clear it, but let me clear it a little before going, because sometimes the things they stuck to your mind. So, not antisoric. That does not mean that out of all the antisorics we cannot give any medicine. For example, a case is coming to you. The case clearly shows the pattern or the states, the chill state or the heat state or some kind of characteristic of those states, and it responds to sulfur. Okay, when you look at the whole case, you see that okay, sulfur is the remedy, but sulfur is an antisoric, approved antisoric remedy, very strong antisoric. Okay, so now if you're okay, so 235, it was written that not to give antisoric. So instead of sulfur, what should I give? Should I give aconite? Should I what? We have to understand this thing that medicines, this antisoric part, what does Dr. Hanneman means? Okay, there are some remedies which are proved antisorics, or there is this thing because they have a deeper action. Dr. Kent, he explains it in a more brilliant way, this antisoric part. He says that any medicine which has given symptoms or which has this tendency to produce symptoms on the skin, that can be considered as antisoric. Okay, so any remedy which has symptoms which can be produced on the skin, some kind of eruption or some kind of psoric eruption, it can produce on the skin part, then we can consider that remedy as an antisoric, and that class has been increasing. Uh, and lot of medicines can be called as antisoric. There are very few medicines which we can call that okay, these are not antisoric, or these are uh, does not have that deeper action where the sora is situated. Again, we can talk about this thing in a different time or a lecture when we will discuss miasms. Antisoric is the way of prescribing a medicine. Same medicine you can prescribe in an antisoric way. The same medicine you can prescribe as an acute. Okay, like we normally talk. Okay, you can prescribe this medicine for a chronic disease, the antisoric one, or an acute. Also, the same medicine will work. The arsenic will work. The sulfur will work. Natrum will work in both the ways. So the main thing is that you do not have to approach as an antisoric in these kind of conditions, whereas sporadic acute or an epidemic acute has come. Take it as an acute, approach it as an acute disease. Okay, don't go into the past history. The recent causation is required. If you can get that, not, then we can go to the other part of the symptoms which we have. But you do not, right now you do not worry about giving an antisoric or giving the medicine in antisoric way or a constitutional way. So don't confuse it that Dr. Hahnemann has uh, told us not to give antisoric, but here it means the way, that don't approach it in that way. Okay, if a sulfur is coming, if that is a remedy, then give it. Okay, and Dr. Hanneman is going to tell the same thing in the coming aphorism. I will again, we will talk about that again at that point, but still at this point I'm just trying to clear that and the remedies of this sort are the surest. If you will give it in this way, then they will be surest. If you are not taking an anti-psoric like you are not taking the whole chronic history, asking what happened, in the, take it as an acute. This is the approach which we have to take, and the remedy which will come, that will be the surest way of curing this particular intermittent fever which is in front of us. So now coming to the next part. So the remedy which we are selected, therefore the remedy selected for them from the general class of proved medicines must either be able likewise to produce in healthy body two or all three similar alternating states. So the first thing which we have to keep in the mind is that the remedy which I am selecting, so whatever the states are there, either the two states are there or the three states are there, the medicine should be able to produce the same alternating states in a healthy body. Means it should have that power of curing those states, or else must correspond by similarity of symptoms in the most homeopathic manner possible to the strongest, best marked, and most peculiar alternating either to the cold stage or to the hot stage or to the sweating stage, with each with its accessory symptoms according as the one or the other alternating state is the strongest and most peculiar. Okay, so either it should cover all the states or it should correspond in the similarity to the most marked and the strongest state of all three or two. If the sweating stage is more marked means it has more symptoms, it has more characteristics as compared to the cold or hot stage, then that should be the prominent part on which our medicine should be based. Our medicine should be similar to that. If heat stage has more prominent, for example, a patient is in a state of heat stage, at that time the fever is has started, the body has started becoming warm, and the patient starts going into delirium. He has become loquacious, he has become cheerful, he is so feeling energetic at that time. So that becomes a very marked part of that heat stage with its accessory symptoms, all the accessory symptoms which are there. Okay, so if there is some state which is marked, which is strongest as compared to the other two, that the other two are not giving such strong symptoms, why he's making this thing clear? Because sometimes what happens is you have three stages of fever. There is a chill, there is heat, and then sweating. Sometimes there are some one or two peculiar characteristics of chill stage, then there are some characteristics of the sweating stage, and then there are some characteristics of the heat stage. When you see look at the chill stage, you think of some remedies coming in the repertorization which is not similar to the heat stage. The characteristics of heat stage are not being marked by this thing. But then you look at the sweating stage, then a third remedy is which is coming up, so you get confused which to give. We get confused, okay, whether I should give this because this medicine covers the sweating stage but it does not cover the other two states. So to clear out that thing, you have to first pick in such a, if a remedy matches all the three states, there is nothing like that. That is the best remedy. But if we come into the state that all the three, characteristics, the three characteristics of all the three stages, sorry, characteristics of all the three stages, they are pointing to different remedies. So first we have to pick up a stage. We have to pick up the state which is more marked, which is more strongest, either by frequency, either by the strength. For example, the chill stage is very small, but the fever stage is very long and very marked and very intensified. So we will take it as that, okay, the whole disease is basically showing itself in this stage. Or the chill stage is very marked. It is very long, very strong as compared to the heat or the sweat. So we have to see the intensity, we have to see how long is the duration, we have to see which state is having more characteristic symptoms. According to that, we will pick one state in such cases, and then we will start finding the remedy for that. Okay, so these are the two ways. First of all, one, all the a remedy which matches all the three states, nothing like it. But when a medicine is not matching, or there is some state which is more stronger, more marked, more peculiar, then we will pick first that stage or that state, and then we prescribe our medicine according to that state. Now comes the more important part, or more prioritized part, but the symptoms of patient's health during the intervals when he is free from fever must be the chief guide to the most appropriate homeopathic remedy. Okay. Again, but the symptoms of the patient's health during the intervals, during the state of apyrexia, when the fever or any of those three states are not there. At that time, whatever the symptoms are of the patient's health, they are the chief guide. They supersede all the other characteristics. If there is some characteristic in that state, for example, in staphysagria, when they are in a state of apyrexia, they start getting very ravenous hunger, very ravenous hunger. They will keep eating, keep eating, keep eating, keep eating. So that stage or that kind of symptom becomes very important. The symptom which is coming when the patient is free from all the three states. Okay. So they will become the chief guide to the most appropriate homeopathic remedy. Now, between you have thought about a remedy for those states, and then there is a remedy for this state which is free from the fever. This will be given more importance, which is more similar to the patient's symptom. They have to be characteristic symptom, not some weakness or some head heaviness, not those kind of symptoms. But if there is some characteristic symptom, like I told you that, suddenly he will go into a state of ravenous hunger, or when, for example, if there is no fever, the diarrhea sets in, and there is some characteristic of diarrhea, then that part will become a more important this thing, guide for the homeopathic remedy which we have to prescribe. So first of all, the more topmost priority is to the symptoms which are in the stage of apyrexia. That is the topmost priority. Then the symptoms of the states. Okay. First, if all the three or two states are covered, very good, we can give that remedy. If we are not able to decide upon a remedy because the remedy of every state seems to be different, then we have to pick the strongest, best marked, and peculiar state. Okay, and then prescribe according to that stage, because many times there are not much symptoms in the apyrexia state. In the interval state there are not much symptoms. Okay, so then we go back to the, this that symptoms of the state, whether the chill or the heat or all the three or two, we have to decide a remedy accordingly. But if you have those kind of characteristic symptoms in the state, in that interval time when the fever is not there, when all of the three states they are gone and the patient is in a healthy state. Okay, then those symptoms, when he's free from the fever, when he's free from this intermittency, those symptoms need to be the chief guide according to their characterizations, according to their characteristics, according to the modalities whatever they have at that time. So okay, so in the intermittent fevers we have to understand that we have to prescribe for this state acutely. We have to prescribe. Don't go into the uh, analysis like we do in a chronic case or in a chronic disease. Don't go like that. It is an acute stage, we have to take it acutely. And then we have to, when I'm saying acute, don't misrepresent it with the acute miasm. Acute miasm is a different thing. When I'm talking acute means it has come, um, like we have discussed, sporadically or an individual acute disease. I am taking the characterization of that acute which Dr. Hahnemann has given. We have already discussed in, I think, in aphorism 72 or 73. I cannot remember clearly, maybe, but around that we have already discussed this classification, which we are to be called as the acute and which we have to call as the chronic. Okay, so I am taking that classification, that individual sporadic epidemic diseases, which we call as acute diseases. So in those acutes, we have to prescribe on the basis of acute, like regarding this stage, this episode, which is in front of me. So first footnote to aphorism 235. The pathology hitherto in vogue, which is still in the stage of irrational infancy. So here Dr. Hahnemann is talking about the intermittent fever. Basically, the classification which the pathological books, they have given to the intermittent fever. They call it ague. So he's talking about that recognizes but one single intermittent fever. He's saying that pathology recognizes that only one kind of intermittent fever is there, because anything which has cold, chill, and sweat, they call it as intermittent fever. The pathology describes it as intermittent fever, which it likewise termed ague, and it is termed as ague, AGUE, and admits of no varieties but such as are constituted by the different intervals at which the paroxysms reoccur. So he's saying that there is no varieties which are given in the books of pathology. Only diversities or only divisions or only terminations, terminology which is given is basically based upon the paroxysm, that how frequently they are reoccurring, whether it is a quotidian, tertian, or a quatern, etc. But there are much more important differences among them than what are marked by the period of their recurrences. So he's saying, but there are so many diversified intermittent fevers. Now, some, like for example, malaria is also an intermittent fever, dengue is also an intermittent fever, but there is not a single type of dengue. Every patient has a different symptoms. So he's talking about this thing that when you classify a very larger thing into a very simpler form, into a very small form, then there is an inability to think beyond that. Okay, so this is basically why Dr. Henneman was very cautious about uh, diagnosis means giving a name to a disease, that just by the common symptoms of the disease, that there is fever, there is chill, and there is sweat, we just call it an intermittent fever. That is not a way how they should be, because the line of treatment then goes accordingly. Whatever the name of a disease is given, the line of treatment is going according to that. So he's saying that, but they are all different. There are innumerable varieties of these fevers. Innumerable. We cannot number them. There are so many varieties of these fevers, some of which cannot even be denominated egg. And many of them we cannot denominate egg, because in egg there is a sequence that first the chill will come, then the heat stage will come, and then the sweat will come. But there are so many intermittent fevers that don't go like this. Some, the heat may come first and the chill comes in the last, or it may start with the sweat also and then end in a heat. So he's saying that there are so many varieties which cannot even be denominated egg, as their fits consist solely of heat. Because sometimes there is only one state which is available. Their episode, fits mean their episode, the paroxysm which comes, it consists solely of heat. Others again are characterized by cold alone. Then there is only chill in some, with or without subsequent perspiration. There might be some perspiration or there might not be. Yet others which exhibit general coldness of the surface with a sensation of heat on the patient's part, on which the body feels externally hot. The patient might feel coldness, but when you touch the patient, he is hot. The patient feels cold, or the patient's body is hot and he is feeling cold, or the patient's body is cold but internally there is a sensation of heat. This also can happen. Others again, in which one paroxysm consists entirely of a rigor or simple chilliness, followed by an interval of health. So there can be a paroxysm where only the chill comes and then the apyrexia starts. There's an interval of health. Whilst the next, okay, so the next paroxysm consists heat alone, and the next is in the paroxysm in the same patient, there can be only heat, followed or not by perspiration. It may be followed by perspiration, it may not be followed. So he's telling there can be so many different varieties of intermittent fevers, and he's just telling us about that. See in a big way, see in a wide way, that how many differences are there, and we are just naming it with simple small intermittent fever. Others again, in which the heat comes first and the cold stage not till that is gone. So there is when the heat comes and then the cold stage is not yet gone, but the heat starts. And others again, wherein after a cold or hot stage, apyrexia ensues, and then perspiration comes on like a second fit, often many hours subsequently. And there may be some kind of a fever where a cold or a heat stage has come, and then there is a state of apyrexia. Patient is healthy, and then after a few hours, the perspiration starts. Others again, in which no perspiration at all comes on, and yet others in which the whole attack consists of perspiration alone without any cold or hot stage, or in which the perspiration is only present during the heat. So now there can be some paroxysms or some kind of intermittent fevers in a patient which may show that there is no perspiration, or some paroxysm will be like that it has only perspiration, or without any chill, without any heat stage. And there are numerable other differences, especially in regard to the accessory symptoms. So all the other accessory symptoms such as headache of a peculiar kind, bad taste in the mouth, nausea, vomiting, diarrhea, want of or excessive thirst, the patient may be thirsty or thirstless, peculiar pains in the body or limbs, disturbed sleep, delirium, alterations of temper, spasms, etc., before, during, or after the cold stage, before, during, or after the hot stage, before, during, or after the sweating stage, and countless other varieties. So he's saying that there are so many accessory symptoms in the patients which are different regarding the thirst, regarding the uh, appetite, regarding some kind of pain in the body, some kind of delirium, sleep, and different stages. It so he's saying that there are innumerable variety, countless varieties. We cannot count, and we just give it one name and then treat them accordingly. All these are manifestly intermittent fevers of very different kinds. They are all intermittent fevers, each of which, as might naturally be supposed, requires a special homeopathic treatment. And they all require a special different treatment. Homeopathic means similar to the symptoms. Homeopathic. It has to be homeo, and then only that kind of treatment is what is needed to cure them. It must be confessed that they can almost all be suppressed. Now he's saying that he it should be confessed, it should be understand that all these fevers they can be suppressed. The word used is suppressed. It is not cured, suppressed, as is often done by enormous doses of bark, cinchona bark, and its pharmaceutical preparations, the sulfate of quinine. So the quinine, we have discussed this earlier also when we were talking about this thing, that quinine is a very strong medicine which has been used and is being used even now. So we are not yet free of that thing, but some preparations have changed, but still quinine is being used. So if given in this way, that every intermittent fever is given quinine, every intermittent fever is given, even if I talk homeopathically, if every intermittent fever is being given China, then we can also suppress that patient. That fever can be suppressed when given in larger doses. I'm not saying that don't give China. If it is indicated, we have to give China, but it should be indicated in a homeopathic way. Then it can cure. If we are giving China in large doses, repeating oftenly, then it will suppress the fever. That is to say, their periodical reoccurrence, their typus may be extinguished by it, although often only after increased and frequently repeated doses. So, this is the first thing which can separate a right remedy, right medicine, or a wrong medicine. That a wrong medicine will never need, sorry, a right medicine will never need to be frequently repeated, or its doses they never need to be increased. If a medicine is repeated frequently, in such cases, there are some cases where you need it, the frequent repetition. I'm not talking about that. But in these cases, intermittent fevers or some acute episodes, you don't need to repeat that dose again and again. And if you have to increase the dose also of the medicine, with that, then we are prescribing the same way the allopathic medicines are prescribed, because there is a need to increase the medicinal substance, because it is a substance, it is a material dose, so it needs to be increased and it needs to be frequently repeated. But the patients who suffered from intermittent fevers for which cinchona bark is not suitable, now there are some patients who are suffering from intermittent fevers, and the cinchona bark is not suitable to them, as is the case with all those epidemic where the epidemic intermittent fevers are there that traverse whole countries and even mountainous districts are not restored to health by the extinction of the typhus. So cinchona bark will help in the extinction of the typhus. Typhus means that reoccurrence, that periodical reoccurrence that will break down. Like we have discussed earlier in the last time also, that it is a characteristic of China that it will break the periodical recurrence. So even if you have given a right remedy, the patient is getting better, 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 but the periodical reoccurrence is not going away. So there also Dr. Hahnemann said that think about a dose of China, yeah, in a diluted manner, in a tincturized way. Okay. So because the China has this characteristic of breaking the typus. So if Syncona bark is being given and it breaks the typus, it does not mean that the patient will be restored to the health. On the contrary, they now remain ill in another manner. The whole disease is suppressed. Now they are ill in another manner, and worse, often much worse than before. You will find the patients who will come to you who have been taken some medicines for the typhoid, for the malaria, for dengue, especially this quinine part. You will see that okay, there that problem has gone away, but after that, many other symptoms, especially of weakness, or some kind of pains in the body, which are coming, okay, or some kind of, they will never say that they are healthy, and they will always point to that time after chikungunya, after typhoid, after dengue, doctor, I have not recovered. Because they feel that something has been taken away from their health permanently. So this, they will always point to the doctor. The doctor, after that episode, after that dengue, after that, intermittent fever, I have never recovered. Because there's something like this has happened. Often much worse than before, they are affected by a peculiar chronic bark dyscrasias. This is the medicinal disease which they have been, that it has taken the place of that intermittent fever. It was strong, it replaced, it was similar, strong, so it replaced the old disease, aphorism 37, 38, 40, which we have done regarding how the diseases, they basically displace each other and can scarcely be restored to health even by a prolonged treatment by the true street system of the medicine. Okay? Even with the, sometimes with the homeopathic, because aphorism 76, sorry, 70, yes, 76, it tells us that, that this kind of damage has to be treated by the vital force itself, and it takes a long, long, long time to do it. Re- that we have removed the miasm, or we have cured the miasm, the cured the sora, which has been the fundamental cause for the chronic disease. Once we have given the medicine, still complete restoration to the health, it takes a long time, prolonged treatment, and yet that is what is called curing forsooth. And forsooth means indeed, indeed in a sarcastic way, in a more a way which shows a little mocking, that, and then they call this curing, like the intermittent fever has been cured. So second footnote to aphorism 235, here Dr. Hahnemann basically tells about Dr. Boeing Hassan's, because he made this repertory, he made a special his work regarding this thing for the fevers. So Dr. Von Boeing Hassan, who has rendered more services to our beneficent system of medicine than any other of my disciples, has been elucidated this subject, which demands so much care and has facilitated the choice of the efficient remedy for the various epidemics of fever. In this work entitled Versu Kiner Homeopathician Therapy der Wechselfieber 1883, Munster Bay, Regensburg. So this was the work, or this was a kind of small repertory which Dr. Boinghausen at that time had made for the epidemics of fever. After that, many doctors have worked on this thing. Many other books have been, and many vast work has been done on this thing. And so you can, I think Dr. Allen has also done a very great work on this thing. So if you want to go to that particular books, you can go, you can read them. There are different symptoms given in these books of chill, of the heat, of sweat stage, and then also of the apyrexia stage when the fever is not there. Okay, so they have been given beautifully. You can go, you can read. Yes, I will not say that we can remember everything, but yes, at least we can see what kind of symptoms they come in these stages. We can become acquainted with that thing, that what kind of symptoms we can see in these states. Some might stick to you, that is good, but at least we will go when we go through the symptoms, because one patient is not going to show you all the symptoms, or 10 patients are not going to all show you all the symptoms. Like Dr. Haneman has already told us many times that they are innumerable. you, you even in your whole life you cannot see all of the symptoms. But yes, by reading this materia medica, we keep getting acquainted. We keep getting acquainted with the wordings the patient has used. Like in Kali Carb, the patient uses this word that it feels that there are someone has placed coal, burning coal on my rectum. The hemorrhoids, they feel like that. So we can sit for a moment, we can meditate on that words, that okay, it feels like so intensified burning that someone has put a coal so intensified. So that is how the patient is going to tell us, that is how his pain will be, his expressions will be, the way of explaining will be when he comes to me. Because when patient is coming to me, he's not going to use the exact same words, but yes, he will show the same kind of intensity and expressions which those patients might have shown. So this is how we become acquainted with the symptoms. Again, one points how to read materia medica. We have to get acquainted. Okay, these kind of symptoms are shown. And there are these kind of symptoms the patient might feel while while urinating. Patient feels, that something very big has escaped, and now he feels relaxed. Yeah. These kind of symptoms are there. The patients might, that there is an amelioration after urination, amelioration to that heaviness which was felt in the uh, abdominal area, or in the lower abdominal area, or in the pelvic area. So when we go through those kind of symptoms, we become acquainted. So similarly in fevers, similarly with the cough, you can decide that okay, today I am going to read about the cough. What kind of cough are there? We can go into that thing, understand that thing. What is a hacking cough? What is a cough which can be this uh, contracts or suffocates, contracts the esophagus, or a spasmodic cough, or a hacking cough, or a dry cough. What kind of ameliorations and aggravations are there? Sometimes you are surprised, oh, this kind of thing might aggravate or ameliorate the cough. Like there is one of the remedies, I am not trying to that if they hold their throat uh, more strongly, then the cough becomes better. I'm not able to remember the remedy right now, but there is this kind of symptom. So if you have read, and when you are reading the symptom, it surprises you. Oh, what kind of symptom is this? Because if something strange is coming, the mind becomes curious. That is a food for the mind. That is a food for the brain. The brain becomes curious about new things, something which is not ordinary. Because if that kind of symptom comes in front of you someday, the brain will automatically catch. You don't have to do anything, because you have already been surprised, and you will be again surprised to see that thing. Okay, so don't uh, learn or read materia medica to memorize it. There is no need for that thing, and it is not meant to be like that. It should be anything which we read, not only materia medica. I have told this thing earlier also, that anything we read, what is the purpose of a book, or what is the purpose of reading? That it should incite our ideas, our thought process. We are not going to remember. Like when we were small, we used to hear stories. Our grandparents or parents that used to tell us stories. What was the purpose of those stories? They didn't wanted us to have that kind of like why children like stories, because they wonder. That is what the brain needs. that they wonder. They wonder at the choice of the words, they wonder at the twists, they wonder what is going to happen next. That wondering is basically, which basically uh, helps the brain to retain the information to learn. So similarly are the books. They are there to provoke the thought processes. So whatever comes in the thought process, that will be retained. So sometimes it might feel like, for example, if you now, I'm not saying that, sometimes you, a book, for example, some Materia Medica, you start reading Netramure from Dr. Kent's Materia Medica. First, you will look at the pages. How many pages are there? Sulfur, oh my God, 30 pages, 35 pages. So, because we are told that everything should be perfect. We try to do thing, everything should be perfect. For example, reading means I should memorize perfectly. There is no definition of perfection. There is no definition of perfection. There is nothing in the world which is perfect. Even the earth is not round. Although we see that round earth, but actual shape of earth is not round. It is way away from being round. It is just shown or seen like that, that it is a round or oval shaped. It is not. If you go on the internet and you type in the actual shape of the earth, you will be, it will be a wonderful thing to see if you. So nothing is perfect. Perfection is just an illusion. Okay, you just we go with this idea. We should go with this idea that there's a beauty in imperfection. If I'm imperfect, if someone is imperfect, that is the beauty of it. If I'm reading something, if I have read 10 lines, I cannot even remember one line after reading. It's okay. No worries. I don't have to read it again. I will just take the gist of it. I will just take the essence of it. What the writer wants to say. That is more important than anything. Because once I get the essence, then I can create that in me. I can recreate whenever I want it. I just need the essence of that thing. Okay. For example, if someone has told you story, you can tell the story again and again and again. You can create, you can add something to it, you can subtract something from it if you which you don't like, but you can recreate it, you can create it in your mind, you can tell it again and again. Because why you can tell? Because that story felt amazing in yourself, you like that thing. So the main thing is liking the idea, liking the wondering in what or how it will be presented in front of me, what I will do if it comes to me. And then what will happen? If I give such a remedy, such a patient comes and I give such a remedy. Yesterday, I had a case of cancer, female suffering from cancer. Already, she was having this soft tissue sarcoma. So there was a medicine which came. It was more indicated, very hard, very big. This thing, the lymph nodes, which were very, very big and very hard. So we gave certain medicine to her. Now, when I was giving that medicine, when I was writing that medicine, so I was wondering what is going to happen. That wondering is what makes us work. That what will happen now, not the fear, but the wondering. Okay? Fear takes us away from something which is beautiful. So that wondering is because I have already read about that medicine sometime before. You can say 6, 7 months back. I have read extensively about that medicine, and then that patient came, and that there was this characteristic of that remedy, and the patient or the attendants, what they were saying, they all then, and after prescribing, you wonder that how like a small child, there is this excitement that now what will happen. Let's see. So this is what makes the materia medica, how you can remember, or how we have to, although I'm going away from the subject, but somehow because the materia medica became a topic in this footnote, materia medica can only be remembered or only be understood by this kind of amazement or this kind of wonder when you're practicing it. All this thing, All the books, Organon, Materia Medica, the chronic disease, all the philosophy which is written, the main purpose is for us to practice it. Okay, for example, there's a game of football. Okay, I tell you the rules or how to dribble or how to do this, but that all makes sense. You have read about everything, you have seen the videos, how the players play. Makes more meaning when we go out and play. You may not fail. That I will not use the word failure, but yes, some mistakes may be done. But those are the learning. That is what is there to do. We can only learn from mistakes. We cannot do learn from anything which we have done perfect, because if we have done something good, then that we know. There is nothing to know more about it. But if we have done some mistakes, even if we have not scored goals or we got you know we did some thing which was not required at that particular time, it's okay. That is how we learn. That is a part of the game. The mistakes are part of the game. So we go back, we study again, we read again, we see ourselves, we work on ourselves, and we go out again. That is how the life is. Every aspect of the life, it is like this. That is the actual purpose of life, to keep improving. So again, coming back to this topic, so this is how we have to go. That at the end, the mind is that we. I am reading about this. Why? Because there is one mission of a physician, the first aphorism, to cure the sick. I'm going out, I'm going to see the patient, I'm going to work on them, I'm going to work on my. The more I see patient, the more I understand sickness, the more I understand health, the more I understand homeopathy. That is how it can be done. So there is, if we think, okay, first I have to read. Many students come to the clinic that I am not ready to practice. The day you understood about homeopathy, the day you read that word homeopathy somewhere, you were ready to practice on that day. There is no decided time to practice. You cannot decide on it. You have to start it. Okay. We have to, there is this word, I think, in a Japanese word, wabi sabi, means act before you become perfect. You have to act. Don't wait for the perfection. You have to act now. Okay. The more you will act, the more you will see, the more mistakes you will wish that you make mistakes, because then you can learn more quickly. The people who are afraid of making mistakes, there is afraid of, you can call it mistake, you can call it failure. If we are afraid of that, we cannot go past ourselves, we cannot do. I have discussed this thing before also, that we hear success stories, but we no one tells us that how many times that person has actually failed before being successful, because it is part of the same process. So you have to act before thinking. Go out, see the patients, go to the clinic, see the patient, go to the hospital, see the patients, because the patients are your guide to homeopathy. That's how we learn homeopathy. That is how we learn materia medica. That is how we learn organon, chronic disease, everything. So we'll go to the next part, next aphorism, 236. So after understanding what is intermittent diseases and how we have to tune into our approach, how what we have to see. Now we have to understand when we have to prescribe the medicine. After we have chosen a right remedy, the most appropriate and efficacious time for administering the medicine in these cases is immediately or very soon after the termination of the paroxysm. So the most appropriate or efficacious time is when the paroxysm has already terminated or is near termination. There was a chill stage, a heat stage, a sweat stage, and now the sweat stage has started decreasing either at that time or it has completely stopped. The sweating has completely stopped. Now is the time to give your remedy which you have selected. As soon as the patient has in some degree recovered from its effects. So as soon as the patient has recovered from that effect of the whole paroxysm, that is the right and the most appropriate time to give the remedy which you have selected. It has then time to affect all the changes in the organism requisite for the restoration of health. Then it will get the appropriate time, right time to affect the change, to cure, to bring the healthy, sorry, to remove the symptoms and restoration of health can be done without any problems, without any great disturbance or violent commotions. Whereas the action of a medicine, be it ever so specifically appropriate, if given immediately before the paroxysm, coincides with the natural recurrence of disease and causes such a reaction in the organism, such a violent contention, that an attack of that nature produces at the very least a great loss of strength if it do not endanger life. So Dr. Henneman is saying if your medicine is right, for example, you have chosen a right remedy, but you give it in the start of the paroxysm, when the paroxysm is just starting, then because the medicine has to produce the similar disease. So there is the intensity of the disease, natural disease, then the intensity of the medicinal disease. Because they are similar, so they might produce such a great intensified violent attack that it might even lead to the endanger of life, or even if it does not lead to that, there will be a great loss of strength. The patient will be very weak at the end of that paroxysm. It can aggravate very strongly if we say, if we have to say. So in such cases we have to understand what should be the right time, because there is a paroxysm coming and your medicine is similar to the paroxysm. Medicine going to produce the same kind of symptoms. Okay, it has a tendency to create produce certain same kind of symptoms. So it will be, the magnitude of the attack will be multiplied. But if the medicine be given immediately after the termination of the fit, that is to say, at the period when the apoplectic interval has commenced and a long time before there are any preparations for the next paroxysm, when the vital force of the organism is in the best possible condition to allow itself to be quietly altered by the remedy and thus restored to the healthy state. But if we have given the same medicine, similar medicine, the remedy which we have chosen at the end of the termination of the episode of the paroxysm of the fit, in that apyretic interval, in the interval when the fever or the paroxysm is not there, then it can give enough time to the body, to the vital force to cure the patient of that problem without any kind of aggravations, and the patient can be restored to the healthy state very easily. So footnote to aphorism 236, this is observed in the fatal cases. So this part, it is basically this do not endanger life, that it may endanger life mean. So here the aphorism is about this part. Sorry, aphorism is about this part, that this is observed in fatal cases by no means rare, in which a moderate dose, some cases which are fatal cases where the intermittent fevers are of that kind that the patient is going towards certain death, in which a moderate dose of opium given during the cold stage quickly deprive the patients of health. So just the chill was starting, opium was the right remedy for that stage, and it was given at that time, and the patient, the whole incidence was fatal for the patient and he was deprived of the life. So this has been seen. So that is why Dr. Hahnemann has given a caution, a note of caution to us, that think about in such cases, especially when the patient is in a very sensitive stage, think about when to give the medicine. But if the stage of apyrexia be very short, now there might be some intermittent fevers where the state of health or the apyrexia is very small, very short, few minutes, as happens in some very bad fevers, or if it be disturbed by some of the after sufferings of the previous paroxysm, the dose of homeopathic medicine should be administered when the perspiration begins to abate. So when the last stage, in this case perspiration, it starts decreasing, the point at which it starts decreasing, that is where the medicine should be given. Only if the stage of apyrexia is very small, preferably in the stage of apyrexia. But in such cases where the apyrexia stage is very small, the medicine should be given when the perspiration or any whichever is the last state, it has started decreasing. or the other subsequent phenomena of the expiring paroxysm begins to diminish. Okay, so either the perspiration, because most commonly it is the perspiration which is the last stage, but in some cases where the perspiration is absent, only heat is the last state, or chill is the last state, or even the perspiration is there, but some other state is there, which basically ends the paroxysm. So whenever it starts decreasing, okay, for example, perspiration is coming, it is increasing, the perspiration is coming, then it is steady, the patient is perspiring, then it starts decreasing. So when it starts decreasing, we have to give the medicine at that time. Only in the cases where the stage of apyrexia is very short. So it is only when the suitable medicine has, with a single dose, destroyed several fits and manifest health has ensued. But after some time, indications of a new paroxysm appear. Yes, okay, sorry. So here, Dr. Haniman is basically talking about that it is only when the suitable medicine has, with a single dose, destroyed several fits and manifest health has ensued, but after some time indications of a new paroxysm appear. Only then can and must the same medicine be given. So, Dr. Haniman, first of all, he's giving importance to this part that these kind of fevers, most of the time, they go with a single dose. When the single dose has destroyed several fits and manifest health has ensued. Okay, there were several fits which were coming, there were several paroxysms which used to come, but a single dose of a suitable medicine, it made sure that the health is restored. So in such a case, but after some time, if after some time, for example, few days, after a month, after 15 days, after some time, indications of a new paroxysm appear. Okay, if some new paroxysm comes after some time, only then can and must the same medicine be given again. Okay, only then the medicine, the dose of the medicine has to be given again. So Dr. Hahnemann is saying that we will not need much, and it is a practically seen thing that if your medicine is right, you have understood the whole phenomena of this intermittent fever, you don't need more than a single dose, and it cures very fast. It gets cured very fast. So in such cases, if a new paroxysm comes again, provided always the totality of symptom is still the same. This is the second condition. The totality should be same. If the paroxysm has a new kind of symptoms or a new kind of characteristics, then don't repeat that remedy. Then you have to find a new remedy. Okay. So if a new paroxysm comes but the symptoms are same, then only we have to repeat this dose. Dr. Hahnemann, in the coming aphorisms also, he will make it clear. But repetition of dose is a thing which should not be taken lightly. It is a very important concept in homeopathy that the medicinal dose should be repeated with caution. And all the good homeopaths, they have given this caution again and again. Dr. Kent even write that when you feel that you need to repeat the medicine, wait for few days. When you feel, even if the thought comes to you that I need to repeat, wait for a few days, see how it goes. Take a break, take some time, go to the basics of follow up, how my follow up is going, what is required. If you cannot tick all the possibilities which require the repetition of dose, don't repeat it. Wait. When you see that amelioration is still going on, okay, certain symptoms have increased, but still some symptoms are getting improved, or the improvement is coming but at a very slow pace, wait. I have said that we cannot increase the speed of improvement by repeating the dose or giving a high potency. No, it has to come from within. It is a secondary action of vital force. The vital force has to do, you have no control over vital force, don't have any control over speed. What is in our control is our patience, and that is only thing which we have to control. The impulses should be in our control, the impulse to repeat, that should be in the control of the physician. If you want to be afraid of a result which will come after repeating, when the repetition is not required, this is the thing which the physician should be afraid of. Again, I'm saying, We should be afraid of the result which will come after unnecessary repetition of the dose. That is what we should be afraid of. Okay. This recurrence of the same fever after an interval of health is, however, only possible when the noxious influence at first excited. So, the only possibility of this kind of recurrence after giving a suitable medicine and the paroxysm is gone completely and the health has come back, the patient is completely recovered. So, the recurrence of same fever, the only possibility is when the noxious influence that first excited the intermittent fever still continues to act upon the convalescent. That the noxious, now we have to understand this part. The medicine was suitable because it destroyed the whole disease, it destroyed the paroxysms, and the health was manifested. Patient was completely healthy in the whole term of health. The way health is described, he was completely that thing. It is not that, yes, certain signs of weakness were there, or cough was still, sorry, some symptoms regarding the paroxysm was still there, but very minute. No, not that. That means the medicine might have not been suitable, because a suitable medicine, a right medicine, in this particular part, it will completely remove the disease, remove the disease in all its extensions. So manifesting health means that the disease is completely gone. So in those cases, we are talking that if a new paroxysm comes, then the only possibility is that whatever caused the paroxysm to come in the first time, that is still acting on the patient. As happens in marshy districts, nowadays we don't have much of this kind, because the urbanization has come, and with our intellect we have eroded jungles, we have eroded, the human being, they have eroded trees, and the marshes, they have been filled with uh, uh, anything which we can. So we don't go, and we don't have much of this thing. But yes, in some cases it might come, or there might be some other causation which is keeping up the disease, or which has helped in the reoccurrence of that paroxysm. So we have to take that thing in account also. So, like it happens in the marshy district, in which case a permanent cure is often only possible by removal of this exciting cause, as for instance, a residence in a mountainous area if the case was one of the marsh intermittent fever. So, in that cases, that may become an obstacle to the cure. So, in those cases, we have to tell the patient to move to some other part, because this part, or there is a causation where he's living, that is not suitable for him to get healthy. So it becomes an obstacle of disease, and we have to tell the patient that you must remove this obstacle. As almost every medicine causes in its pure action a special peculiar fever, and even a kind of intermittent fever, with its alternating states differing from all other fevers that are caused by other medicines. So this is the part where which I was talking about when we were talking about antisorics, or like where Dr. Henneman has given that don't give any antisoric. So Dr. Henneman is saying, as almost every medicine causes in its pure action a special peculiar fever. Every medicine in its pure action has a special peculiar fever. So either it is a polycrest remedy, a supposed antisoric or antipsychotic or antisyphilitic, they have a special peculiar fever of their kind in their action. So any medicine basically can act in the state of these intermittent fevers, even a kind of intermittent fever with its alternating states. So they have peculiar fevers, they have peculiar kind of intermittent fevers. All the medicines they have, which are differing from the fevers which the other medicines cause. Okay? They are different in their own style. Homeopathic remedies may be found in the extensive domain of medicines for all the numerous varieties of natural intermittent fevers. So, a homeopathic remedy, a remedy which is similar to the state of that fever which is presented in front of us in the patient. A homeopathic remedy, a similar remedy to that state, can be found in this extensive domain of the medicines. And for a great many of such fevers, even in the moderate collection of medicines already proved on the healthy individual. So, because till that time, the proving of certain medicines were done, but they were still few. Because now we have an extensive collection of medicine and extensive collection of materia medica, extensive collection of materia medica regarding the fevers also. So we can see how each medicine, every medicine has a different kind of fever which they produce and which they have the power to cure. Okay. So coming to that point also, that every medicine has this thing, that they have a kind of intermittent fever in their action, and every medicine at that particular time in that acute stage can act on that patient. So again, going to that part, that it is written not antisorics, means don't use an antisoric approach, not the medicine but the antisoric approach. What is the remedy found to be homeopathic specific for a prevalent epidemic? Okay, so from here the epidemics disease will start. We will discuss it next time, because then the epidemic is a completely different. So till this is all about the intermittent fevers. Okay, so we started with intermittent diseases. We talked about alternating states, how we have to see them, how we have to approach them. Today we have done how we have to approach the intermittent fevers. So I hope there was clarity regarding the distinction, regarding how we have to approach in different cases, and also regarding how we have to approach our study of materia medica, of homeopathy, because that is very important. I always say this thing again and again to my students, to the doctors whom I talked with, that it is very important. Anything, there has to be clarity. Let me talk about one thing. Clarity about what? Clarity about what I'm doing. We need to be very clear about what we are doing. We have to sit, we have to think, we have to think why. How will come? We have to think about why I am doing this. We have to be very clear. Whatever comes to you, it might be something which may not be up to the moral standards. Okay, because sometimes, some things are like, okay, I want it for money, I want to do it for money, I want to do it for social status, I want to do it for that people appreciate me, they thank me. Whatever be, it is just a talk with yourself. It is just what you are, when you are alone, it is the best time that you are talking to yourself, because that talking to yourself can give you clarity. And clarity is very important whatever I'm doing. Okay, even if does not uh, is not up to the moral standards, it is okay, it is for you. It is not that someone is going to give a report card. So be honest with that, that what I'm approaching, don't try to change it. Even if it is for money, I'm doing it for money. You can do it for money and use that money in a good way, for a good purpose, for the help of other people. You can do that thing. If you're doing it for service, very good, do it for service. If you are doing it for um, you know uh, for appreciation, or do it for that, it's okay to do for that. So you don't need to have a singular particular meaning for everything. You will reach there, but right now we have to be honest with our intentions, why I'm doing this. Okay? Because once we are clear about our intentions, only then we can move forward. We have to be very clear. It should be a very clear approach. I am reading materia medica for this thing, I am doing homeopathy or my practice for this thing. I Results might come, you might get what you want, you might not get what you want. That is a different part. What you are going to get is not in our hands, what we are going to get. But at least I should be clear that yes, I'm doing this for this. That's it. Okay, no more, no less. Because when the mind becomes clear, You can think in a more efficient way. Clustered mind cannot learn anything. A mind which is clustered with thoughts, which is clustered with guilt, which is clustered with different emotions, it cannot think. So the best way to do is that clarify yourself that why I am doing this, and just accept it and move that yes, this is for what I am doing. This clarity or this need might change with time, that only time will tell. Okay, you don't need to make a big issue out of it. It is only with yourself. You don't need to tell anyone. It is just with yourself, but you with yourself should be very clear. That is the first thing, which will bring you more closer to the learning part. The more quickly you become clear with yourself, you can easily show your intention with that clarity to your mind, to your work, that this is what I want out of it. So now let's work. If in a certain patient you want that, yes, I want to cure this patient, you have to be very clear that, for example, I told you that when that patient came, that cancer, what I wanted out of it. It was very clear that I had studied some remedy which is very similar to this, and I want to see how it. That is a very clear thing that I want to see what this remedy do. Okay, so and you can try this in anything that anything which you do. If you sit for some time, be clear with yourself. It increases the power of intention. Your intention power, it increases when you are clear, and you will be more uh, you know for example, you have just started, you want to start with a new remedy. Sit before reading remedies, you just sit for 1 minute, 2 minutes, have a talk with yourself. Why I am going to read this remedy? Just be clear about it. I am today going to read sulfur or calcarea carb. Why I am going to? I know many things about sulfur. I know many things about calcarea carb. So why I have opened the book and go to this thing? Okay, though that patient. So you have to become clear. Okay, that patient I thought about calcarea carb, but he was not calcarea carb. So let me see what more I can know about calcarea carb, or just that I want to know something new about calcarea carb, something new about sulfur, or I have been thinking this thing about sulfur, whether it is right or not, I just want to verify. So when you are clear why you are doing this thing, anything, any small thing, why we are doing it, then it becomes very easy for us to approach in that thing. It's a very practical point, and maybe just play with that idea, play along. You can, maybe something good might come out of it. So again, like, we have to find our own ways to do some things. Okay, something might work for me, something might work for you, but again the thing is that we have to reach at the same point. So that is the more important thing, that we have to, if we are into homeopathy, practice is the way to learn homeopathy. So now if some students, they ask me, some new student, I say that start seeing the patient from first year. You have started, see the patient. You might not know the remedy, it's okay, but see the patient, understand the symptoms, how they tell, what kind of ways are there, what kind of words they use. You don't need to prescribe, but see patients. If someone uh, in your family or in your relatives, they ask you, to see them or to consult with you, yes, consult them. You might not be able to give medicine, or you might give medicine according to what we have learned, but at least you will learn from that thing, that what the diversity of the symptoms which the patients possess, the diversity or the intensity of the symptoms which the patient have possessed, the words they use, the way they express that thing, because that is what we are going to need in our practice when we will be in the clinic. Or in the clinic also, we are learning every day when we are looking, like I told you about this case. So I had read about that thing, I had a mental image about, but when I saw, then it became so clear. Okay, this might be, I'm not saying that this is, but this might be uh, that in duration which has been written in that particular remedy. So with that, I will again request that go through these aphorisms, try to understand the intermittent fevers, because nowadays also intermittent fevers are coming, like the dengue, it is a kind of intermittent fever. So in those cases, we have to prescribe accordingly. One more thing I would like to add, that nowadays, because the whole picture is sometimes not available to us, okay, because of the antipyretics, or sometimes the patient they take antibiotics and they take some paracetamol or something like this. So the whole stages are not in front of us. But again, that should not be a case or an excuse. We can ask about whatever the symptoms we can get. If the patient's fever is not intense, request them to at least for one paroxysm, don't take any medicine, let us know the symptoms. Or the apyrexia state, after even the paracetamol has been taken, wait for 1 hour, 2 hour, 3 hours, and then the some symptoms if they start coming, the state of the apyrexia and the state of apyrexia, for some head heaviness of head, some diarrhea sets in, something like this, they can also help us or guide us to know which remedy to give. Okay, so with emergence of these new medications to tackle or control the intermittent fevers, we have to also find some way to work or to prescribe medicine in such cases. Okay, so there are ways, we just have to find, we just have to deal with them, that how we have to understand. So here Dr. Henneman has given us different stages of intermittent fever, how we have to tackle them, when we have to prescribe, what we have to expect out of it, how we have to repeat everything. He has given it very clearly. So again, I request you just go through them once again through these aphorisms, and try to create a mental understanding about this classification of acutes, because it is very important. When we are approaching acutes, there are many doctors which I know which are very good in prescribing for chronic diseases, patient where, but not good in the acutes. They cannot prescribe in a better way when there is an acute fever or an acute condition, because these kind of conditions, it can be a state of, like one example in the aphorism was that it was a fatal stage, because many times there can be some paroxysm or some acute cases which are at a stage, or an intermittent states which are at a fatal stage. If we know when to prescribe, upon which things to prescribe, we might save a life also. So with that, I will thank you and take your leave. And just because this organon is a huge responsibility and huge task. Responsibility because sometimes you have to be very sure, not sometimes, but you have to be very sure that what you are going to say about this thing, it should not distort the meaning in any way. But I will apologize if some mistakes were done, but still we are trying to improve on everything, on every aspect. We all are collectively trying to improve. So it is an effort which we all are doing. uh, all I mean, everyone of you also. So so just to put a fruit to it, that we need to just keep working on it, we need to keep working on homeopathy, we need to keep working on ourselves, so that we can bring a change which we have hoped for, you know everywhere around us, in our countries, in the world. The hope of Dr. Hahnemann, that the homeopathy is supposed to cure the ailing humanity. So for that we have to keep working. It is not a one person's task, it is a collective task of all the physicians around the world. If they take up this task of curing, and it can be done, it can be done. Okay? So thank you all for taking time out of your schedule, and thank you. Have a good night. Today we are here again to continue with the organ part. We have done till aphorism 230 and we will start with 231. Today we will not be doing many of aphorisms, we will be doing only four aphorisms. But these four aphorisms, we will try to understand the depth of these aphorisms because in these four aphorisms, Dr. Henneman is trying to guide us about the intermittent diseases. What are intermittent diseases? How we have to differentiate those intermittent diseases? How we have to classify when a patient comes in front of us, either in acute condition or in a chronic disease? How we have to identify whether this is an intermittent disease or not? And then we have to prescribe accordingly. There are some methods which he have told us. We will talk about that thing. But the main thing is that this differentiation is very important. Like in the last part, we have differentiated between the true mental diseases, the true diseases, mental diseases, which are coming from the physical part. Then there are some emotional diseases. Then there are some diseases which disturb the mind acutely. Then there are some problems of the or they can be called as the mental diseases which are coming from the faulty education and which can be uh, made better without any medicine, with some kind of consolation or some kind of some advices or some guidance. So this differentiation is very necessary because until and unless we don't differentiate what we are have to do or what we are going to do, it cannot become clear for us. We all have been coming to this point in the journey of homeopathy because I know many of the doctors are there uh, who joined some school of thought within homeopathy. They learned homeopathy from that school of thought. So there are some concepts which are still imbibed in us, which we still retain from those schools, whatever they were teaching regarding the homeopathy. In the colleges, there are some students from India. In the colleges, what kind of things the teachers have told us, what kind of the group we have been in, what kind of things we have seen in front of us in those, they shape our thought process, they shape our concepts. So every time when we are doing the organon, I always say that why organon is necessary. The first thing is that we should as a homeopath know whether, first of all, what I have learned, whether it is right or wrong. Organon paves a way. Organon gives us a guidance to understand that till this point, what I have been doing, whether it is right, where I have been making the mistakes, from where I can learn these things and how I can rectify so that my results improve, so that as a homeopath, I improve, my knowledge of homeopathy improves. So today, when we will be talking about this intermittent diseases, there will be few things like we will be talking about miasms, not in a very definite, not in a very diversified way, not in a very not big discussion, but a briefly we'll talk about some things. I will discuss my experience which I had recently after uh, seeing the things as they are given in the organon. So, like I have told many times before also that recently, just before starting this English organon classes, we had class in Hindi, the full series in Hindi. It is on the YouTube also. So we had that also. But when I spoke about these things at that time, and now I am speaking about the same aphorism, about the same things, many things have changed. Many experiences have been added. Before that, when I used to read Organon, so if I compare to that part, because when you are practicing regularly, when you are going through uh, the literature regularly, your own intellect, your own understanding is getting upgraded. So when you are reading the same thing from an upgraded version of yourself, so the things they seem, some things which were not understood in depth, then you go again, then you are reading it again, and then you try to understand that, yes, okay, this is what is said in this aphorism. Okay, this is the what things I have seen in the patient. There I have made the mistake, or there, you can relate those things. So even maybe after 1 year or 2 years, when we will go through the organ again, then again maybe some, because it is an unending, endless source of knowledge. I will talk at the end about something, that will clear more what I'm trying to say. That this is an endless source. You can never reach the bottom of the knowledge which is given in the organ. I personally think so, because every time you find something new, every time you find something new, you go through it. Every time there is something, it comes in front of you, some new kind of knowledge, some questions which you have been looking at. So with that thing, with that understanding in our mind, we'll start with the aphorism 231. So aphorism 231: the intermittent diseases deserve a special consideration, as well those that reoccur at certain periods. So first of all, we have to understand what are the intermittent diseases. Okay. So what are the intermittent diseases? Those that reoccur at certain periods. There are certain periods when the symptoms are there, a set of symptom of a disease is there. Then there are periods where those symptoms are not there. An apparent healthy state is there. Okay. So we call those as intermittent diseases, the diseases or the symptoms which are reoccurring. One condition is reoccurring at certain periods. These periods can be associated with some time of the year, some time of the day, or some day in the week, some months. It can be according to the numbers, or like every alternate day, alternate month, alternate hour. So but there is certain periods when this thing happens. It can be seasonal, related to the seasons. It can be related to certain conditions. But yes, these things, they happen at a certain period. Like the great number of intermittent fevers, we'll talk about it in the aphorism 235 next time, that there are great number of intermittent fevers which come in this category, and the apparently non-febrile affections that reoccur at intervals like intermittent fevers. So first is the intermittent fever, then there are the non-febrile affections. Okay. There are affections, certain affections, for example, migraine, for example, headaches. Okay. They appear after certain intervals. They are appearing after certain days, after a week, after a month, something like that. Okay. So they are reoccurring at intervals like intermittent fevers, as also those in which certain morbid states. Then there is the third category, where the certain morbid states alternate at uncertain intervals with morbid states of a different kind. Then there are two morbid states, two sets of symptoms which are occurring or which are alternating with each other. There are some certain, at time there is a certain state with the symptoms of head. There is headache, there is some kind of congestion of the head with some vertigo or something like that. When it subsides after some time, there is an alternate state, maybe of the stomach. Okay, there is some pain in the stomach, some diarrhea sets in. So these are the alternate states. So they also come under the category of the intermittent diseases. So basically three types. Basically, there may be some other variations under these types, but basically one are the intermittent fevers, where a febrile condition is coming, a fever is coming, Okay, then we will talk about in 235 in detail, where there are certain stages like of heat or cold or sweat, then it subsides, patient becomes normal, then it comes again. Those are the intermittent fevers. Then the recurring non-febrile conditions, the conditions which are recurring, but they are non-febrile. They don't produce fevers, but they come in the same way. They are coming in the same way. They are recurring. They have intervals in between. There is a state where the patient is apparently healthy. Okay. Then third is the different states of diseases alternating at uncertain interval. There is not a certain interval. It may happen like the headache is happening in the morning and next day the patient is having gastric symptoms. Then for 3 4 days nothing is happening. He's in a apparent state of health. Then again one day he starts getting the headache, then again he goes into a state of apparent health, then the gastric symptoms may come in. So there is an uncertain intervals, the intervals are not fixed, there are uncertain intervals, but this phenomena, it keeps on happening. So we call them the alternating diseases, where the different disease sets, where the different set of symptoms, different morbid states, they're alternating. So we'll try to understand more about this. These later means we are talking about the alternating diseases, the last ones, are also very numerous. So they are numerous. There is no end to what kind of state a patient can produce in his being when he is suffering from these chronic diseases. But they all belong to the class of chronic disease. So the first thing we have to understand is that either they are alternating disease, we will come to that point. So first we will talk about the alternating disease. So what we have to understand is that all these alternating disease, they are basically a class of chronic disease. They should not be taken as acute disease. They should not be prescribed as acute at that part. We usually call them that there is episodes. Like for example, a patient comes to us with an episode of migraine. So what to do at that time? Many times the doctors, they just give a bottle of belladonna to take whenever the headache happens. That is like giving a painkiller. I always say that it is better to give a painkiller. Why? Because a painkiller or the allopathic medicine or any such kind of preparation, it is more of a material dose. So material dose will only affect the material body. It will not go more deeper than that. So painkiller is taken, it produces certain phenomena, and the pain is gone. So that is what happens. But the belladonna, it is a more energetic medicine, because we have gone through that preparation, that how these medicines are prepared, and the sphere of action of these medicines. And in the last part of the organ, Dr. Hanneman will talk about the same thing, which I'm just talking about right now, which I'm sharing right now. That that these medicines, they act in a very deep state. At that time the patient might get relief from belladonna, no doubt in that. If it is a headache which has come suddenly, developed suddenly, and there is a congestion of the head, belladonna will act, no doubt in that. But if we are giving numerous doses, excessive doses of such a medicine, it can produce many other symptoms or states in the patient, which can actually affect the patient in the long run. So, homeopathic medicine should not be used as a painkiller or as a substitute. It cannot substitute that thing. It has its own quality that they can cure. Belladonna, when prescribed in a way as it should be prescribed, it will not, it will cure that headache. That headache will not come. That is the action. Aphorism 2, it has to be cured permanently. It has to go away permanently. So, what we have to understand is that we should not prescribe in those episodes for this thing. You know, even if you are prescribing, for example, the patient is coming to you and he is having this, if you are prescribing for that episode, keep it this thing in the mind that this is a chronic disease. I have to give an anti-psoriatic or anti-miasmatic medicine later on, like we have discussed in the part of the acute mental diseases, when they come as an acute attack for the first time they have developed. But if even the alternating diseases, if a patient is coming to us that the symptom has been going on from a quite long time, the best way is to go for an anti-miasmatic medicine for the constitutional medicine of the patient, because they all belong to the class of the chronic diseases. They are generally a manifestation of developed sora alone, sometimes but seldom complicated with a syphilitic miasm. Now, this part we have to understand. So, they are basically developed from the sora. In the mental disease, all through, Dr. Hahnemann has told that this is a development of sora. Okay, that was fine. Here, he has added something that seldom, not every time, but seldom. Seldom means rarely, sometimes. It may be complicated with a syphilitic miasm. Means most of the time, the alternating diseases are also a part of the developed sora. Most of the time. But sometimes you have to keep that thing in mind that it may be complicated with syphilitic miasm. Recently, I have been studying about this psychosis and syphilis from some time. I have been doing practicing it in the clinic also. Last time in the Thailand workshop, I shared some of my experiences and how we have been approaching it in a wrong way, and how Dr. Hahnemann has actually given it in a very beautiful way that how it should be practiced. So I was talking at that time about Merck's soul, that how the Merck soul picture it should be understood. Syphilitic miasm or psychotic miasm, they are the miasms which are coming from the venereal diseases. Somewhere in the life, someone had some venereal diseases, some sexually transmitted disease, and from there this thing started. Although there is a very long explanation to that thing, I will not go into that because then we will be off the topic. But in those cases where a person has been affected by syphilitic or psychotic miasm, okay, we maybe in future very soon we can have an online lecture about psychosis and syphilis. We will talk about that so that we can understand more, because these things have to be, because many times when you see in the clinic, you have been given a good constitutional, you have complete confidence in the medicine, and it is removing certain parts, certain symptoms, they are being removed, they are being cured, but one part, one some part is there which is being left uncured, untouched by a very rightly selected soric anti-soric constitutional remedy. The part is not even being touched by that medicine. So somewhere you have to keep in mind that that might be due to the psychotic or the syphilitic miasm. That is not, I am being very clear that that is not always the case. Sometimes we have a wrong selection of medicine. Okay, it may be due to the wrong selection of constitutional or antisoric medicine. So there we have to differentiate again whether it is how we have to differentiate. We will talk about that when we will talk about psychosis and syphilis. But we have to differentiate that, okay, this may be due to that thing, or maybe because my prescription is not right. Okay, because when prescription is right, like we have talked about it, that the patient starts feeling generally better. So if that generals they start becoming better, then somewhere we have that thing in mind that okay, the prescription may be right, but there might be some other hindrance. Then we start thinking about this part, this syphilitic or psychotic miasm, and then we have to verify it. You just cannot, there is no scope of speculation in homeopathy. We cannot speculate. We have to be very certain. Either we have to verify from the patient. Many times the patient, for example, I have told about one of the cases of a lady who came. She had this inflammation in the eye, a very bad inflammation, which then the eye necrosed after the inflammation, and the surgeons, they have to remove the eye, the whole eyeball. It has to be removed. It was not metastatic. There was nothing like, but it was very severe. And then the problem started in the left eye. So when it started in the left eye, someone recommended her to take homeopathy. She came to us in the clinic, and when I saw the whole process, how, again, we will talk about that thing later. I'm not going again into that, because there are certain symptoms which can guide you, which can they can tell you that this might be a syphilitic miasm or a psychotic process is going on. There are certain symptoms. So those symptoms, they were guiding that there has to be something like this, because it cannot come like this. The sora does not come like this. So when I asked her that, okay, something like this, some venereal diseases, some symptoms, there are few urinary symptoms, urinary infectious symptoms, which she told about, the rashes. Uh, but again, it depends upon how the syphilitic symptoms will come, or the psychotic symptoms they start. There is a very different way about that thing. There are many different stages which we have to talk about, which we have to understand about this miasm. So she told, and I had this, that she did not had any of this affection directly. She was not the primary person who got affected. So then I started inquiring about the husband, that your husband, did he had any of these symptoms, like the basic symptoms of syphilis, and some chancre or some itching or something like that? And she told no, he has never complained about this thing. But still I was, that no, somewhere, because sometimes those things, they point you, when you are going through those things again and again, when you have seen those things again and again, then there is an idea which is built that yes, this can be that. So I went with the some antisyphilitic medicine which was suited to for her. We gave her that medicine, and she started getting better. All the symptoms of the inflammation, they were completely gone. She was losing the vision from left eye, which came back. It was reversed. She got better regarding her this thing. Then when she got better after 3 or 4 months, the husband came for his treatment, that he also wanted to take treatment. And then I started talking to him. He started telling his history. First of all, he told that I want to have privacy. I don't want anyone in the clinic. He told his wife to sit out. He started telling me. And then he came to this point that I also had extramarital affairs in my office. And he talked about it, that, that I had this thing. And then it suddenly struck me, although that thing was in my mind that I wanted to ask him. Then I told him that, did you had these kind of symptoms? He said, yes, I had these symptoms, and but I got treated. I immediately I took the treatment for it, and those all symptoms are gone. So this is the state of latent syphilis. Syphilis also has its latent stage, like the latent sora. So okay, I gave him the medicine again. I started with some antisyphilitic for him, and then that was a. And then after 1 or 2 months, he was trying to apply for a visa to Canada, where you have to get yourself medically checked up, and you have to go for that uh, this STD, the sexually transmitted diseases. They have to check for those virals, and his syphilis came positive. So in such cases, if recently also I had one such case of brain tumor of a lady, in which this whole thing started with this thing, and she is getting better with Merxol. So there are many cases which are coming, which, because now the understanding has opened for this thing. So, but again, coming to the aphorism, back to the aphorism, that many times these alternating diseases, they may be complicated with syphilitic miasm, which we have to verify first, either through the symptoms, the other symptoms, the history of the patient, or through direct questioning to the patient whether any kind of this thing has happened to him in the past, or presently it is happening, or something like this. So therefore, in the former case where it is only developed from the sora, may be cured by antisoric medicines. So in the former one, it can be cured by the antisoric, which is homeopathically suited for that patient. In the later, however, in alternation with antisyphilitics as taught in my work on the chronic disease. So, but if it is has something of the antisyphilitic miasm, syphilitic miasm in this alternating disease, then we have to alternate the antisoric and antisyphilitics, which he's saying that as I have told in my chronic disease. We'll talk about that again. I am maybe because I I have told this thing earlier also, that I many times there is some students also here present who have asked me to start a series or lecture on chronic diseases, and I told them that we will start. Why we have not started is because I want to be very sure about what I'm speaking. I just don't want to read through the book or just tell. I don't want to translate what is written. Okay, that translation will not be, I don't think it will be an effective thing. I want to be very sure about how this thing happens. And like I'm told that from past few years, I have been seeing such cases, and I have started speaking about that thing, more about syphilitic miasm right now. I will not talk about psychotic yet, because I'm still gaining that kind of experience, or I am still uh, I have to see those kind of things happening. Then I will speak more about it. But yes, antisyphilitic, I will very soon will speak about both the miasms, but how to prescribe the antisyphilitics, or how we have to understand the syphilis part, that we will talk about very recently. There are many books on the miasms. There are many literal translations. There are many translations where the miasm has been shown in some other light also. Uh, Somewhere the meaning was same. However, someone understood, they wrote about it. But again, like the organon, we should go to the chronic disease to understand these miasms as they are supposed to be understood. So we will take the excerpt, because whole book reading will not be possible. But we will take the excerpts from the, we'll take some portions from the book, and we will try to understand. And I will, after we have done that thing, I will tell you now that you have to go through the symptoms. These miasms, the syphilis and psychosis, they, you can only ask questions about that thing once you have gone through the symptoms, when you have understood the picture of the symptoms which they produce. It is different from the psoric miasm. It is different from the chronic diseases which are coming from the psoric miasm. Okay, so that is why Dr. Henneman, he always refers, wherever he talks about the miasms in the organ, he refers to his book on chronic diseases, because that is where he has given the whole explanation. So we'll move to the second one. But here we just need to understand this thing, that there is a group of alternating diseases which is part of the intermittent diseases, which are coming and going. They are coming and going. One set of the symptom comes, then the other set of the symptom comes, and the other set of the symptom comes. So there are these alternating diseases, which most of the times are manifestations coming from the psoric miasm, but sometimes it can be due to the syphilitic miasm also, the complication of sora and the syphilis. So footnote to aphorism 232, Dr. Henneman, he gives certain examples. Two or three states may alternate with one another. So there might be two states which are alternating. There might be three states also in certain patients. Three set of symptoms, three morbid states which are alternating. Thus, for instance, in the case of double alternating diseases, certain pains may occur persistently in the legs. For example, where the two diseases are alternating, two set of symptoms are alternating, two states are alternating. There is an example that there may be a persistent pain in the legs for few days, like 4 5 days the legs are paining, etc. There might be some other symptoms immediately on the disappearance of a kind of ophthalmia. So there was this ophthalmia which was going on from past 1 week, suddenly it disappeared, and the pain in the legs it started, which later again appears as soon as the pain in limbs has gone off for the time. And as soon as the pain in the limbs go away, the pain or the ophthalmia it will come back. So convulsions and spasms may alternate immediately with any other affections of the body or some part of it. There might be, like, for example, there is convulsions going on or spasms in the body going on. When they get better, the patient might suffer from some kind of urinary complaints or some kind of diarrhea or some kind of gastric complaints. As soon as that gastric complaint or that thing becomes, the convulsion or the spasm may appear again. In a case of threefold alternating diseases, where the three um, uh, diseases are alternating, in a common indisposition, periods of apparent increase of health and unusual exaltation. So, with physical some alternation, there might come a state where there is apparent increase of health. A person is unusually exalted, unusually happy, unusually energetic, unusually active. And and unusual exaltation of the corporeal and mental power, the physical and mental powers, they have exalted. Okay, they have increased. Extravagant gaiety, very cheerfulness, extraordinary activity of the body, excess of comfortable feeling. He is feeling too much comfortable in his body. Inordinate appetite, an appetite which is good, very good, etc. So these kind of symptoms may occur, after which, quite unexpectedly, gloomy, melancholy humor, intolerable hypochondriacal derangement of the disposition. And suddenly he may alternate back to the sad state of the mind, a gloomy state of the mind, or a hypochondriacal state where he is too much anxious, sad about his health, with disorder of several of the vital operation, the digestion, sleep, and etc. So the sudden that excess of comfortable thing, the excess of health, it may suddenly derange into a very bad health. Appear which again and just as suddenly give place to the habitual moderate ill health. So that excess of increase in health will give alternate into a habitual moderate ill health. And so also so even there can be the various degrees, intensities. For example, very healthy, okay, one state very healthy, very sick, and then a little bit sick, a third state. Okay, the symptoms of sickness are there, but now less intensity. That is also a state. Certain symptoms are gone, certain are remaining. So the patient is basically going through all these things. And many times we see this thing happening when a person is basically going from a chronic disease, or the sora has been manifesting from a long time. These kind of states they happen. Nowadays, many these states they are not very clearly seen because of the medications which the patients are taking regularly. So somewhere we are not able to state them, see these states quite openly because of, because nowadays there are medication for anything, for everything. Okay, to keep that thing in check. There are medicines for pain, there are medicines for the gastritis, there are medicines for the infection, there are medicines for the, so everything is checked. But still, through the checked state, we have to ask in the history that what happened, how frequently this thing happens, then what happens once you are okay, you take the medicine, then what happens. And from there you can get a picture or an idea of the alternating diseases or the intermittent diseases. And so also several and various alternating states. So there are various alternating states, there are innumerable such alternating states. When the new state makes its appearance, there is often no perceptible trace of the former one. So, in this alternating diseases, when the new state comes, the old state or no perceptible trace of the former one is there. You cannot see that thing there. That set of symptom is completely gone, and this state comes. And when this state goes away, no symptom will be left, and the old state will or the other state will come in. In other cases, only slight traces of the former alternating state. But there will be some cases where slight traces of the previous state is still there. For example, patient had a pain. Pain is coming from the cervical region, radiating in the whole arm and numbing the hand. There is a numbness of the hand. So when this state is there, there are symptoms of the pain, a radiating pain with the numbness, with the stiffness. Okay, the patient feels weak in the arm. Then suddenly this state goes or this state goes away, and some other, for example, the headache came. This is an example. So the headache starts getting worse, and this starts getting better. But the patient still complains of the numbness and weakness. The pain is gone, but some trace of the former this thing that still, doctor, I feel that the numbness is not completely gone or the weakness is not completely gone. So there might be some traces, or it can completely go away, and the other alternating disease it may come. Few of the symptoms of the first state remain on the appearance and during the continuance of the second. So some symptoms they remain of the first when the second, the other alternating state comes. And when the first one comes, there might be some symptoms of the second state. For example, the pain comes back to the arm, and there might be some dullness of the head, some heaviness of the head. The pain is not there, but there is some this symptom which is still there. Sometimes the morbid alternating states are quite of opposite nature, and sometimes the morbid states are completely opposite. For instance, there's a period of sadness, of melancholy, alternating with gay insanity or frenzy, with too much cheerfulness. Completely opposite states. One state is of complete, which we call as the bipolar states also, that there are two poles, completely sad, dejected state, and then completely cheerful and vivacious state. So there are numerous alternating diseases. What Dr. Hahnemann wants to say is that there are numerous alternating diseases, and you cannot put a number to it that only this will define an alternating state. Anything, this is up to the physician to decide to characterize that this is an alternating disease and this is an intermittent disease. This is he has given the examples, he has given us the definition, he has given us the differentiating points. Now it is up to the physician that he has to make this decision that this my particular patient is basically having this particular uh, this particular state of this alternating disease or the intermittent disease. 233. The typical intermittent diseases are those where a morbid state of unvarying character returns at a tolerably fixed period. So the typical intermittent diseases are those where the morbid state of unvarying character, the character does not vary, it does not become different with each episode. So that unvarying character, it is not varying. Okay. It returns at a tolerably fixed period. Okay. Tolerably means, okay, this state it comes after 1 week. Okay. Not 1 week, 10 days. This time it came after 10 days. Last time it came after 1 week. Then again after 7 or 8 days. So there is a tolerably fixed period which we can understand that, okay, it comes like this. Most of the time, when you ask the patient that how frequently you get a headache, doctor, every 12 to 15 days, I like twice a month, or so there is a fixed period, thrice a month, twice a month, there is a fixed period. The character of the headache, it is unvarying, it is same every time. So we call that this is a typical intermittent disease. Whilst the patient is apparently in good health and takes its departure at an equally fixed period. So there is an apparent period of good health in that period, in that fixed period, and then he takes its departure, means from health to that state of disease, he comes at the equally fixed period. This is observed in those apparently non-febrile morbid states. So this is more seen in the non-febrile morbid states, not the fevers, but where the fever does not come, like I am telling you, giving you an example of headache, and go in a periodical manner at certain times. So sometimes they also go in a periodical manner, every 7 days, every 10 days, every 15 days, once a month, as well as in those of a febrile character, to wit, the numerous varieties of intermittent fevers. And also in the intermittent diseases, especially the fever ones, the febrile character, where there are intermittent fevers, there also you will see this periodical manner. You there also you will see that there is a period of health in between, either of few hours, like for 2 hours, 3 hours, he has healthy period, then the chill starts or the heat starts or then the sweat comes. But still there, you will always find that there is this uh, apparent state of health, a period of health which comes in between. So those we call as the typical intermittent diseases. Those apparently non-febrile, typical periodically recurring morbid states just alluded to, observed in one single patient at a time, they do not usually appear sporadically or epidemically, always belong to the chronic disease. So with this, Dr. Hahnemann concludes this thing, that all these kind of non-febrile symptoms, the typical non-febrile symptoms or the periodical recurring states which are coming, which I have told, alluded means already spoken of, which we have already spoken on in the previous aphorism, they basically belong to the chronic diseases, mostly to those that are purely soric. Okay, again the same thing like the ordinary diseases, mostly soric, are but seldom complicated with syphilis and are successfully treated by the same means. So they most of the time they belong to the chronic miasm. I will I'm not trying to complicate the things by telling you about syphilis or psychosis. When we are learning, we are taking steps, we are ascending the steps. So these are the next steps. But that does not mean that everything which you have learned or till now, it goes down to zero, or that will not be effective until and unless you know about the psychosis or syphilis or how to treat them. Don't take it like this. Okay. Dr. Hahnemann, many other authors, they have come to this thing again and again, to this truth, and they have agreed with Dr. Hahnemann that more the people who understood miasms, the people who know what the miasms is, that the mother is Sora. Even syphilis and psychosis, they cannot come without Sora. Yes, in certain cases, there is a specific way. I don't want to put a number to it. I don't want to put like, okay, 90% cases, 80. No, I don't want to. But the word is mostly. That mostly are purely storic. So there is no need to go into this kind of thinking, that because many times when I tell something, then sometimes it strikes to the mind, okay, that is why I'm not getting my result, because I don't know about psychosis or syphilis. This is not the case. Even if you don't know about psychosis, if you don't know about syphilis, you have a patient who has this complicated miasm in him, you are prescribing a right antisoric, a right constitutional remedy, the person will start getting better. If it is right, they will get better. So you don't need to it is just the next step in understanding. The next step. Okay. So you don't need to complicate it. Whatever you are doing, that is right. You have to understand the follow up in the same way. You have to understand whether your medicine is right or wrong. That is the first step. The constitutional medicine or the antisoric which you have given, whether it is right or wrong, the follow up will tell us. Okay. If it is right, go with it. If it is wrong, change it, go to a more specific one, go to the more take give the medicine which is more similar to the whole scenario of the patient. So if our prescription is wrong, that is told by the symptom, that is told by the patients. We have done the Kent's Dr. Kent's observation, the 12 observation, they are a guide. Herring's law is a guide. So those things they tell us that where the disease is moving. Okay. So this is for certain cases, few cases where something is happening, and this does not uh, like the brain is always asking for something, that okay, if this thing is not working, then there might be something which I don't know. So don't go to that point. Just understand that most of the diseases are from the psoric miasm. They have to be given a constitutional remedy, an anti-psoric remedy, and they will get better. That is the true part. Okay. But yes, now we have to refine our knowledge. We have to take a step ahead from where we have been standing. So there comes the knowledge of syphilis and the psychosis. Okay. But still, with the syphilis and psychosis, you will again need an anti-psoric constitutional remedy, which might be alternated, which might be given in stages, okay, to cure that case. So only antisyphilitic or anti-psoric psychotic, it is not going to cure the case because it is basically based on sura. Okay. So I'm just telling you this, that not complicate that thing in the mind. Just it is very clear thing. It is a very plain thing. Even if you don't understand psychosis, syphilis, it's okay. You have to just keep doing your practice. You have to keep giving medicine as the way you were giving. Okay. With time, these things they will come to you. If you are a seeker, if you want to know, these things will come to you. You will understand them. You will see them in your patients. You will start prescribing them. Many things they have to be understood with time. You cannot rush them. Okay, they come with time. They come with our own intellectual evolution, with our own spiritual evolution also. I will use that word also. Okay, not like you have to meditate, but yes, when you are learning, I will talk about that thing in the end because that is what we need to understand. Let's just finish the aphorism first. Yet it is sometimes necessary to employ as an intermediate remedy a small dose of a potentized solution of cinchona bark in order to extinguish completely their intermittent type. Now, this is something which we can add. Intermittency, this alternacy or the intermittency. Sometimes the word is sometimes again. Please give importance to these words. Yet it is sometimes necessary, not all the time, not every time, because few doctors when they, you know, in the past also, I have seen many materia medica books. Like there are so many things which are going on or told, which basically make the homeopathy very superficial science with respect to all the doctors, all the homeopaths all over the world who have been there, who are there now, they are all striving to do homeopathy. They are doing homeopathy from their heart with love. I know that. But again, it comes down to our knowledge. What kind of knowledge we have, what kind of exposure we have got, what kind of experience we have got. I have heard this thing from many doctors, many doctors, like they will ask that, is it necessary to give Nux vomica before you start a case? Or is it necessary to give sulfur at the end of the case? This is a very superficial understanding. These all concepts are coming from neglection of these kind of words where it was written sometimes, not always. Somewhere it was written there, but the reader or the practitioner, he or she ignored that part and jumped to the conclusion that intermittent diseases means China, Cinchona bark. This is not there. Dr. Hahnemann, he, like I have told, that he is a person who believes in telling everything, all the experience he has shared with us. So in that experience, there are some times. There are things which happened sometimes, which were effective sometimes. He did not ignore them, that it has affected sometimes, so I should not write it. He wrote about those things also, which happened sometimes and gave good results. He wrote about those things, but he added the word sometimes necessary. So, in all the intermittent diseases, China will not help. It does not help. The people, the doctors who have been doing homeopathy from a long time and they have prescribed in such cases, they have, I have seen, I have tried, I have done in with my patients out of many times in the initial practice when you are not trying, when you there is a certain case of intermittent fever going on, you are not finding a remedy. The first thing comes to you is to give China. Okay, done that, learned from that, it does not work. Okay, so sometimes, yes, in certain cases where you are seeing that the symptoms are going away, but the intermittency is not going. Symptoms have become less intensified. Uh, uh, they have become, that you can see that the medicine is working, but the intermittency is not going. The episodes are still coming with few symptoms, with very less intensified states for a small period of time, but the intermittency is not breaking. In those certain cases, you might need China in order to extinguish completely their intermittent type, because whatever the medicine we are giving, it is not able or it is not sufficient to break that intermittency. Again, you have to understand this thing, that whatever remedy is right for that state, okay, if it is right remedy, the symptoms have to diminish in such a case. The sometime case, the symptom has to diminish. If the symptoms are not diminishing, no apparent amelioration is coming, that simply means that the remedy is not right. And most of the remedies, if you go into the repertory, if you see the intermittent fevers, you see all the polycrest remedies there, that they have the power to break down this intermittency. But then there are certain states, there are certain symptoms, there are certain constitutions. When you are giving the right remedy, the medicine is able to decrease the intensity, it is able to decrease the disease of the patient. But the intermittency, the episodic, sometime, some symptom or some few part of the symptom. For example, I told you that this, we'll take the same example, the headache and the numbness. Now you give certain remedy and it decreases the symptoms to, like, very no headache, no pain at all, just slight numbness sometimes in the hand. And after, when it is better, or it decreases, a slight heaviness in the head, but it keeps on coming. You have given the remedy again, you have repeated the dose, you have given the high potency, but this intermittency is still there somewhere. There, the China will cure the case. It will break that intermittency, because now the symptoms are subsiding, the disease is going away. Only thing which is holding down the disease is the intermittency, that tendency of intermittency in the patient. So that tendency of intermittency, there the China is helpful. Okay, so again, because we have to understand carefully this thing. So don't take it that every intermittent disease or everything the China has to be given in the end or in the starting or in the middle, or if the medicine is not working. If the medicine is not working, Dr. Kent's observation says the medicine does not produce any change, it's the wrong medicine. If it does not produce any change, then you have to see a new medicine. So this is about the intermittent diseases. Okay, so we have to understand the classification and we have to understand that they belong to the chronic miasm of Sora, but again, sometimes, seldom complicated with syphilis. Okay, so with that, we will conclude the part of the aphorisms. The thing which I was talking about earlier, this thing about, that when I was saying that you have to be evolved, anything which is true, like which is true to the experience. I'm not saying true in the meaning of knowledge or how many people have verified it. If 10 fools verify something, that does not make it a truth. If 10 liars verify something, it does not make it true. So that verification, that thing does not make a truth a truth. What is truth is what is experienced. I have told many times that uh, take these words of the organon as they are written, try to apply. When they give you result, when they show themselves to you that yes, this is how it is working, then they become true. Then they become a truth for you. When something happens in front of you, then it becomes truth. So the regarding the evolution as a human being, evolution as a homeopath, especially because we are dealing with that kind of science, we are dealing with that kind of part of the universe or the world. We have to, we have always, we should not be students. There is nothing to know in homeopathy. There is no knowledge in homeopathy. Any true thing which is there anywhere in the phenomena of the universe, there is no knowledge. There is nothing to gain from the books. So you cannot know. For understanding it, for feeling it, for experiencing it, you have to seek. There's a difference between a person who is seeking truth and who is seeking knowledge. Knowledge is very easy. Knowledge is very easy. You take a book, you memorize it, and you are knowledgeable. You can talk about certain logics, you can talk about certain reasoning, and you are a knowledgeable person. There are so many people who are knowing in this world. But truth is something different. It can only be, cannot only be known, it has to be felt, it has to be experienced. Because some things which are there in your experience, some things which you, that is why I always say that materia medica cannot be learned, it cannot be known. You have to experience it. Only then those symptoms, those things, they become true to you. Recently I have encountered, I'm just giving an example, encountered, I have been reading fluoric acid from past 15 years, more than 15 years. Even I have attended lectures of my father when I was a uh, in 8th class, ninth standard. From that time I might have been listening to fluoric acid. I know fluoric acid. Theoretically I know fluoric acid. But fluoric acid became true to me, for me, from past few years when I started getting results in cases which show the true potential of that second aphorism, that how the cure has to happen, that ideal cure. Then the fluoric acid became a truth for me. So there is this difference which we have to understand as a homeopath, that knowing, yes, we have to know because I have to listen about fluoric. But then there has, we are not the person, we should not stop there, that okay, now I know about fluoric acid. Yes, you know about fluoric acid, but you don't know the truth about it. You have the knowledge of the fluoric acid, we have the knowledge of some certain things, of certain aphorisms, but are they true to you or not yet? The truth has to be seeked. We have to be seekers of the truth. uh, I'm just going to take a little time because this is a very essential thing which has to be there in a homeopath. And recently I had a discussion with some of the students that how we can understand homeopathy more efficiently. So to understand efficiently uh, homeopathy, especially in this particular scenario, because we are practicing homeopathy, and in general in understanding the other things, we have to understand what we are seeking, what we are going behind, what we are trying to find. Okay, so if the aim is to seek truth, then I think it presides everything, it is above everything. When you are seeking truth, you will be more truthful to yourself, you will be more truthful in the approach which you are applying, you will be more truthful to the mistakes, we will be more truthful to the learning, to the understanding, because knowledge and experience, they are completely different things. I will just give you a story, an example. We all know about a very famous poet Rumi, a Persian poet Rumi. Before becoming a poet, he was not a poet. He was not poet from the starting. He did not knew anything about the poems, he did not knew anything about what he has been telling later on. But he was a scholar. He was a very, very great scholar, an Islamic scholar who gave lectures, who gave sermons. And at that time, we are talking about, around maybe 1,000 years back or 1,200 years back. At that time, people would travel from thousands of miles to listen to him because he had great knowledge. He had a big library of books. He would read from there. He would give sermons. He would, but when you listen about his what he has written about his earlier stages, that he was never satisfied with whatever he was talking about. He knew that okay, this is the knowledge which I have read, but somewhere, the truth I have not experienced. That is the seeking part. If we become okay, I know everything, you stop there. There is nothing more to search. So but even you are searching continuously for something, you are continuously searching for the answers, you are continuously searching for what is true, then they start appearing in a way that you see them. So he was a seeker, and fine day his teacher appears. His teacher who took him from a scholar Rumi to the poet Rumi. And the more important thing was his this teacher. He was Shams Tabrizi, the teacher. And more important was that Shams was not a poet himself. He was not poet, but he taught him something which made him a poet and a person who has illuminated lives. The poems which has illuminated the lives of many people, who have shown the way to a new culture, who have shown the things in a very different light. So I'm just giving this example because the person who is practicing homeopathy for the whole life, he's on that path. He's always searching, he's always seeking the true nature of the disease, the true nature of the medicine, the true nature of what is being presented in front of me, the phenomena which is being presented in front of me, how I can heal it. So there are always these questions which are going on inside us. But the main thing is to be on that path. That, you know, even when you're going through the aphorisms, I always request you that during the week, just go through these aphorisms once again and try to understand each word, how they are written, what does Dr. Hahnemann mean to say. So there will come as when you are going through again and again with this manner that you want to seek the truth, uh, one day it will come that you will feel that you are getting the answers from the same text which you have been reading again and again. You're getting all your answers because recently Dr. Jonkol, because we always keep having some discussion that some of the doctors, they want to understand how to read materia medica, so that because yes, the ultimate purpose is that the knowledge should come to us from within ourselves, from what we are doing. Okay, someone can show us the way, but after the way is shown, it is us who have to walk on that path. That teacher or the master, he cannot walk for you on that path. The master or the teacher, he can just show you that this is the path, these might be the obstacle, this is what you might experience, this is what you might go through, but you have to walk on it. So I always say that for this to come in that kind of understanding, that it should go deep in us, the homeopathy as a science, as a subject, because we say that homeopathy is science and an art. Art has to be felt. There's a painting in front of you. You cannot tell that how much red color is used, how much yellow color is used. I cannot tell you about a painting by describing from my words that there was a red color in that, there was an orange color in that, there was a yellow color in that, some part of that was white, some. I cannot explain to you. If I say that there were clouds, there were rivers, there were hills, it is a very vague description of that. Art has to be felt. It has it The true nature of art comes when you go deep into that thing, when everyone cannot understand art. That is also the thing. Why? Because they don't have that kind of soil, because they don't have that kind of what you say, a mental or a spiritual way of looking at art. There are four persons who are standing at a place and they are seeing the mountains in front of them. The one person is okay with it, and there is one person who says wow. So that wow person is the one who came very close to understanding that thing which was in front of that thing. So anything which is art, anything which is natural, anything which is like that, it can only be felt. That is why I many times I have to say this thing, that homeopathy cannot be understood from a material mind. It comes very difficult to a material mind. The people who completely understand the material world and they don't have any you, even in your patients you will see this thing. The people who are very materialistic in their approach, who completely are relying on the material world, they will very rarely come to homeopathy. Okay? So many times I say this thing also to, that they do not believe. Like someone tells me that, I have told them that to come to homeopathy, but they do not believe. So I always say that, okay, when, somewhere there, they will be fortunate enough to come, then they will come. Because that is also a part of, sometimes around this thing. Okay. So the main thing is that we for to understand homeopathy, this is a main thing, that we have to be seeker of the truth. We have to have this thing in our deep in our disposition, deep in our mentality. We have to define this purpose, that yes, I am here to seek the truth. I have to understand the truth about my patient, the remedy, I should not. That is why Dr. Hahnemann many times write that do not speculate, do not theorize. It takes you away from the truth. So we have to incorporate that thing, that feeling in us, that I am a seeker of truth. I seek truth, and the truth will come to me from the same things when I read it, when I understand it. Same is with materia medica, same is with the organon. Okay. Once you have this thing in your mind, you sit calmly and it starts appearing in front of you. This time in this week, go through the same aphorisms with this thing in the mind. Slightly meditate on this thing, just 5 minutes, that I am here for this thing. I just want to know the truth about this thing. What is there? I'm not trying to remember it. I'm not trying to memorize it. I'm just here to see the truth. And you will automatically see that this thing will start coming. It feels like, that is coming down in you, all this part which is written here. You will see a very small difference in the words. You will see the sometimes more, seldom more in the whole aphorism. Okay. So those differentiations, they start coming. So with that, I will take your leave. Very good night to all of you, and keep learning. Thank you. We will start where we left last. I think we have done till aphorism 220. So we were doing this mental diseases, the one-sided diseases. So we'll continue with that part. So till now, Dr. Hahnemann has given us a basic principle on how to deal with the mental diseases, the psychological disorders. He will give more finer points in the coming 10 aphorisms. We will try to do from 221 to 230 today. 10 aphorisms we will try to finish. And he will give some fine points on how to deal with different kind of diseases in the same group, in the same mental diseases part. So we will start with aphorism 221. So if however insanity or mania, so we have been doing all those the reasons for the psychological disease, psychiatric diseases, how the mental diseases they come up. So till now we have understood that there is somewhere a physical phenomena, a phenomena of the physical disease, which has transferred to the organ of the mind. So it has been a process which have been going on from a long time. There have been few symptoms which have been seen regarding this phenomena, which may be part of disposition, which may be part of behavior, and they have now increased in this specific mental disease. Then we come to the second part. If, however, insanity or mania caused by fright, vexation, or the abuse of spirituous liquors, etc., have suddenly broken out as an acute disease. So, in some cases, this insanity or some kind of mania, it can also suddenly break out like an acute disease, because of some kind of causations where there can be fright, where there can be some kind of anger, where can be some kind of excitement. Because of that, sometimes this acute episodes of insanity or mania, they may break out in the patient's ordinary calm state. So I can recall a case of one of my known people. She works for me in the and this. Suddenly, I got a call from the clinic. I was on a holiday. It was a Thursday, so I had not gone to my clinic. So suddenly, I got a call from one of my assistant doctors that this particular person, she has gone into some kind of attack, into some kind of episode where she's not able to listen. She has just closed her eyes and she has started scratching herself. So there were two or three students who managed to get her and this get her on the sofa. They made her lie down, and then I reached the clinic and I saw that she, her eyes were closed. She was doing and she was scratching herself continuously, the whole body. She was scratching herself. So out of nowhere, the student, they told me that we were just talking and suddenly this thing started. So even some kind of mental disease or some kind of delirious states or some kind of insanity or mania, they may also come in the acute states. So what we have to do at that time is, although it almost always arises from the internal sora, the cause is the sora, no doubt, but it comes like an acute disease, like the other acute diseases also. When we have done this portion of the acute diseases, where we have done that sporadic one or the individual ones or those things, they all arise from the sora. The cause is always sora, but it is like a first time, or it is like sometime, a long time before it has happened and now it is happening. It comes like an episode. So like a flame bursting forth from it, yet when it occurs in this acute manner, it should not be immediately treated with antisorics. So, what is the important thing to understand here is that when it comes like this, like any other acute, the way we approach the other acute diseases, it should not be treated with the antisoric or a constitutional medicine. We have to see what are the current symptoms, what is the characteristic of a current symptom, and then we have to prescribe accordingly. But in the first place, with remedies indicated for it out of the other class of proved medicaments. For example, aconite, belladonna, stramonium, hyoscyamus, mercury, etc. So we have to treat it as an acute disease, and whatever state is being present, like in that girl, there was this scratching, which was she was doing. And this is a very characteristic state of belladonna. Now that uh, person, she is not belladonna in a constitutional state, but that acute state was agreeing with that picture of belladonna. So she was given belladonna. We rubbed on her wrist, around her mouth, and I think within few seconds, she started coming back to her conscious state. She stopped doing that thing. She started, coming back to that state within few seconds. So, in highly potentized, minute homeopathic doses, in order to subdue it so far that the Sora shall for the time revert to its former latent state. So, what we are doing is we are giving an acute remedy in such a state so that we can take back the patient to that former state of Sora. This medicine is not going to cure Sora. This medicine is not going to cure her completely. But yes, she will be sent to that latent state, the latent state of the Sora. So, to its former latent state, wherein the patient appears as if quite well. Now, Dr. Hahnemann, like I told you, that he chooses his words very carefully, wherein the patient appears as if quite well. That is the latent state of Sura. When we appear, everyone appeared to be quite well. We appear, we are not well. That is not a state of health. There is a latent stage of Sura which is going on. And Dr. Boeing Hassan, he basically writes a very beautiful line in his lesser writings. He has, in one of his essays, that this latent state of Sura is the state where the mental symptoms are more prominent. The behaviors are formed, the habits are formed, a kind of disposition of a person is being formed in this latent state of Sura. So it just shifts. It shifts to the other part. So because there are no physical signs, no physical symptoms, the journals are good, we don't feel anything. So we say that we are healthy. We are in a state of health. But a good physician, a good homeopathic physician will always know that no, this is not health. If something has disappeared completely and not gone into something more, sorry, in a lesser form, then that means that he is not cured. It has just gone to the latent stage of Sura. That is why it is very important. Like I have been telling this a long time. When some symptom disappears, where does it go? We have to understand that thing. Where has it gone? If an epilepsy has suddenly stopped, where has it gone? If someone was having some pains, some very bad pains, and they suddenly stopped, where have they gone? They should always go into a more, lesser symptom in a lower stage of the disease. Like, for example, epilepsy gets better and some rashes start appearing. Then we are okay. Okay. Some old symptoms, they start coming up. It is good. But then if it disappears and nothing is coming, that means that it has gone to that latent stage of Sura, from where it might come with a more forceful or powerful symptoms as compared to before. So now what we have to do when they go to the latent form of the Sura, aphorism 222. But such a patient who has recovered from an acute mental or emotional disease by the use of these non-antisoric medicines should never be regarded as cured. You should never ever regard that patient as cured. The same thing was told when we were doing this acute diseases. That if you have given a medicine and the patient symptom have disappeared, don't regard it as cured. On the contrary, no time should be lost in attempting to free him completely by means of a prolonged antisoric treatment. We should immediately start an antisoric treatment. A constitutional medicine should be given to that patient, and this treatment is going to be prolonged. It is not going to be like this. Some old symptoms have to come, which have to go then some more old symptoms or a more lesser uh, important symptom, they have to come and go, so that this patient can get rid of the Sura from the chronic miasm of Sura, which it is true has now become once more latent, but is quite ready to break out anew. If we just leave it untreated, it might again break up with more violence, with more prominence. and it might be very difficult at that time to bring the patient back to that latent stage. If this be done, there is no fear of another similar attack if he attend faithfully to the diet and regimen prescribed for him. So if it is done, so then there will not be any fear of any similar attack. So the footnote to aphorism 222. It very rarely happens that a mental or emotional disease of long standing ceases spontaneously. So Dr. Heyman is saying that very rarely it may happen that some mental or emotional disease which have been going on from a long time, it suddenly disappears on its own. It very rarely happens. For the internal dyscrasia transfers itself again to the grosser corporeal organ, because for that to happen, the disease has to shift back to the physical organs. So this shift on its own, it happens very rarely. Such are the few cases met with now and the where a former inmate of madhouse has been dismissed, apparently recovered. So, because at the, even now there are some hospitals or some centers which take care of the psychiatric patients. At that time, at the time of Dr. Hahnemann, there were few asylum, these kind of centers, which took care of such patients who have been suffering from some mental diseases. And because there were no other medicines, psychiatric medicines were not available, or they were not in a very good amount, or the people did not knew about this thing, the research was not like that, so they had to be kept in those kind of centers for a long time, sometimes even the whole life they have to be there. So he's saying that from such kind of mad houses, from such kind of centers, there are very very few cases where you see that a patient has been dismissed from that center and told that he has recovered. He had to, moreover, all madhouses have continued to be chokeful. He's saying that all such centers are chokeful, they are full, and no new admission can be done, so that the multitude of other insane persons who seek for admission into such institutions could scarcely find room in them unless some of the insane in the house died. So he's saying that they are so chokeful, they are so full that no, even if some new patient has to be entered into that facility, they will not get room there, and they can only be admitted if some old patient dies. Not one is ever really and permanently cured in them. So from his experience, he is saying that no one is basically permanently cured or really cured in these kind of centers. So he's basically telling us about the centers, the state of those centers, and the kind of treatment which was given to the patients at that time. A convincing proof among many other of the complete nullity of the non-healing art hitherto practiced, which has been ridiculously honored by the allopathic ostentation with the title of rational medicine. Because at that time, such patients, they were given electric shocks also, they were beaten also, they were given punishments also. So there were many kind of such processes or procedures which were done. And Dr. Hahnemann is talking about all those things, that this is not a medical art. How often, on the other hand, has not the true healing art, genuine pure homeopathy, been able to restore such unfortunate beings to the possession of their mental and corporeal health, and to give them back again to their delighted friends and to the world? And he's comparing that, on the other hand, when we see homeopathy, the medicines when we give in such patients, that their mental and physical health, they both recover, and they are basically uh, we can give them back to the family, we can give them back to the world, so that they can pursue their life, they can pursue whatever they want to do in their lives. So aphorism 223. What if the antisoric treatment be omitted? What happens if we don't give an antisoric treatment? If we don't give the patient the constitutional remedy after such kind of episode, then what will happen? Then we may almost assuredly expect from a much slighter cause than brought on the first attack of the insanity, the speedy occurrence of a new and more lasting and severe fit. So he's saying that if the antipsoric treatment is not given, then we can expect that even from a more slighter cause, even from a much lesser cause, this kind of attack may come again, which will be more severe, more long lasting, during which the sora usually develops itself completely, because the sora in that latent stage is going to develop. And once it is going to develop, once it has got that power, then it will show or express it in a more severe and a more lasting way, and passes into either a periodic or continued mental derangement. Then it will become an either an episodic derangement or a continued mental derangement, which is then more difficult to be cured by the antisorics. Okay, so like I was saying, that then it will become more difficult for us to cure that thing. So it is better that if such a patient comes to us, after such kind of episode, we have to start antisoric or these constitutional treatment immediately, although the patient appears to be in a healthy state. So if the mental diseases be not quite developed, and if it be still somewhat doubtful whether it really arose from a corporeal affection or did not rather result from faults of education, bad practices, corrupt morals, neglect of mind, superstition, or ignorance. So, like we have talked about it earlier also, that one are the diseases which are basically the true mental diseases, the true psychiatric diseases, which are coming from the corporeal affections. The physical symptom they started disappearing, and suddenly this mental disease it started coming. And then some are result from our faults of education, the things which we have learned. For example, if in someone's family, the people they use abusive words, that they disrespect some the elders, or they disrespect people, and the child is learning that thing. So that is a fault of education. Some kind of bad practices have been going on. Someone is having some corrupt morals because he's seeing everyone corrupt around them. So neglection of mind or superstition or some kind of ignorance. Okay. So because of this thing also, someone might this come up with the some kind of habits or some kind of disposition, which we might feel that it can be a mental disease also. So but how to decide which is which one? So the mode of deciding this point will be that if it proceed from one or the other of the later causes. So if it is coming from some kind of fault of education, some bad practices, corrupt morals, from superstition, ignorance, if it is coming from there, later causes, it will diminish and be improved by sensible, friendly exhortations. So that can become better. It is just an education. You give a good education to that person and he can start becoming better. So when we give them some friendly advices, some consolatory arguments, we put some kind of arguments in front of them, some serious presentations, and sensible advice, they will start becoming better. Okay. If someone is having some kind of for example, if someone is kind of in a habit of stealing. Okay, he just likes to take things which he like. So if he's suffering from the later cause, some bad education, if we make him sit, if it can tell that this is not thing, something belongs to someone, or it can give a pain to someone, that if you do things like this, and they start understanding that yes, it is a genuine thing which the person is saying, and they start getting better, then it is because of that faulty education. Whereas a real moral or mental malady, but if someone is a kleptomaniac, it has come as a disease to that person. A real moral or mental malady, depending on bodily disease, which is coming from that physical disease, which have been shifting to that part of the mind, would be speedily aggravated by such a course. That kind of patient will be aggravated by all these things when we are consoling them, when we are advising them, when we will tell them that this is because of the environment, or because of the education, or because of some things which you have not understand properly. So those patients, they will become more aggravated, they will not get better. So aggravated by such a course, the melancholic would become still more dejected. The person who is in a depression, who is in melancholy, if you start consoling him, they will become more sad. They will become more dejected. Querulous, inconsolable, and reserved. The spiteful maniac would thereby become still more exasperated. If there is some maniac, he will become more maniac when you are trying to calm him down. And the chattering fool would become manifestly more foolish. And if someone is speaking foolishly, talking foolishly, and you're just telling him or arguing with him that this is not like, he will become more foolish and he will argue more. So this is a way how to see which is the actual mental disease coming from, that shift of the sura, and which is because of the faulty education, because of something which he has picked up from his surroundings, which have been because of the superstition or some kind of ignorance. So this is a way how to make it, how to differentiate it. So there is a footnote to aphorism 224. It would seem as though the mind in these cases felt with uneasiness and grief the truth of these rational representations that acted upon the body as if it wished to restore the lost harmony. So he's saying that in these cases, which cases? The cases which where the shift has come from the physical symptom to the mental symptom, the true mental diseases. He says that there is a kind of uneasiness and grief, that these representation where the person is telling me these advices, they are rational and acted upon the body as if it wished to restore the lost harmony, but that the body by means of its disease reacted upon the organs of the mind and disposition and put them in still greater disorder by a fresh transference of its suffering onto them. So he's saying that in these cases it feels that the mind, somewhere might be understanding, but the disease force is so strong, the disease which has shifted to the mental disease, it does not let those advices act on the reasoning of that mind, as if that disease has taken the control, the complete control of the reasoning and intelligence, and it is not letting all those things, all those advices, all those consolations to act on it, and it puts up a more suffering in the patient. The disease produces refresh fresh transference of its suffering onto them. There are, however, as has just been stated, certainly a few emotional diseases which have not merely been. Now, third one are the emotional diseases. We are coming to that part. So, there are, however, as has just been stated, certainly a few emotional diseases which have not merely been developed into that form out of corporeal diseases. So, now these emotional diseases have not developed from the physical diseases. Okay, but which in an inverse manner the body being slightly indisposed originate and are kept up by the emotional causes such as continued anxiety, worry, vexation, wrongs, and the frequent occurrence of great fear and fright. So now there are some emotional diseases which are dependent upon what we have been going through, some kind of stresses in the life, some kind of uh, situations which are around us, some kind of things which have been happening in the past, or something which we are anticipating in the future. All those kind of things, they can bring out some emotional diseases in us. They are not actually developed from the physical symptoms, but it is in the inverse manner that these emotional diseases can basically start uh, damaging our physical health. So this kind of emotional diseases in time destroys the corporal health. So in a reverse manner, we have seen this many times. Like for example, there was some death in the family, the patient, they got grieved, the grief went much deeper in the patient, and after some time that grief started taking the whole economy and weakening the patient, the mind and the physical health of the body. And these kind of diseases, we call them as the emotional diseases, which started with some kind of emotion on the organ of the mind, and then it started destroying the physical health, often to a great degree. So it is only such emotional diseases as these which are first engendered and subsequently kept up by the mind itself, that while they are yet recent and before they have made very great inroads on the corporeal state, may by means of psychical remedies. Okay. So now what we have to do is that when we see a patient who has just started with this kind of emotional disease, suddenly something has happened. And we can see that this now, there are two ways how we tackle with situations which are around us. Two or three ways. One thing is we get an emotional state, some kind of grief, some kind of anxiety. That thing is resolved. If it is of low intensity, it is resolved, or we try to resolve it. For example, there is death, we try to overcome that state, we try to manage ourselves by some kind of consolation, some kind of meditation, and we get out of it. The second is that the mind, it starts keeping it up, you know. uh, because again it will come down to the same thing, that if it is happening, it will be because of the sora, because of the sensitivity of the patient. So if it is that the mind is still keeping it up, you know, although everyone is giving that kind of advice, that kind of everything is there, everyone is there for the patient, but they are still keeping it up, keeping it in mind. So now we know that in such a patient, you know, the physical health, if it keeps going on, the physical health is going to get destroyed. It is going to get affected. So what is there? We can do it maybe by means of psychical remedy. The first thing is that we have to give some psychical remedy, such as a display of confidence. Again, that, you know, we should have confidence in that person. For example, if someone is feeling low on confidence, we show them that no, we are confident about you. That may provide confidence to the patient. A dejected person, he might find confidence from your confidence. Some friendly exhortations, some friendly advices, some sensible advices, and often by a well disguised deception. Be rapid. Sometimes we also, you have to, you know, use something in a disguised way, in a deceptive way, but for the good of the patient. Okay. Sometimes we have to give a fear to the patient to take away the another fear. Like, for example, recently, one of my patients, he was, you know, he was basically slightly worried about his health, that something is happening, what it could be. Tell me the test, tell me the test. He would always come to the clinic and, doctor, just tell me the test. What test should I do? And I just, because he was like, this is also like cures, like, similia similibus currenter. Give him an extra fear. I said that, okay, you are so worried right now because nothing is coming in your tests. You are so afraid and you're so worried. What will happen to you if something comes up? Just think about it. If something comes up in that test, because right now nothing is coming in any of the tests. So if something comes up in that test, what will happen to you? And he was suddenly taken aback, that because he has not thought up to that level. If something comes up, then what? And suddenly he said that I will die on the spot. So I said that, why are you, trying to find a way to die? Just live. Just be happy that there is nothing coming in the test. You are having a good thing. Your health is becoming more better. Why you are, so eager to find something? And that is a, a well disguised deception that you have to give to the patient. Sometimes the answer should come. You should put a question like this, that the answer should come from inside, awakening the patient. The enlightenment should come from inside. You should put a question like this, then that what will happen if something comes up? And then the patient starts thinking, in a more uh, wider way, or in a more elaborative way about his state. So be rapidly change into healthy state of mind, and with appropriate diet and regimen, seemingly into a healthy state of the body also. So sometimes these psychical remedies, they help us to bring out a patient out of that emotional disease. But the fundamental cause in these cases also is a psoric miasm. We always have to keep this in mind. That if a patient is not letting it go, then the somewhere the mental state or the state of mind has become like that, that the soric miasm has infested that state, which was only not yet quite near its full development. And for security's sake, the seemingly cured patient should be subjected to a radical antisoric treatment in order that he may not again, as might easily occur, fall into a similar state of mental disease. So, although it is a cure, we feel that he has been cured or she has been cured, but it is seemingly, not really. So we should not take a chance. Even in such cases, we should give them an antisoric treatment, which basically, whatever their state is at that time, we should give them a constitutional treatment so that they do not fall into these kind of mental diseases yet again. So, in mental and emotional diseases resulting from corporeal maladies, which can only be cured by homeopathic antisoric medicine conjoined with carefully regulated mode of life, an appropriate psychical behavior toward the patient on the part of those about him and of the physician must be scrupulously observed. So, in addition to the homeopathic medicine, okay, for the real mental diseases, the mental diseases which have resulted from the shift of the physical symptoms to the organ of the mind, with along with the homeopathic medicines, we also have to, it is very important, this part, that we also have to guide the attendants of the patient and the physician. He himself should be aware of this thing, that how he has to behave or the patient's attendant has to behave around the patient, because our behavior, sometimes I have seen in many cases where the parents or the attendants, they are not able to understand that how they have to behave, that it can become an obstacle to the cure of the patient. So we have to guide them. Especially recently we are having these cases of autism in the children, so we have to guide the patient parents in a way that how they have to be around this child. And sometimes the parents, they do not understand in one time, so we have to guide them again and again and again. We have to keep uh, we have to be observant and keep an eye how they are behaving with the child, so that they can be guided, because they need that kind of guidance. So first we have to be aware how we have to behave. So it should be scrupulously observed, very carefully observed, by way of an auxiliary mental regimen. So it should be a mental regimen, it should be a mental routine which we have to develop. To furious mania, we must oppose calm, intrepidity, and cool. If someone is a maniac, if someone is getting angry, if someone is getting uh, this going into rage, we have to tell ourselves also, we have to train ourselves and tell the attendants also that we must oppose calm and cool behavior around them. We have to be very calm when they are in that state. If the parents or the attendant, they start becoming angry, they will become more angry, it will aggravate them. We have to be calm, cool, but of firm resolution. We should not cave in to their anger. We should be firm that this is wrong, what you are doing. But it should be in a calm and cool way, but with firm resolution. We should not cave in. The parents or the this attendants, they should not cave in to that furious mania. To doleful, querulous lamentation, a mute of display of commiseration. If someone is quarrelful, lamenting, continuously complaining about something, continuously being irritable, there should be mute display of commiseration. We should not at all uh, talk with them. We should not look to them. We should not do any kind of gesture. Okay, so a complete ignorance to that kind of patient where they are querulous, where they are, because you say anything, they will pick it up and they will quarrel about it. They will become irritable about it if you say anything. To senseless chattering, a silence not wholly attentive. If someone is chattering, speaking, talking, you should not talk with them. You should not tell them to stop. So complete silence, but not wholly inattentive. You should be attentive towards them, not completely inattentive. Okay, it should be shown in a way that you are not giving attention, but your ears should be toward that, chattering what they are talking about, to disgusting and abominable conduct, and to the conversation of similar character, total inattention. If someone is lascivious, if someone is talking in that way, if someone is doing a conversation or a conduct like that, there should be a total inattention towards them person. No, not even looking, not even talking, no, complete inattention. So we must merely endeavor to prevent the destruction and injury of surrounding objects. Okay, so the endeavor should be to prevent the destruction and injury of the patient, of the attendants, or the surrounding things, without reproaching the patient for his acts. While we should not at all reproach patient for what he or she is doing, because they are not in their senses. And if we reproach them, if we somehow try to punish them, or somehow try to make them understand in the way we understand, it is going to aggravate everything. And everything must be arranged in such a way that the necessity for any corporeal punishments and tortures, whatever, may be avoided. Even in the clinic, we should not keep things which can harm such kind of patients, which can be broken, or some kind of injury may be conducted to the doctor, to the attendant. So if you know that some kind of patient which is like this, like I have a girl of 18 or 19 years, when she comes into the clinic or when the parents are calling, so I tell everyone, just remove these things, just remove them. So we have to be very proactive in understanding what these patients are suffering from, what the attendants are suffering from. We have to guide the attendants and the parents how they have to behave, so that the patient does not become aggravated more. This is so much the more easily affected, because in the administration of the medicine, the only circumstance in which the employment of coercion could be justified in the homeopathic system, the sorry, this is so much the more easily affected, because in the administration of the medicine, the only circumstance in which the employment of coercion could be justified. So Dr. Hanuman is saying that the only circumstance in which coercion means, we have to do uh, against the wishes of the patient, we have to do something against the wishes of the patient, is giving the medicine. If the patient is not taking the medicine, only at that time the coercion is justified. The employment of coercion, or that, this thing is justified, because in the administration, only in the administration of the medicine. In the homeopathic system, the small doses of the appropriate medicine never offend the taste, because it is small taste. So Dr. Hahnemann was so careful. Sometimes some things which he has written, when you read, you can see that deep state of sympathy and compassion of Dr. Hahnemann, that he is even telling us that, that even the taste should not be offended of the patient while giving the medicine. He was going to that uh, level of compassion, where he's thinking about a patient who is suffering from a mental disease, and he's thinking of in a term of sympathy, that you should not do any punishment or coercion with such a patient. Even homeopathic medicine, they don't offend the taste of the patient, because that is also kind of coercion, or that is also kind of torture, to offend the taste of such patient, and may consequently be given to the patient without his knowledge and his drinks, so that all compulsion is unnecessary. So even don't coerce for taking medicine, just give the medicine in some drink of his without their knowledge, so that any kind of compulsion is unnecessary. Don't compel the patient to do anything. So sympathetic, so compassionate. You know, you can see a personality of a person from his words, that he know that what kind of disease these patients are suffering. He was horrified by the idea that these patients have been taken away from the society and put into those madhouses, into those centers where they are tortured, where they are, not taken care as a human being, where they have been left on their fate and no medicine is being given to them. He's so much concerned about such patients because that is a heart, or that is a soul from where the homeopathy has originated. And that is why I always say that we can never understand homeopathy if we don't have that kind of heart, or that kind of compassion or sympathy in our being, which is required to understand homeopathy. Because homeopathy is not some practical system, it has to be felt. The whole system was developed, the whole system was discovered out of this feeling which Dr. Hahnemann had towards patient, that whenever I give my medicine, the allopathic medicine, to the patient, they are more suffering. So he stopped his practice. Such great compassion that he has stopped, he has thrown away his practice because his patients were, because he would leave his patients worse after giving the medicine than before he found them. So that is from where this homeopathy has been discovered. We have to uh, get in touch, get in tune with this feeling of homeopathy, and then it starts coming on in it on its own. Then you don't have to put much effort. So footnote to aphorism 228: it is impossible not to marvel at the the same thing. It is impossible not to marvel at the hard heartedness and indiscretion of the medical men in many establishments for patients of this kind, not only in England but also in Germany, who, without attempting to discover the true and only efficacious mode of curing such diseases, which is by the homeopathic medicinal antisoric means, content themselves with torturing these most pitiable. Again, the way he felt pity for those patients. Of all human beings, without the most violent blows and other painful torments. By this unconscientious and revolting procedure, they debase themselves beneath the level of turnkeys in a house of correction, for the latter inflict such chastisements at the duty devolving on their office and on criminals only, whilst the former appear from a humiliating consciousness of their uselessness as physicians. So he's saying that it is, how can the people be so hard hearted? The people of medicine, the people who call themselves medical men, they are in these kind of establishments in England, in Germany, other places, and they are so hard hearted that just because they do not want to give this efficacious mode of homeopathic treatment to those patients, they use torments, they use violent blows, they will beat them up, they will use other painful torments to treat these patients, these pitiable of all human beings. Because other diseased human beings, they are at least in their conscious level, they can understand what is right, what is wrong. These patients, they are not able to understand, they are the most pitiable of all those. And those houses, those establishments, they were torturing them, they were beating them, they were using electric shocks on them, they were using other procedures. Like I have studied about uh, a way of surgery where they will put a scalpel and they will remove, they will just erode the forebrain, they will injure the forebrain of the such patients, and they will be like a vegetable for their whole life. So even those kind of unhuman treatments were given to those patients. So he's saying that they are just like the people who are at correction centers in the this prisons. But the only difference is that there is a duty of an officer, and they are treating like that with the criminals. But here, a physician is doing this thing because of his uselessness. What is the usefulness of a physician? That a physician should be able to cure a patient. If he is not able to cure a patient, then this is not the way how they should treat their patients, only to vent their spite at the apparent incurability of mental diseases in harshness towards the pitiable innocent sufferers. So he's saying that just to vent their spite, just to vent their resentment that they are not able to do anything for these patients, they will harm them. They'll be harsh towards them. Though they are the innocent sufferers, those patients, and they are punishing them, they are beating them, for they are too ignorant to be of any use and too indolent to adopt a judicious mode of treatment. So, on the other hand, contradiction, eager explanations, rude corrections, and invectives, as also weak, timorous yielding, are quite out of place with such patients. So, these things should never be done with such patients. We should not be eagerly explaining them, contradicting them, rude corrections, rudely speaking with them, trying to correct them, or some kind of physical means. And also, we should not be yielding or, be weak in front of them. There should be firmness, but there should be ignorance also. They are equally pernicious modes of treating mental and emotional diseases. They are very dangerous modes of treating these kind of maladies or these kind of diseases. But such patients are most of all aggravated and their complaint aggravated by contumely, fraud, and deception that they can detect. These patients, they are not incapacitated to detect some kind of fraud or deception. They know that you are, telling a lie, or someone is telling a lie, or someone is trying to fraud them or deceive them. Especially the schizophrenic patients, or they are very suspicious already. So they can make out if someone is doing something with them. The physician and keeper must always pretend to believe them to be possessed of reason. So we have to pretend that they are possessed of reason. The physician and the attendant, they should always pretend that yes, we believe in you. Okay. So when they're telling something, you should not deny it. Just be a little inattentive. Keep writing whatever they are saying. Just be inattentive. Don't ask them more. Let them be what they want to tell. But don't, kind of contradict them or try to reason with them. All kinds of external disturbing influences on their senses and dispositions should be, if possible, removed. Any kind of senses, any kind of disturbances which can be strong for them, any kind of influences, they should be removed. There are no amusements for their clouded spirit, no salutary distractions, no means of instruction, no soothing effects from conversation, books or other things for the soul that pines or frets in the chains of diseased body. They should not be given any books to read. Nowadays, I always tell them that don't let them see news, YouTube. Don't let them surf the internet, because they will that becomes the same thing. That is a disturbing influence for them. If someone, uh, like for example, I have told you about a case of Lekises who used to have, this kind of, who would hear sounds that someone is planning some attack on the country or planning to harm someone, and he will go to the police, he will tell to the, other institution that I can hear them conspiring. So if a YouTube is given to such a patient and he starts listening to the conspiracy theories, then that would make his mind more solid that he whatever is happening is right. So these patients, they should not be given any kind of disturbing influence, anything, any kind of thought or thought provoking thing. They should never be given. If a person is religious or he has gone into a religious mania, he should not be given more religious books or more religious instructions or more religious this thing. No, that is going to aggravate him. Okay. Because Dr. Hanuman said that for the it is a soul that pines or frets in the chains of a diseased body. It is like that they are chained in this diseased body, and all these things, they are going to get aggravated. No invigoration for it, but the care. We should just care it for them, but not should not give anything which can invigorate them. which can get them excited. It is only when the bodily health is changed for the better that the tranquility and comfort again beam upon their mind. Only when they start becoming healthy in their body, this tranquility or comfort will come only at that time. So the patient, the attendants, the parents should be told not to do such things. We also should not advise such things because it is not going to help. On the contrary, it is going to. I never tell such kind of patients or their attendants. Recently, one of such patients' parents, they told me you should advise him to meditate, and never tell him to meditate. He can even get this mania of meditation, and it will be more difficult to cure. Then it will be more difficult, you know because that reason is absent. When I tell some healthier person that you should meditate, he will meditate because of reason. There is reasoning that why I should meditate. It is going to calm me. It is, I will be more in control of myself. I will more be in control of this thing. Sometimes the people who meditate, it increases their ego. It increases their already diseased ego haughtiness, and they may go into some kind of retrum kind of manias or sulfur kind of manias. So never advise to listen to something, never advise them for some kind of motivation, never advise them for some kind of meditation at that time. We have to understand this thing, that the reasoning is not there. Emotional diseases, yes, these things can help, like we have talked. Or there is some um, uh, behavior which has developed from faulty education from the surroundings. Yes, these things can help. Some motivation can help, some meditation, listening to something, these can help at that time, but not in such cases. So as a physician, we have to first differentiate which case is which, and then we have to advise accordingly. So if the antisoric remedy is selected for each particular case of mental or emotional disease, there are incredibly numerous varieties of them. So we have numerous varieties of antisoric remedies. We have homeopathic remedies. Be quite homeopathically suited for the faithfully traced picture of the morbid state, which, if there be a sufficient number of this kind of medicines, known in respect of their pure effects, is attained by an indefatigable search for the most appropriate homeopathic remedy, all the more easily as the emotional and mental state constituting the principal symptom of such a patient is so unmistakably perceptible. So, among all the antisoric remedies which are known to us, we have to faithfully trace the picture of this state, the characteristic of the principal symptom of the mind, and then we have to find, or we have to search for that remedy which is appropriate homeopathic remedy, which is homeopathically suited to this case. Then the most striking improvement in no very long time, which could not be brought about by physicking the patient to, sorry, I think there is something. Let me check. 30. Okay. Yeah. So we, if we find such a remedy, we will find a striking improvement in no very long time. Okay. In very small time, we can see striking improvement in the behavior, in the emotional part, in the mental part of that patient, which could not be bring up by the off repeated of all other unsuitable allopathic medicines. The medicines which were taking him towards death, the patient towards the death, because of the by numbing his brain, by sedating his brain. So it was taking patient towards the death, and you can see the improvement when the patient, although they are on these sedatives, when they come to us nowadays, they're already taking some psychiatric medicine, they're already taking some sedatives. But when you give a right remedy, a right homeopathic remedy to that patient, the kind of difference that remedy brings in the patient has not seen, or the attendants have not seen in, from the years which the allopathic medicine he they were taking. Okay. So the allopathic medicine, it was managing the patient by benumbing or sedating. But that kind of love towards life, or the reasoning, or that intellect which suddenly develops after the right homeopathic remedy, they have not seen in past many, many years in the patient. So that is a beautiful picture to see when the attendants of such patients come. Like I have seen these cases. I have seen the mother. I can, because those are the experiences. I still remember that mother of a boy, 19 20 years old boy, who was, who was tried 2 to 3 times to commit suicide, and he was in a very, very bad state of mind, and he did not like himself. He was so much, kind of disgusted by himself. And they were giving him antidepressants, they were giving him, all those medicines. And after one single dose of Cilicia 10 after 1 month, the mother, she cried, and she was so happy. And the words were that I got my son back after 5 years. These were her words, that my son is back. She said that it is as if, your son was lost somewhere and suddenly he came back home. So that, even that boy from past 5 years, the medicines, the allopathic medicine, they were managing him, not, he was not pushing himself to that part, although those thoughts will come. But the prevailing of the sanity, coming back of reason, coming back of that love of life, that I want to live, that is an amazing, which cannot be described in words. It has to be felt. It is amazing. So, this thing, when now you read it with that kind of experience, then you get it. Yes, it is a very beautiful thing which Dr. Hahnemann has written here, that although these patients have been taken medicines from a long time, and they were getting more bad in their health, and suddenly with that kind of thing, a striking improvement comes. Striking. It strikes you. It strikes the patient. It strikes the um, parents, the attendants of the patient. It strikes you. Indeed, I can confidently assert from great experience that the vast superiority of the homeopathic system over all other conceivable methods of treatment is nowhere displayed in a more triumphant light than in mental and emotional diseases of long standing, which originally sprang from corporeal maladies or were developed simultaneously with them. So he's saying that from Dr. Hahnemann is saying that from my experience, I can say that in this particular aspect of the mental diseases, of the emotional diseases, there is no superior medicinal system which can show or display the triumph, the win, or the cure as the homeopathic system can show. And Dr. Hahnemann's experience have become my experience. And when it becomes your experience, in some of you have experienced this thing, some who have not, when it becomes your experience, especially in such cases, you will be on a completely another level. And then you come back and read the aphorism 230 again, and then you can feel that yes, all these words are true. Because I always say that the right belief, the belief system are of two, uh, you can say, there is believing, and then there is a faith. Faith is next level. Faith comes from experience. Believing is okay, he is believing, that is believing, 5 or 10% are believing there might be something to believe. That is believing. But faith comes with experience. When you see that happening in front of you, then the faith comes, which cannot go away. Then it can never go away. Whatever anyone says, whatever happens, that faith cannot go away. Belief, it can go anywhere. Today you are believing, tomorrow you might not be believing if you get to listen to something which is quite opposite. That is with the belief. But faith has to come from that experience. It has to come with a feeling. Feeling can only come with an experience. Then the faith sets in. And once you see that thing happening, you will be, uh, you know, every word of this aphorism will feel true. It will feel completely true with your being. Okay. So we have done till aphorism 230. There is a small this thing to differentiate. You can take a, I can make it, let me see if I can get it on a whole screen. You can take a screenshot if you want. So these are the types, three types of the diseases: the physical diseases advancing and transferring to the organ of mind. Okay, when the physical diseases or the symptoms are shifting or transferring to the organ of the mind. Then the acutely manifested mental diseases, and the third are mental diseases developed out of circumstantial and situational causes, faults of education, wrongs, vexations, corrupt morals, or some kind of uh, grief, anxiety, all that kind. There is a fourth type I have not added, but maybe you can type where the emotional disease they start affecting the physical health, but they will come in the fourth, and this third part is the same. So treatment, proper constitutional simillimum antisoric is required. In acute one, the acute manifestation is to be treated first. After the attack subsides, immediately antisoric should be given. Usually subside by psychical and moral remedies like friendly interference, comforting, reasoning, sensible advice, but afterwards should be given a constitutional simillimum. Causation is all sora. They are all caused by sora. Okay. So we have done 10 aphorisms today, and we'll take a leave. I will take a leave uh, from you at this time. Uh, like again, I will tell you that during the week, go through these 10 aphorisms. If you have been practicing from a long time, try to recall those patients, those experiences. If you have seen cases like these, just try to get and feel with these words. Words are only words until and unless they provoke a thought process in you. I have been talking from 1 hour. Whatever I am saying, these are only words. But these words, they become helpful when they provoke a feeling and a thought process in a person. Then they become meaningful. Until then, they do not have any meaning. They are just words written in some book, kept on a shelf, kept on a table for many, many years. So just go and read them and feel how you feel about them. Hold on to that feeling. Like I told you, in the words, when you read them, what Dr. Hahnemann has written, it produces that feeling of compassion and sympathy towards these kind of patients. That is important. A physician without a heart is not a physician. He is just like some machine which has been working from 35 years, 40 years. The heart always tells us to be sympathetic, to love the patients, to listen to them, to be careful with them, to be patient with them when they are telling something, when they are, telling about their even the personal problems. If you have a good heart, you can listen to someone's, because sometimes a person only needs ear. They just want to say something, they just want to tell something, and if you can give your time and your ear to them, just listen to them, they get half cured. They start feeling half. Many patients, they come to the clinic, even most of you also have experienced this. When you listen to them, when they hear to them that catharsis, they start feeling better. They will tell you that, I have come here, I have met you, I have felt very good. So that is what tells you that what is required of a physician. So these words, they amplify that feeling. So again, a request that just during this 1 week, go through them. Next week, next Wednesday, we will start with aphorism 231, and we will start with the intermittent diseases, the alternating diseases or the intermittent diseases, and how we have to go along with them. So till then, thank you, good night, and have a good week. Thank you. Good evening to all of you. So today we will continue with our organon series. There is a question regarding the local diseases. The question is freckles or melasma the hyperpigmentation on face local diseases? If yes, doing laser to treat hyperpigmentation or these kind of lesions, to remove these lesions on face, is it harmful? Okay. So when we started with this particular part of the how the treatment should be done, this local diseases, they come under the heading of one-sided diseases. So we have basically two kinds of one-sided diseases. One is the local disease, and one are the mental diseases. Okay. So when we started with it, so the first thing is one-sided diseases. What are the one-sided diseases? Diseases where there is paucity of the symptoms, where we do not have much symptoms, where we do not have enough symptoms to prescribe on. We don't have much characteristics. We don't have such symptoms in the journals or in the peculiars where we can prescribe. There we say that the disease is a one-sided disease, where all the disease is basically concentrated on one organ of the body. So in that case, then there is a subdivision of that one-sided diseases, which is the local diseases, where the diseases are basically concentrated on the organ of skin. So coming to the question, if this kind of symptoms, for example, this melasma or this thing, it comes in this category where that there is no other symptoms in the body, no other characteristic of the disease, like for example, no other the symptoms of the gastric system, respiratory system, or you do not find the disease where it penetrates the other tissues or the organs of the body, then we can call it a local disease. Then that discoloration, then that melasma, then that kind of freckles, they are basically one-sided disease, a local disease. Although not troubling, although not giving any kind of much trouble, or they're not some kind of the things which are painful, or this thing, but still they are present, we can call them the local diseases. But if these kind of symptoms, they're coming up with other symptoms, for example, there are symptoms of liver, some problems with the liver, with the indigestion, with some kind of um, dyspepsia or something like this, then they can be associated with those kind of problems, or they can be part of the original sora which is running through the body, but then they will not be in the category of one-sided diseases. Although that is a local symptom, although that is a symptom of the skin, but we will not call it a local disease. We have to understand this difference. Okay, the symptom is of the skin, but we will not call it a local disease, or we will not cure it in the way where it is said, like we have discussed in the last part. We have to see all the symptoms, whichever remedy is being given by all the symptoms, we have to prescribe that along with the characteristics of that skin symptom, if there are any. But if we are in those kind of diseases also, if we are looking only at the characteristic of the lesion, only at the characteristic of the skin, what kind of discoloration it is, the color of the discoloration, and giving or prescribing only on that part, then that is not fair. Then that will not be a homeopathic prescription. When Dr. Hahnemann has started with these aphorisms of one-sidedness, the first thing is that he said is that when the symptoms are not much, we only have one or two symptoms, and those are the only symptoms which basically tell us about the disease which is going on in the body, and we are kind of helpless there to just prescribe on that. And even he says going further that it can go into two things. Two things can happen: either that will be cured from there, it will be gone, the patient will go into healthy state, or the symptoms which were lying or which were in a latent stage, they might come up, and then we will have to come up with a new remedy which basically is equivalent to those symptoms, which is similar to those symptoms. So understanding of this thing, yes, the melasma or this thing, they basically belong to the skin part. They are local symptoms, but they are not only a disease when it is coming in conjunction to the other symptoms in the body. Okay, so we cannot just prescribe on that part, because in actual local diseases, when we are not having much of the symptom, we have to find the characteristic of that lesion on the skin. We understand that lesion, we try to find out the characteristic of that lesion, and we prescribe accordingly, because we don't have many other symptoms of the journals. Or if you ask about the sleep, everything is good. If you ask about the appetite, everything is good. If you ask about the mental journals, physical journals, or any other particular peculiars, you don't find anything in that. So yes, then we have to see what are the characteristics of that local disease on that part of the skin, and we have to prescribe accordingly. But in such cases, if there are many symptoms in the rest of the body, then it is not homeopathic to prescribe on only one single symptom, whether it be on the skin, whether it be on the any other part. We have to see the patient holistically. We have to see where the disease has permeated, and we have to understand the whole phenomena and then prescribe accordingly. Okay. So to the second question, whether the treatment of laser, is it justified? See, the problem with the hyperpigmentation is only this, that the people, they don't feel good about it. It does not cause any trouble to the patient. It does not cause any kind of dis-ease. Means it does not produce any kind of discomfort, except from the fact that we have this concept of beauty in us, that if the skin is clear, then only we look beautiful, then only we look good. So it is more of a mental state which is causing us in a state of disharmony. It is more of a concept which is causing a disharmony. Otherwise, there is these kind of, even if they come, they are very silent symptoms. They don't cause any trouble to the patient, except from this. Okay. So I think the patient, they should be guided about it. They should be told about it, that it is okay, and the color of the skin, it changes, it can go. Okay, if it is a part of some major disease, we will get to that disease, we will try to cure that disease, and with that disease, these symptoms might go away. If they have just come because of some other reasons, I will not say that it is in a state of they may come, they may not come. But yes, going for the laser treatment just because of that concept is not right. And yes, it can suppress and can create any other kind of deep seated diseases, because it is a symptom which has been caused by the body. But like we have discussed also, that whenever the body is taking a route of local disease, what it is trying to do is, see, there are two one sided disease, there are two categories. The one is the local disease and one is the mental diseases. If we look at the patients, if we look at our medicinal system, there are two diseases considered to be most difficult to cure. Two diseases. One are the skin diseases and one are the psychiatric diseases. They are most difficult to cure, manage, or treat, because once they come, and then there are very few, or almost kind of, we can say there is no other treatment for them. You can manage it, but they will come back again. There might be some periods with the sedatives or with local ointments or some kind of steroids in the local diseases. Once they are stopped, they will come back again. So these are one of the most tedious diseases in the whole array of diseases, if you say. And why? The reason why? Because the vital force, the intelligent vital force, it basically is trying to protect the body from complete destruction by keeping the diseases as one-sided diseases. There is a threat to the body that if this disease spread, then it can cause that sora, if it spreads, it can cause a complete destruction of the whole economy. So what the vital force is trying to do, it is trying to keep that disease in a one single organ of the body to protect the rest, either on the skin or on the state of mind. We'll go to those aphorisms also. And it was a very common phenomena nowadays because of the uh, this some diseases, some equipments which have come in the medicinal field, that we don't see much of these kind of things happening. But earlier it used to happen when the patient was, like kind of, they used to tell that, that we doctor used to tell that we cannot do much for this patient, so let him go on his course, just, you can just serve him in this state, rest whatever could be done we have done, and we cannot do more. So there were many cases at that time that suddenly a life threatening disease, some, like for example, a woman is in a child in the labor, or she's just on the state of, kind of, that she might die or collapse or something. Suddenly those people, they will go into states of manias. Some patient who is suffering from a very bad lung disease, suddenly he will go into a state of mania or some rage or very severe melancholy, and the whole disease will go away. Even Dr. Hahnemann talks about it in the, we'll talk about it when we'll go with the aphorisms. So when you look at that in that way, many times when you take some strong medicines, some strong allopathic medicine or some other medical medicines, it may cause a side effect in a form of, some skin rashes or allergies. Again, it is a very common thing, because whatever that thing has caused in the body is trying to throw it out. It is trying to take that disease, that medicinal disease, outside of the body and trying to keep it on one of the external organs so that it does not permeate inside, it does not invade inside. So that is why these two diseases, they are very difficult to cure, treat and manage in the current medical system, because they are like a very strong defenses of the vital force where it is trying to save the life. So if we are doing some kind of treatment, we are, going against it, then it might produce some more severe symptoms inside. And definitely these kind of laser treatments, they might have some kind of very bad effects of the laser also. And also if these kind of things they get suppressed, then they can produce some inner disease which can be then very difficult to be cured. So we will start with our aphorisms. So we have done till aphorism 214. We'll start with aphorism 215. So till 214 we have discussed about the mind and the disposition, and that how and why they are important in our prescriptions. We'll start with the 215. Almost all the so-called mental and emotional diseases are nothing more than the corporeal diseases, in which the symptom of derangement of mind and disposition peculiar to each of them is increased, whilst the corporeal symptoms decline. So Dr. Hahnemann is saying that whatever diseases we are calling as mental diseases, emotional diseases, nowadays we are calling them the psychiatric diseases, they are nothing more than the corporeal diseases. They are just the physical diseases, they are nothing more than that. The difference is that in this part, in which the symptom of derangement of mind and disposition peculiar to each of them is increased. The only thing is that in this particular case, the same derangement of mind and disposition, which is seen in almost any disease, which we have discussed in the past few aphorisms, that every disease, whenever it comes, it produces some kind of mental changes or some kind of changes in the disposition of the patient. So we see that kind of change. So in this case, when we call the mental disease, it is nothing special. Just only thing is that the disease is more peculiar or more spread in the organ of mind and the disposition. It is more increased there, whilst the corporeal symptoms decline. So the corporeal symptom, the physical symptoms are declining, and the disease is shifting to the mind and the disposition. The symptoms of the mind and disposition are increasing more or less rapidly. So either it is in a slow pace or it is in a more quicker pace, till it at length attains the most striking one-sidedness. And it happens till it takes a striking one-sidedness, almost as though it were a local disease on the invisible subtle organ of the mind or disposition. So what happens is that a person was suffering from a disease from a long time, or other symptoms, for example, many symptoms there were, and they were slowly and slowly shifting towards the organ of the mind and the disposition. If you see the patients who are having some kind of schizophrenia, bipolar mania, some severe depressions or panic disorders, or some anxiety or some rage, if you look at the history of these patients, these kind of symptoms they usually are having from a long time, not this much intense, but yes, if you look at very closely, if you inquire about these kind of symptoms very closely, then you will find, like yesterday I had a patient who has panic disorders. So when I asked them that, is there a definite time when you started having these panic disorders, he said that from recently, from 1.5 year or 2 years, the words are that severity has increased, their severity has increased. But I have always been like this, I have always been a fearful person right from my beginning. I used to think a lot about something which used to make me afraid. So it is not something that has come suddenly, it has been there, a part of them, along with some physical symptom, it has been going from a long time. And these physical symptoms over a time of period, they have been declining, and this mental symptoms, they have been increasing. So we see a shift in this kind of diseases, in the mental or emotional diseases, that a shift has come from where the physical symptoms have decreased and the mental symptoms have increased. So again, it gives us a perspective or an understanding that when we have to cure these kind of diseases, like we always talk about, that we have to understand the phenomena. So we have to understand the whole phenomena, how this disease has developed. So it is not something one, or some causation which has happened 1.5 year back or 2 years back. No, it has always been a part of that patient. So we have to understand that thing. 1 year back, 2 year back, 3 year back, when it has become more severe, something might have happened. But that was more of a thing which aggravated the thing which was already there. So it was not a cause which has been a fundamental cause for that thing. It might be some aggravating cause, but that does not become important in such cases. What becomes important is that how he has been through his whole life. We will talk about that in more detail when we go to that aphorism. But to understand this, that it is, we have to understand that there is a shift of physical symptoms to this state of mind and disposition. So 216, the cases are not rare. Like I was telling you that it used to, even nowadays it happens, these things. The cases are not rare in which a so-called corporeal disease that threatens to be fatal, a suppuration of the lungs or the deterioration of some other important viscous or some disease of acute character, for example in childbed, etc., becomes transformed into insanity, into a kind of melancholia, or into mania by a rapid increase of the psychical symptoms. So Dr. Hahnemann is saying that it is not rare, it is frequent. Okay, that some diseases which were life threatening, like there was some thysis of the lungs, some pneumonia, some suppuration of the lungs, or some other destruction of some important organ, which becomes suddenly transformed into insanity, which suddenly transforms into some kind of deep depression, some kind of mania, where the psychical symptoms they are increasing that were previously present. Again, the same thing. The symptoms are not new ones. It is not that some new symptom has come up. They were always there, but in a very subtle, in a very low intensity or mild intensity, they were always there. If a patient has gone into some severe depression, sadness, melancholia, there used to be some bouts of sadness earlier also. The patients were sad patients earlier also. But now they have suddenly gone into that state, whereupon the corporeal symptoms lose all their danger. And when this shift happens, when this rapid increase of psychical symptom happens, the corporeal symptoms, which were the physical symptoms, which were life threatening, they lose all their danger. They become very mild, they become very less in their intensity. These later improve almost to perfect health. It appears many times that these symptoms, as if they were never there. If some mental diseases of a very, very long has been happening from a long time, the attendants, the people who have been with them, sometimes they even don't remember that they had any kind of physical disease. They will always have, physically he is fit, very strong physically, never had even a fever, never even had some cough, never had any coryza, because that all is shifted to that state. So these later improve almost to perfect health, or rather, they decrease to such a degree that their obscured presence can only be detected by the observation of a physician gifted with perseverance and penetration. Or they become obscure or they decrease to such a degree that only a physician who is gifted with perseverance and penetration, who has a very strong observation, who has a grit that I need those symptoms, I need to ask about them, I need to find them, then that kind of physician can see that yes, these symptoms are still there to a very small degree, they have not completely gone, but they are still there. In this manner, they become transformed into a one sided and, as it were, a local disease in which the symptoms of the mental disturbance, which was at first but slight, increases so as to be the chief symptom. So that whole problem, it's basically transformed and shifted to a local organ of mind as if it were a local disease. And then that symptom became the chief symptom instead of some physical symptom which was very strong earlier, and in a great measure occupies the place of the other corporeal symptoms whose intensity it subdues in a palliative manner. Again, very important word, palliative manner. So it takes place of the other symptoms in the body. The whole, like I told you, that whole disease gets concentrated to then that one particular organ, and we call it a local disease. And why it happens? To palliate that. It happens in a palliative manner. It has palliated those corporeal physical symptoms, not cured, they are not gone, but they are in a palliative state. So that, in short, the affections of the grosser corporeal organs became, as it were, transferred and conducted to the almost spiritual, mental, and emotional organs, which the anatomist has never yet and never will reach with his scalpel. So the whole look, the physical phenomena, the whole phenomena of the disease, it is transferred to that invisible spiritual, mental, and emotional organ of mind. Dr. Hahnemann says that it is such an organ where the surgeon or an anatomist can never reach with his scalpel. That is why It will be not able to cure that part, that disease, by the methods which we are commonly seeing. They can never help that patient. So in these diseases, we must be very careful to make ourselves acquainted with the whole of the phenomena. So the first thing which we have to do is we have to be very careful. Careful in what? In understanding the whole phenomena, both those belonging to the corporeal symptoms and also, and indeed particularly, those appertaining to the accurate apprehension of the precise character of the chief symptom. So the first thing, we have to be very careful in understanding the whole phenomena, the phenomena which consists of the physical symptoms which were there, and now it has shifted to the other part of the brain. But like Dr. Henneman will also tell this thing, but somewhere they will come back. You will always see those physical symptoms coming back whenever the mental diseases, the symptoms have the intensity has decreased. You will see those physical symptoms sometimes coming up in some kind of seasons, in some kind of situations, in some kind of uh, uh, when the patient is in a more stable mood or in a more stable mental state, so those symptoms will come back, although minutely, although for a less time, but they will come back. And if we have this understanding that we have to look for them, then we will indeed see those symptoms. And if we ask also to the attendants, uh, and many times the attendants, they tell about those symptoms. So those appertaining to the, and the second part is first the corporeal symptoms, and then particularly accurate apprehension of the precise character of the chief symptom, of the peculiar and always predominating state of the mind and disposition. So now the chief symptom is the state of the mind and disposition right now. That has become the chief symptom in these cases. So a physician has to understand the peculiar character of that. For example, if a patient is suffering from some kind of delusions, so we have to characterize it. What kind of delusions are there? Okay, is there some particular underlying theme of those delusions? If the delusions are ever changing, they are of no use to us. Okay. But yes, if there is some underlying this thing, for example, there was a case I have discussed. I think most of you have heard about that case, a case of Lekes's patient who used to hear, he used to have auditory delusions. He used to hear that someone is scheming against the country. So he will go to the police, he will go to the CID and tell them that, I can hear, I have this power, I have gained a power by which I can hear their satellite communications. The people, they are trying to attack in some part of India, and I can hear them. So he would say that now they have come to know that I can listen to them, and they are threatening me. They are saying that we will kill you if you tell to the police or you tell to the army. So he used to go everywhere to tell everyone that I have these kind of this thing. So that auditory delusion, that becomes a very characteristic part of the chief symptom. So similarly, if there is some kind of confusion of mind with that, any kind of dullness of the mind, or if there is some kind of anger, then how the person is behaving in that anger. If a patient is suffering from some kind of panic attacks, then how is the usual mood with that kind of anxiety? Like one of my patients again, he used to have a very severe hypochondriasis, very severe. Like every month he used to do some MRI or some scanning of the body. He always had that, this fear that the doctors are not able to understand. He used to feel this pains around this area, in the back, sometimes in the cervical region. And his mother had suffered from cancer. She died from the cancer, and that had a huge impact on him. So he used to do lots of tests, echo, ECGs, MRIs, and whenever he would do, he would be in this thing, he will always become very sad. He would weep also. Okay. So hypochondriasis, it is a chief symptom. Anxiety or this fear of disease is a chief symptom. But the characteristic was that whenever he was into this state, he would become very sad, very depressed. He will not talk with anyone. He will be silent. He does not want anyone to talk with him. Otherwise, he was a very extrovert person. Otherwise, he would like going out with the people, like doing his work, his job, very sympathetic, very generous person. And he would all like, after he became well, he would always tell me, doctor, we should start a camp for the children which you are doing. We should start in this city, we should start in that city. Always very enthusiastic to help others. And animal lover, very, very this thing. So, but he had this character. Whenever he was into a state of hypochondriasis, he would be very sad and does not want to talk with anyone. He used to have pigeons, which he loved very much, which he took care of a lot. And at that stage, he would even stop feeding those pigeons. He would stop looking at his dog. He would stop taking him out for a walk. And he would be in a very, very deep, sad state. And this is a very characteristic of phosphorus, this particular part. Phosphorus we usually do not think about when we go into this hypochondriasis, but it is one of the main remedies when this kind of state happens. And whenever they're in a state of hypochondriasis, they go into such very, very deep sadness. A very, jovial person, a very happy person, a person who has lots of energy, and going into such state. And he is completely out of that state now. Even now, if he sometimes gets symptoms, he does not bother about that. He completely, even he would not even go out of the city at that time. That if I had a symptom there, then my doctor, how will I contact my doctor? How will I contact him? How will he give me medicine? Because he was taking the homeopathic medicine. He had a belief in homeopathy and me. So he would say that, doctor gives the medicine from his clinic. It is not like allopathy that I can take it anywhere. So how he will give medicine? So his son has been calling him to Australia from past 10 years, and he did not went there. He did not went for his graduation. He did not went when he started his job, because he said that I cannot come. If I get sick, then who will give me the medicine? And recently, after getting better, he has gone 3 times to Australia. 3 times, for 1 month, 1.5 month. And now I sometimes jokingly ask him that, now you are going to Australia. If you get some problem there, how will you manage? I jokingly ask him. Yeah, don't worry. I will just call you. I will just call you. So, um, so we have to understand the whole phenomena. This characteristic of the chief symptom and the corporeal symptoms which they used to have, or which sometimes comes now also, in order to discover for the purpose of extinguishing the entire disease. So, among the remedies whose pure effects are known, a homeopathic medicinal pathogenetic force, that is to say, a remedy which in its list of symptoms displays with the greatest possible similarity not only the corporeal morbid symptoms present in the case of disease before us, but especially this mental and emotional state. So it should not only cover the medicine which we are selecting. It should not be only similar to the morbid symptoms of the corporeal character or the physical character. Not only the physical disease symptoms should be covered, but especially this mental and emotional state and its characteristics. Okay. This finding of characteristic is very important, because, for example, all the patients who are suffering from, if we name it, if we go into the name of the disease like schizophrenia, everyone is suspicious. Everyone is suspicious. So suspicion is a very common thing among such patients. But we have to understand that there is always some characteristic to those kind of things. We have to find that characteristic. What change happens into them when they are into that state? Is there any characteristic? Is there any characteristic in their behavior which they usually do when they are into, for example, a patient, a person who is suffering from some kind of anger disorders, some rage or something. Whenever he goes into the, he starts abusive, he starts becoming abusive, although he's not, especially when he's not from that kind of background, familial background. Like a person, and there was this patient, he was a teacher in a university, and he comes from a very decent and a background which is very manneristic. Like his father was a teacher also, mother was also a teacher, and they were at very good posts, and this person is also a very good post. And when you inquire about him, that has he been like this, like abuse, everyone will say that this is a completely different person. He was a very, very subtle person, talking very carefully, seeing how the state is managing, how the things are in a very responsible way or in a very beautiful way. And suddenly such a person, when in anger he becomes abusive, that becomes a very characteristic thing. So that becomes a characteristic of that mental and emotional state. And our remedy, along with the physical symptoms whichever there are, we have to we have to form a picture and find a remedy which basically corresponds or is similar in greatest possible meaning to that particular picture. So aphorism 218, to this collection of symptoms belongs in the first place the accurate description of all the phenomena of the previous so-called corporeal disease. Like we have discussed, that all the phenomena from where this disease has shifted to the mental disease, the phenomena of that disease, that physical part, it has to be accurately described, has to be accurately understood before it degenerated into a one-sided increase of the psychical symptoms and became a disease of the mind and disposition. This may be learned from the report of the patient's friends. Okay, so this we may learn from the patient's attendants or friends or the family members. A comparison of these previous symptoms of the corporeal disease with the traces of them that still remain. So once we have asked from the parents or the attendants or the friends of the patient that what were the physical disease which was before this state has come, and now if we compare with the traces of them that still remain, so like I told you earlier also, that there will be some symptoms which will be still there, though they have become less perceptible, they have become very less perceptible, they have become less prominent, it is difficult to see them or analyze them, but which even now sometimes become prominent. When do they become prominent even now? When a lucid interval or a transient alleviation of the psychical disease occurs. Transient alleviation means a small amelioration. Whenever the psychical symptoms, they are ameliorated for a small time by the situations, by some kind of something which is according, something is going according to the patient is happy, there is little alleviation, amelioration of the psychical disease, those symptoms they will come back, they will become prominent. Some kind of diarrhea, some kind of changes in the, for example, the same patient who was, like I told you, who had this auditory hallucinations. So there were some bad days, there were some good days. On good days, whatever was his coryza will come back, he will start having this cold, you know so will serve to prove them to be still present although obscure. Okay. So this also tells us that those symptoms are still present, they have not gone anywhere. Like Dr. Hahnemann, he used the word that they are basically in a suppressed state. They are not gone anywhere, they are still there, they are still the part of the disease. So it also gives us a relation that whenever the the psychical symptoms increase, the physical symptoms decrease, and whenever the psychical symptom decrease, the physical symptoms they come back. So they are basically uh, so much interrelated with each other, and they become a they make a very characteristic picture of finding a simillimum remedy. So that is why we have to become acquainted with the whole phenomena of this physical disease which has happened or which had been happening before it shifted into this part. And there was this one more boy who used to have suicidal disposition, suicidal thoughts. So similarly in his case also, whenever he will become a little better, he will have very severe headaches where he will start becoming more confused. He will become more dull. He will be not able, for example, if he was studying in the college, so when if he had this exams, and he will become very confused which exam is tomorrow, like which I have given, which I have to give. He will become confused in them. So this was very characteristic of that patient. So by adding to this state of the mind and disposition accurately observed by the patient's friends and by the physician himself, we have thus constructed the complete picture of the disease. So by adding the state of the mind and disposition to this part, to this characteristic of the physical symptoms, or which are still there, we have completed the picture of the disease, for which in order to effect a homeopathic cure of the disease, a medicine capable of producing strikingly similar symptoms and especially an analogous disorder of the mind must be sought for among the antisoric remedies if the psychical disease have already lasted some time. Okay, so out of them we have to find an antisoric, we have to find a similimum remedy, which is basically similimum to the disorder of the mind, to the state of the mind, and to the physical picture of the disease which preceded, which was there before this disease came, this mental disease came. So this is the idea about the how to deal with this mental diseases, because without considering this whole thing, we will never be able to treat the patient. And this is a key. If we suddenly go and give stramonium, belladonna, and veratrum, and hyoscyamus, or these kind of remedies, we are just looking at the mental picture and ignoring the physical phenomena which had been running behind it. So that is why these kind of remedies, they don't give a permanent. They might again ameliorate certain symptoms. For example, you give stramonium, it will ameliorate certain symptoms of the patient. You give belladonna, it will decrease the anger for some time, but it will come back. So it again acts in a palliative manner, because we have not considered the thing which had been there before this disease has come up. And moreover, at least in understanding a general state of mind, when we look at a patient that okay, he's suffering from uh, some kind of sexual mania, erotomania, he's suffering from that, at least we can rule out the remedies which don't belong to that stage. So just the understanding of this thing, that what kind of a general state of mind is going on, like we were discussing last time also, that rule out basically happens when you know that what kind of general disposition is of the patient and what kind of the general disposition a remedy possesses. We have done that footnote to the aphorism that Nakswamika will never be uh, able to cure if the patient is of a yielding disposition. So whenever patient is yielding, we know that we have to rule out all the remedies which are predominantly obstinate. So similarly in this state also, when you see that a particular kind of mental state is there, we can rule out all the other remedies which do not have those kind of states commonly or generally. So if a patient is suffering from melancholia, at least we will have this thing that we should not give belladonna, stramonium, or veratrum in such cases, because they don't have this kind of state of the mind. Okay. So we will stop our lecture today here at aphorism 220. I will again request you to go through this. These kind of diseases, homeopathy is the only answer in today's time. You all have experience in homeopathy, in the medicinal system. Many of you are doctors who have been practicing from long time. You have seen such cases, how they have been suffering from so long, And at least we know that there are no other medication, because the medicines, other medicine, they're not working in this way. They're not trying to go through the patient or understanding the patient in this way. So that is the first reason why those medicines, they don't have that power to cure the patient in a complete manner as it is meant to be, for a longer period, for a permanent period. Why these medicines, they are not able to help? They can help for some time, they can manage the patient, yes, they can help with that thing. But when our aim is to bring the patient back to health, then we should go with that mindset in such cases. So we have to go through these aphorisms, because these kind of diseases are on the increase. The reason that the physical phenomena are being suppressed in a more rapid way by many kind of treatments which are going on nowadays. So we have a rise in these kind of diseases in recent times, and we have to understand that we are the ones that can help those patients. So we need to understand it in a more deeper way, that how we can go about these things through our, now like I told, and these all things are given in our materia medica. If we can understand the organon, if we can just understand this part, now after understanding of these particular aphorisms, when you go back to materia medica of phosphorus, you will find the same thing which I have told you today, because it is written in the materia medica. But we didn't had a mirror to look through earlier. Organon helps us like a mirror. It helps us in searching like a magnifying glass. It helps us to search what we are looking for in the materia medica. So now if you go to the phosphorus, you will find these things which I have said today in the materia medica of phosphorus. Because now you know that, there is some this similarity which is there. There are some peculiars which we have to find in the mental and dispositional part of the patient, and now you can hit upon that thing. So when you go through these aphorisms again and again, you make a link. You go through the aphorisms organon, you go through the materia medica, you go through the aphorism, you go through the materia medica, you start forming a link. And that link is what transforms into our case taking, into our analysis, and into our search of remedy. If I am reading materia medica with one mind, and the organon I have never gone through, or just few aphorisms I have gone through, I have not formed a link between these things, then it becomes very difficult. And it becomes very difficult to understand miasms, because nowadays, like recently when we had been in Thailand, I have talked about syphilis when we were discussing Merck. So recently, from past few years, I have been I have few cases which have responded to that kind of anti-miasmatic treatment. I will not go into detail right now. It is a long thing. Where the problems they have developed from syphilitic miasm, the syphilitic miasm which Dr. Hahnemann has told us about, which is linked to the venereal diseases. Because when you have to form the link in all the things which are homeopathic, all the homeopathic literature, you have to go through them again and again. And when we are doing these classes, when we are doing these lectures, we have a 1 week period in which we can go through them once or twice, try to understand, try to, make a link with the previous aphorisms, try to make a link with whatever we have talked, try to make a link with the materia medica. For example, if you go to the lachesis part of the materia medica, you will find these kind of characteristics there. If you go to the sulfur materia medica, you will find those mental characteristics there. And if when you will see that in the patient, someone who is suffering from those kind of psychiatric diseases, the immediately the remedy will hit your mind. The remedy will hit, because now you know the aphorisms, now you know what you are looking for in such cases. Earlier we were just kind of throwing the darts in the dark. We didn't know what to hit. Everything, we didn't know what is the target. We do not know. So organon, these aphorisms, they give us a way how to proceed in such cases, how to understand our materia medica. So now whenever now you go through the materia medica, if there is go after this, go for the materia medica of Mazerium and Dr. Kent's materia medica. Just read Mazerium and see how he tells that those skin symptoms, how they change into something more drastic, something more bad. All the materia medicas have, pointed these kind of changes. What happens after this? What happens after this? We were not able to establish that link. Then if you go to the Mazerium, you will start understanding that indifference part of the Mazerium, how it is developed and how violent it is. So when, because like I have told you that you cannot memorize materia medica, it has to be understood. So these aphorisms, this organet helps us in understanding the materia medica, how it is to be understood. So just now you just go give a reading to Mazerium. It is a very small, I think 3 or 4 pages max. You can just do it in 15 or 20 minutes. Try to understand, try to see this link in that remedy. And then you can, make up your mind that, okay, if a patient comes with this kind of condition, who has come from this kind of state, Mazerium is the remedy. And I'll wait for the such kind of patient to come. And whenever he comes or she comes, I'm going to this remedy and I will see that beautiful cure happening in front of my eyes. Okay. So first go read the Mazerium, feel about how you have understood this thing, you know, keep that thing inside, think about it, and then you go back to those aphorisms and then read them again. And you will have a more clear picture about what we have talked today. So with that, good night to all of you and thank you very much. A very good evening to all of you. So after a long gap, we are restarting the organon classes. So we have done till aphorism 209. So we'll start with aphorism 210. From this point, the discussion on the mental diseases will start. There is differentiations among the different kind of mental diseases. There are some emotional diseases, there are some mental diseases. So as we go along in the aphorisms, we will try to discuss those differentiations and how we have to go along in those cases, how we have to understand those cases, how we have to tweak some of our points in the case taking so that we can come up with a remedy for such patients so that they can get cured. So we will start with our presentation. So aphorism 210. So we are talking about the one-sided diseases, that diseases which come only on one single part of the body. They show very few symptoms, but when examined carefully, those few symptoms can give us the complete picture of the disease itself. So of psoriatic origin are almost all those diseases that I have above termed one-sided. And all these one-sided diseases, whether they are coming on the local parts, whether they are coming on the part of the mind, they're all of psoriatic origin, which appear to be more difficult to cure in consequence of this one-sidedness, all their other morbid symptoms disappearing as it were before the single great prominent symptom. So again, just to recap that once in one-sided diseases, We have very few symptoms or no symptoms at all, only just one single prominent symptom or one or two prominent symptoms which are there in front of us, while all the symptoms have disappeared. So Dr. Hahnemann is saying that it is difficult to cure them because they do not have much symptoms. They do not have symptoms which can stand out as very characteristic symptoms. So we have only very few symptoms. We have only some symptoms, but those are prominent ones. We have talked in the last few aphorisms that those symptoms are very prominent ones. And when a remedy is prescribed on those symptoms, it can cure the whole case. So of this character are what are termed mental diseases. Even the mental diseases, they have the same kind of character, that they have one-sidedness to them. They do not, however, constitute a class of disease sharply separated from all others, since in all other so-called corporeal diseases, the condition of the disposition and mind is always altered. There is no disease which we can call is a completely physical disease. If some part of the disease body is getting diseased, the whole is always involved. Even if we are having pain in some part of the disease, the mind, the rest of the body, they are all involved, they're all feeling that pain. So Dr. Hahnemann here is saying that although I am calling this part or these kind of symptoms as mental diseases, but they do not constitute a separate class. Because why he's saying that? Because in all the corporeal, all the physical diseases, the mind and the disposition is always altered. There is no disease. Even Dr. Boeing Hassan states that during the stages of latent sora, the sora is basically how the disease shows itself on the physical body with any kind of symptoms. When it comes on the body, we say that okay, this is a psoriatic disease or a psychotic disease or a syphilitic disease. So that is when it is shown on the physical body. But in the state of latency, when it is not showing itself on the physical body, the disease is not gone. It is trying to develop at the parts of the mind in different kinds of emotions and different kinds of behaviors. So it is not until and unless some very good treatment is given to a patient, we cannot say that we are healthy or we are basically disease free or any other patient is disease free. Just the absence of symptoms at a particular time, it should not be considered that the patient is healthy. We have to see where it has gone, where are all the symptoms gone. So Dr. Boeing-Hawson in his lesser writings, there is a one of the chapters where he mentions this thing, that during that stage of latency, a physician should always see that what are the changes coming in the behavior or the mind mental part of the patient, because it is developing there at that time. So there is no physical disease which comes without the alteration of disposition and mind. So because of that, he's saying that this is not a different class of disease, but yes, we can call it mental disease. Why? Because here the disease is more prominent on the mind. And in all cases of disease, we are called on to cure. The state of patient's disposition is to be particularly noted. And in every case, all the cases where we are uh, called to cure a patient, we always say that disposition is a very characteristic part of the patient. For example, there was a child today who came, a cerebral palsy child. So when I was looking at his symptoms, some symptoms of convulsion, some symptoms, his physical symptoms, Nux vomica was coming very prominently. The kind of the constipation, the kind of the sensitivities that child had. So Nux vomica was coming very prominently. But he was a very, very smiling child. The parents told that he never gets irritated. He's always smiling, he's always laughing, very easy to be pleased. So that goes completely against the disposition of Nux vomica. And that should only be one symptom which should stop us from prescribing this remedy. because the state of the disposition is a very, very prominent characteristic part of the patient, and it should not be ignored. It can never be ignored. So the state of the patient disposition is to be particularly noted along with the totality of the symptoms. So whenever we are called upon to see a patient, when we are taking a case, when we are assessing the medicine, when we are analyzing the medicine of the patient, the disposition of the patient should particularly be noted, and it should be among the totality of symptoms which the medicine should cover. If we would trace an accurate picture of the disease, and we have talked about this thing when we have talked about sora, we have talked about this part of the disposition, that how it develops and why it is given so much importance. Why, like I told you just right now, the example that even having very strong symptoms of some remedy, we can basically rule out that remedy, or we can just get it out from our analysis, because it does not matches the disposition of the patient, or the patient does not have the disposition of the remedy which we were going to prescribe. So it holds so much importance. So if we would trace an accurate picture of the disease in order to be able therefrom to treat it homeopathically with success. So if we wish to cure the patient, if we want to treat the patient successfully, and in order to trace a right picture of the disease, the disposition has to be included in that accurate picture. Only the picture of the disease will become accurate if we have added the disposition of the patient to that part. So this only thing, this only line, this only these words can tell us that how important it is to understand the disposition of the patient, and how important it is to include in our analysis. So there's a footnote to aphorism 210. How often, for instance, do we not meet with a mild, soft disposition in patients who have for years been afflicted with the most painful diseases, so that the physician feels constrained to esteem and compassionate the sufferer? So Dr. Hahnemann is giving some example of the patients like who have been very mild and soft, and from a long time they have been affected by some kind of painful disease. And when you see the condition of the patient, we feel sympathetic towards them. We feel that how much they are suffering, and we feel uh, constrained to help those patients. But if he subdue the disease and restore the patient to health, as is frequently done in homeopathic practice, he is often astonished and horrified at the frightful alteration in his disposition. And sometimes, when the patient gets better, when the physician is able to restore the patient, which is frequently done with the homeopathy, he says that sometimes you are very astonished, and this has once happened to me. The same thing which Dr. Hahnemann is writing about with one of the patients who was suffering from a kind of yeah, like he was dying. He was in that state of uh, disease, and he came out of it. He went on to become healthy, and you see that how that disposition, because the mind has been changed during that process of disease. Some parts of the mind which the formerly the patient was, that has changed. So you can see that change in the disposition when the physical health is also getting better. He often witnessed the occurrence of ingratitude, cruelty, refined malice, and propensities most disgraceful and disregarding to humanity, which were precisely the qualities possessed by the patient before he grew ill. So before he went into that kind of state, when he went, even many times in acute diseases, you can see these kind of things in acute diseases. Suddenly a patient who has been very mild in a fever, very, want like a pulsatilla person, once he gets better, he comes to his this older self of being dominating, of being angry, of being, abrupt, the who was very soft and sweet during that acute phase. So main thing to understand is that whenever some disease processes start, they basically affect the disposition of the patient. Those who were patient when well often become obstinate and violent, hasty or even intolerant, and capricious or impatient or desponding when ill. Those formerly chaste and modest often become lascivious and shameless. A clear headed person not infrequently becomes obtuse of intellect, while one ordinarily weak minded becomes more prudent and thoughtful. So, in the mental picture, also, the intelligence gets affected, the disposition, the emotions get affected, the behavior gets affected, the will gets affected whenever the disease process is going on. And a man slow to make up his mind sometimes acquires great presence of mind and quickness of resolve. So both the things uh, can happen in the state of mind. Anything can get affected in the state of mind when the disease is going on. So that is this is an example which Dr. Henneman is giving to make us understand that how much it is important to consider the state of the mind and the disposition of the patient when we are prescribing, because they are already and every time affected, even in the physical disease. Even when the physically a patient is becoming weak or he's getting diseased or he's having some kind of pain, he's having some kind of chronic disease, the mind and disposition, they are always affected and they should always be taken in the selection of the remedy. So this holds good to such an extent that the state of the disposition of the patient often chiefly determines the selection of homeopathic remedy. And it is so good to that an extent that it becomes a prominent symptom, the disposition of the state of mind. It becomes a prominent symptom in determine in selection of the homeopathic remedy. Like I gave you the example of Naxomica. That disposition of the boy, it became a like he's so openly affectionate. So you need to think about the remedies which are openly affectionate like that, or at least we will not give the remedy which is completely opposite. That is how the rule out system works, how we have to throw out a remedy from our analysis as being a decidedly characteristic symptom which can least of all remain concealed from the accurately observing physician. And the thing about disposition, the thing about the behavior is that the patient can never withhold that from us. He can never withhold. If a patient is fearful, that fear will be shown. The way he talks, the way he is behaving. If a patient is timid, that will be shown. They will be soft in speaking, they will be low in speaking, the voice will be low, the eye contact will not be there. Okay. So if a patient is impatient, if a patient is who can suddenly go, that will also be seen. Even if he is trying to control himself or she is trying to control herself, that irritation will come up in some kind of words. So if we are observing in a very very accurate way, that symptom can never remain concealed, that symptom can never remain in obtuse state. It will always be revealed, it will always be shown. The creator of therapeutic agents, very beautiful word, the creator of therapeutic agents has also had particular regard to this main feature of all diseases, the altered state of the disposition and mind. For there is no powerful medicinal substance in the world which does not very notably alter the state of the disposition and the mind in the healthy individual who tests it, and every medicine does so in a different manner. So he's saying that the creator, when he was making these therapeutic agents, he kept this thing in his mind. He kept this thing in a very particular regard, that all the features of the disease, that there is no therapeutic agent, an agent, anything which can cure a disease or when given to a healthy patient can alter or bring out the symptoms of a disease He's saying that no, there is no such agent which does not alter the state of disposition of mind. So the creator of these therapeutic agents, he kept this thing in main regard, that whenever the disease is going to come, it is also going to affect mind and disposition. So the therapeutic agent, so the medicine, it should have the power to cure that mind and disposition also along with the physical part. So he's saying that if whenever you will test some therapeutic agent, you will always see that the mind and the disposition, they are always irritated. A very good example is quinine. Quinine is a medicine which have been used a lot, and I think that almost all the doctors, the old doctors or doctors who have given allopathic medicine, or they have recorded in a very detailed manner what has happened to the patients after the quinine. It was a very common thing which came with the quinine, that whenever it was given in large quantities to the patient, there was an intense irritability of mind, which came with the quinine, or a very uh, low state of mind, a dull state of mind, which is produced by the mercury. So even the doctors who did not took or gave medicine with keeping this thing in mind, that I have to prove the medicine or I have to see the effects of medicine, they were just giving the medicine as it was supposed to be given. But they also noted these kind of changes in the mental or the dispositional part of the patients, that after this medicine the patient has become more aggressive, more irritable, or he has lost the chain of thought, the intellect has become low after the medication. Because all the medicinal agents, they have this power to affect the mind and disposition when given in the healthy state, or even in the other states when given in large doses, they have this power to affect the mind and the body. So we shall therefore never be able to cure conformably to nature, that is to say homeopathically, if we do not in every case of disease, even in such as are acute, observe along with the other symptoms those relating to the changes in the state of the mind and disposition. So he's saying that we cannot cure homeopathically any patient, and it is very true. It is very true. I have seen doctors who have been prescribing from years just on the physical symptoms, just on some keynote symptoms, although they are taking it as a characteristic symptom, although they see that it is a something which is unique in the patient, but on a physical part, like for example, if I would have given Naxomica today, what would have happened? It would have ameliorated some symptoms. It would have ameliorated some symptoms which Naxomica would be similar to, or given a partial relief. They might have come afterwards, but the patient will not be cured. And I have seen this thing happening, that when we have given some uh, patient some medicine without considering or without taking into our analysis the mind, and the patients, they don't get better or they do not cure homeopathically as we believe that they should get cured. The second aphorism, the ideal cure, how it should happen, they don't get cured like that. They don't get better like that. The symptoms, they will come back, or some new symptoms will take place of the old symptom which is gone if it was of less intensity, but the patient remains sick. So even in acute cases, not only chronic cases, but even in acute cases, it is very important to take the change in the state of mind and disposition, how the mind and the disposition of a patient is changing over the course of time. And if we do not select for the patient's relief from among the medicines the disease force, which in addition to the similarity of its other symptoms to those of the disease is also capable of producing a similar state of the disposition and similar state of disposition and mind. I think just let me check if this it is written in a complete form. 230. Yes, okay. So we will never be able to confirmably cure. We will not be if we are not selecting a remedy which can basically affect the similar state and the disposition of the mind as it is shown in the patient. We have to select the same remedy, a similar remedy to that state of the mind and disposition, and every word is true because this thing has happened to me and I have seen it happening to many of other doctors around me when we have talked, some old doctors also, when I have seen their cases, that whenever this thing was not taken into conformity, into that final analysis, the cure did not came. The cure never came. There was a partial relief. There was some symptoms which have gone, but the patient always remained sick. Because when I started understanding it in a more deeper manner, when I went more deep into that thing, the sora is coming from somewhere of that state. The sora is basically arising from such states. So it is a very direct, we can say. I'm not saying that sora is a mental picture. No, please don't take it in a that way. No, but somewhere when the sora is affecting, it is affecting that disposition part and the mind part also, along with the physical body. It is developing everywhere in the body. So when it is developing everywhere in the body, and many times you have seen in yourself, whenever we are overpowered by some kind of emotional state which we are already having. For example, we are more overpowered with despair. Something, the things are not working the way we want them to work. The things are not happening as they are supposed to be. No? So we start getting more anxious or sometimes more sad. We are feeling that there is more failure than the success. So the body starts feeling more weak. There will be some kind of diseases or symptoms which will start appearing, which will make us more weak. Some kind of pains will start coming up. Some kind of muscular pains or some kind of weakness of the muscles. Some kind of states would start coming up where the body will feel more lethargic. Feverish feeling will start coming up. So there is a very close relation with the physical symptoms or the physical disease and the mental disposition, how we are feeling at that time. Suddenly if something good happens, you are in a state of elation, you are very happy, something has worked for you. Even the chronic pains, they subside for some time. Some kind of pain which was there, I always give an example that if there is a very good function going, like for example you are celebrating something, you are celebrating a birthday, you are celebrating an anniversary, you are celebrating some marriage in the house, suddenly the whole family is active. Even those patients, those people who have been suffering chronically from some kind of pain or something, they also start working up or doing something which in the normal days you cannot think of that person that they can do this thing. So suddenly when we are into that state of excitement, into that state, suddenly the whole body starts working in a very fine way. So there is always this psychosomatic relation there. It is always there. We cannot deny that the mind and the body, they get diseased separately. They are diseased at the same time. They get better at the same time. After the medicine, when the patients they start getting better, if it is a right remedy, if it is a homeopathic remedy, you will see that they start becoming better in every way. Not only their physical symptoms, but the mind shift is there. All those negative emotions, all those negative behavior, they start becoming less intensified, and good emotions or good behaviors. I have seen people who have stopped going for morning walks or exercises from 10 years, 12 years, because they didn't felt like it, because they had some pain in the they start going, they start doing it, they start feeling that kind of energy that yes, I want to do it. The people who were not able to uh, do some mental work because they felt dull, they felt there is no energy in the body, they start reading, they start reading the newspaper, they start enjoying the talks, they start enjoying the discussions. So when the disease is affecting, the whole is getting affected, and when the disease or the patient is getting cured, the whole should get cured. So footnote to aphorism 213. Thus, aconite will seldom or never affect either a rapid or permanent cure in a patient of quiet, calm, equable disposition. So, if a patient is of calm disposition, quiet disposition, the aconite will never affect either a rapid or a permanent cure, because the aconite is a very sudden remedy, very uh, angry remedy, very you can say blasting remedy. So if a patient is of quiet nature, very equable nature, very calm, aconite does not is not similar to that disposition. And just as little will nux vomica be serviceable, where disposition is mild and phlegmatic. If a patient is mild, like I told you that today the patient was very mild, extrovert, laughing kind of child, very happy child. Nux vomica will not work in those states, even if it is matching these symptoms. Pulsatilla, where it is happy, gay, and obstinate, because pulsatilla is basically a sad remedy. Pulsatilla is a mild and yielding remedy. So if a patient is very obstinate, very happy patient, you know, he is a very dominating patient, the pulsatilla will not work there. Or ignitia, where it is imperturbable and disposed neither to be frightened nor vexed. And ignitia will not work there where the person does not get frightened easily or does not get angered easily. The ignitia do not work because ignitia has a disposition, very sensitive, oversensitive disposition, which goes into strong emotional states very quickly. So if a patient is more of a very slow in his emotions, not showing much of his emotions, very controlled in the emotions, ignitia will not work as good there, as it is supposed to be. So the instructions I have to give relative to the cure of mental diseases may be confined to a very few remarks, as they are to be cured in the same way as all other diseases, namely by a remedy which shows by the symptoms it causes in the body and mind of a healthy individual a power of producing a morbid state as similar as possible to the case of disease before us, and in no other way can they be cured. So he's saying that when I'm going to give some remarks on the mental diseases, it will not be very different thing till what we have discussed till now, because they are to be cured in the same way as all the other diseases, because in all the other diseases the mind and the state of the disposition, they are always affected. So there is nothing very different which we have to do. Yes, there will be some points, there will be some things which we need to consider more, or we in the choice of the remedies we have to give importance to certain remedies which can produce these kind of states uniquely, because every medicine, it produces a unique state of mental picture, the dispositional picture. They have their unique states. So we have to understand those unique states from our materia medica also, and we have to understand those unique states in the patients also. Okay. So a power of producing a morbid state of the mental disease as similar as possible to the case of disease before us, and in no other way can they be cured, and there is no other way to cure them. There is no other way, because many times he will give the distinction of those diseases, that sometimes people think that the advice or counseling or some kind of you know um, if we can talk to some patient who have been suffering from mental disease, it can get them better, we should be very, very cautious about that, because in certain mental diseases, the counseling or any kind of remark which we are telling the patient, which we are telling them to follow, it can produce a very negative result. So we will be talking in the further aphorisms when we will go through them. So we have to understand that there is no other way. And I have seen patients who have been taking so many kind of medications, so many kind of therapies, so many kind of uh, things they had been doing their whole life in such conditions when they have been suffering from these kind of mental diseases. Some things have helped them for some time, but nothing has, you know, no therapy or no other medication have been able to cure the patient. Because whenever we are talking in homeopathy, we are talking about cure. Cure means that the patient should go to the healthy state. He should be healthy. He should no longer be diseased. So in order to produce that cure, Dr. Hahnemann is saying out of his experience, because he had also um, done all kind of things during his time, and he was a better person to tell this thing. And even the doctors who have been practicing from past 30 years, 35 years, 40 years, they can easily see when they have seen thousands of patients of that kind, and they can ask about what kind of treatments they have done, they have taken. We can see that nothing has helped them for a long time. Cure is a very distant this thing, but nothing has even helped, like just to make them stable in these kind of cases of bipolar mania, schizophrenia, some deep depressions, some suicidal mania, some panic disorders, anxiety neurosis, or some this disease of the children like autism. So nothing have helped those patients. And in homeopathy we have cure, but we have to see, we have to understand the way how we have to see the patient and how we can approach that case, what we have to keep in our mind while approaching such cases, because that is what is going to help us to cure such patients. So we have to give very keep a keen mind, keep an open mind when we are approaching such cases. So we will discuss the whole part of that mental diseases in the next class on next Wednesday. Today we have understood the importance of the dispositions, that why they are important, why the mind or the state of the disposition is important in choosing a remedy, not only in the mental diseases or the cases which are um, arising from such things, but in all the cases, whether it is a physical disease, whether it is an acute disease, because the mind and the state of disposition, they are already every time they are affected, and we need to choose a remedy which is also similar to that state of mind and disposition. So whenever, that is why whenever we are seeing the cases, we give importance to that part. We take, we have a different section in the case taking, that how the patient feels, what are their usual behaviors, how they act in the states of anger or fear, or when they are anxious, how they act in that thing, because that all tells us about the state of the mind of the patient. So keeping that in mind, just go through these aphorisms again, so that, because it is a characteristic symptom in homeopathy. When we are prescribing, we are just searching for the characteristic symptom, and it is the biggest characteristic symptom which is always present and is always in front of us. It is always in front of us. You don't need to go into the study of psychology to understand that thing. You don't need to study something separate. You just need to see the patients with a very keen interest in how they are behaving. Once you start paying attention to how they are behaving, how they are telling the things, how what are they doing, what are they doing when they are at home, how they their social relations with the other people, and you will start understanding the disposition of the patient. You will start understanding the mental picture of the patient. You don't need to understand it in a very deep manner, but yes, a general picture, how they are, only that can give us an insight that okay, this can be this remedy, and he cannot, she cannot be these remedies. So from there the clarity of the case starts coming. Okay, but that also does not mean that it is the only important symptom. It is an important symptom along with the other important symptoms which belong to the generals of the patient, which belong to the particulars of the patient. So there also we have the characteristic symptoms. But yes, when we are talking about the mental diseases, it will be more in the state of mind. So when we are going to cure, we will talk about it in detail next time. So we have to understand how the patient has been behaving since he has become sick. So just go through these aphorisms once again, and if there is any problem, anything which was not understood, we can discuss it again in the next class. So till then, thank you and good night. So today we are going to continue with a further aphorisms. We have done till 205. So today we will start with 206. So I hope that till this part, like we have done 205, 205 aphorisms of the organon. So I hope that the things are clear till now, because every time I tell uh, everyone that just go through the old aphorisms once we start with the new, that whatever we have done like in the last week, it is better that we go through that, we revise that thing again and then continue with the next part so that a link can be made. Because these aphorisms, they are like, you know, stairs. We are going up, we are ascending up. So the connection with each of them is very important. So in our mind also, that connection should be there, that this aphorism basically says this and the next aphorism is about this thing. So I hope that because last time we started with the miasm thing, there was a little introduction of the miasms, that although in organon Dr. Hahnemann has not given a detailed view on the miasm part, but in his book of the chronic diseases, he has given a detailed view of the miasm, that what it is, how it is seen, what are the symptoms, what we have to bear in our mind when we are, although that part will come in this part also, in the organ part, that when we are taking the case, how we have to keep that miasmatic part in the mind, what we have to ask, what we have to see. So now these aphorisms, they are regarding the miasm, what should be done in which miasm when you see that thing in the patient in front of you. Then next we will start with the mental diseases. There will be a general introduction on what is disposition, why it is important, and then we will start with what are the mental diseases and how they should be cured basically. So aphorism 206: before commencing the treatment of a chronic disease. So before we start with any kind of treatment of a chronic disease, any kind of chronic disease which the patient is suffering from, when we start the treatment, it is necessary to make the most careful investigation as to whether the patient has had a venereal infection or an infection with the condylomatous gonorrhea. So he's saying that before commencing or before starting the treatment of any kind of disease, any kind of chronic disease, it is very important that we should ask the patient whether he had suffered from any kind of syphilis or gonorrhea, he whether he has taken any kind of treatment, whether he is currently suffering from it, because it is very important to know. For then the treatment must be directed towards this alone, and if he has suffered from that thing or he is currently suffering from that thing, then this part should be first treated with the anti-syphilitic or antipsychotic medications. For then the treatment must be directed towards this alone. So first we have to treat this part alone, because this is a secondary miasm. Because in such cases, like I'll tell you an example of such a case. We had this lady who was suffering from this destruction of the whole eyeball, the right eye. It was completely, when she came to us, she had this eye operated out because this eyeball, it completely got necrosed without any reason, without anything. It started becoming inflamed. Then there was this pus discharge which started oozing out, and when she was checked, that the doctor told that it is completely destroyed and necrosed, and we have to take it out, otherwise the whole necrosis will go into the skull or the brain. So this right eyeball, it was completely removed, and when she came to us, the left eyeball started getting involved with the same kind of affection. So then she came to us. So when we took the case, we were seeing, and when you have been seeing the cases from so long, something strikes you that how come so suddenly this, so much destructive process has happened with this person without any prior disease. There was nothing prior to it, and suddenly she started getting this thing. So when there's difficulty in making that connection, that you are not able to understand that from where it has come suddenly. And that is the time, although we should do it in each and every case, but the I will just tell you where we usually ask about these things, but the patients, they sometimes conceal it, they don't give the information about it. So even in those cases, we should have this thing in the mind by looking at the disease, by looking at certain symptoms that he might have suffered from that syphilis or gonorrhea, he or she. So we asked her that whether you have taken any kind of such treatment or you have suffered from this kind of problem. So she said, no, no, I have never. So, and then we asked about the husband, that whether the husband has, like, according to your knowledge, has your husband suffered from this kind of problem, or he has? And she said, no, no, not that I have heard of, or if you want, I'll ask him, but I don't think he has. And he told that he has not when she asked him next time. But still in the mind, it was no, that somewhere, this picture is of the secondary symptoms of syphilis. That's, it does not fit into that, how the psoric miasm progresses, it does not fit into that. So we gave the medicine. I wrote it down in a query that maybe we will need some antisyphilitic treatment along with it. So by the chance, how how the journey of some patient has to go, next time the husband also came for taking the medications. He wanted to go abroad and he wanted to submit for his medical records. He had some issues with his liver and SGOT, SGPT. So we gave the medicine, and next, after 15 days, he had to conduct these tests which are necessary for going abroad to settle. So in those tests, he came out to be, the syphilis came out to be positive. So then I asked him about, then he, yes, I had some kind of this thing in the past, some kind of relation, and I got infected and I was treated for it. So that became confirmed, but still before that we had already started with that lady, this anti-syphilitic, like we started with the Merck Soul for her. We will go into those details later on in some other time. But it is very important to know in such chronic cases that whether there has been these kind of affections or this to the patient, so that we can basically take care of that also. Because the first thing is that before starting any antipsoric treatment, we have to start with the antisyphilitic or antipsychotic treatments if they are present. So when they are present, the treatment must be directed towards this alone when only the signs of syphilis or of a rare condylomatous disease are present. But this disease is very seldom met with alone nowadays. So nowadays, we don't get such, even with the patients coming to us, very rarely you will get an acute or recent case of syphilis or gonorrhea, because most of them have been maltreated. Some medicines have been taken. The patients, they don't disclose it very easily, but still we have to do our duty according to what is told to us. If such infection has previously occurred, this must also be borne in mind in the treatment of those cases in which SORA is present. So because when the SORA and psychosis and syphilis, they mix up, they become a very complicated picture. Because in them, the later is complicated with the former, as is always the case when the symptoms are not those of pure syphilis. So when the symptoms are not of pure syphilis, then the SORA, most of the time the soric affection is already going on in between the syphilis or the psychosis. The gonorrhea, it peaks up and they become intermingled. For when the physician thinks he has a case of old venereal disease before him, he has always or almost always to treat a syphilitic affection accompanied mostly by complicated with SORA. For the internal H. discretia, the SORA is far the most frequent, most certain fundamental cause of chronic diseases, either united, complicated with syphilis or with psychosis, if the later infections have avidly occurred. So in such cases where patient has been affected or infected by the venereal diseases, because without the permission of SORA, even the psychosis and syphilis, they cannot come in. Mostly psychosis and syphilis, they come when the SORA is in a latent stage. So, but when we have to cure it, when we have to treat it, when we have to give up medicine to the patient and they are suffering from this kind of the thing, so we have to remove that kind of symptoms. We have to remove those symptoms of the venereal miasms first and then give an anti-soric or a constitutional remedy to the patient. This does not happen in every case. Okay, there are cases which are of pure psoric origin. Most of the cases are of pure. Only in certain cases you require this kind of treatment or this kind of thing which is given in the book Chronic Miasm. There are many kind of variable treatments given when a patient is suffering from psychosis or syphilis, depending upon whether it is of recent occurrence or of some old occurrence or it has been suppressed. So depending upon the medicines are given for removal of it, but it is very I will not say rarely, but very less frequently encountered thing. Or as is much more frequently the case, SORA is the sole fundamental cause of all other chronic maladies. Okay? So basically, SORA is the sole fundamental cause of all the chronic maladies, whatever names they may bear, which are moreover so often bungled, increased and disfigured to a monstrous extent by allopathic unskillfulness. So all the chronic maladies which come naturally, SORA is the fundamental cause for that. And when they're bungled up with some kind of medications, because in chronic disease what happens is that when some, for example, someone is having some kind of neuralgic pains from a long time, some kind of GIT trouble, some dyspepsia, and they have been taking some medications, some allopathic medications or some other medications which have been aimed at the uh, disease, not on the whole, not on the sick patient. So some symptoms they get bungled up. Bungled up means that the original picture is lost. Some symptoms of the medicinal disease they start coming up, they start forming up, which we call as the side effects. Okay, but that is a medicinal disease, because once you start telling people that it is a medicinal disease, it the people will become afraid of medicine. So we call them as the side effects, that medicine is affecting in a positive way, but some side effects are there. But no, it is not side effect, it is basically the medicinal disease, it is a medicinal dyscrasia. So footnote to aphorism 206. In investigations of this nature, we must not allow ourselves to be deceived by the assertions of the patients or their friends, who frequently assign as the cause of chronic, even of the severest and most inveterate diseases, either a cold caught, a thorough wetting, drinking cold water after being heated many years ago. So in this aphorism, basically Dr. Hahnemann wants the physician, wants the homeopathic doctor to know this thing, that the chronic disease, when you are dealing with the chronic diseases, there is something which has caused that disease and which is basically um, keeping it up, keeping the symptoms up. For example, if you get affected by cold air, okay, you will sneeze, some mucus will come, but after a few minutes or an hour it will settle down, or a day it will settle down on its own, because now you are not being getting continuously exposed to the cold air. So there is no need for the body to react to it, because there is no stimulus. But in chronic diseases, when we see at the chronic, for example, diabetes is there, for example, hypertension is there are some chronic pains, there are some chronic weaknesses which are happening, some chronic headaches. So what are the things which are making, basically stimulating that thing all the time and keeping it up in the patient? So there has to be some constant cause, some fundamental cause to it, which is making those symptoms and keeping it up. They are developed and they remain there, or they develop into something next. So because of this thing, Dr. Hahnemann wants it to be very clear for the physician that some old cold or some cold which patient once caught by getting wet or by drinking some cold water or by being heated, it cannot be the cause of a chronic disease which has happened years ago. Many times patients will come that, okay, once 5 years ago, 6 years ago, he had a this, he went to the mountains, he got exposed to the cold, and he started having this breathing difficulty, and from that time he has developed this asthma or some chronic bronchitis. That cannot happen. At once some cold, and it even after 5 years, 6 years, that is still acting upon the person. No, it cannot. Those things can basically stimulate the patient from the latent sora stage, but they cannot keep acting, or they are not the producers of the disease. Or a former fright, a sprain, a vexation, sometimes even a bewitchment, etc. Or some kind of vexation many years ago, or some sprain and some fright, or some kind of, if patient think that some black magic was done on him, those things, they cannot keep up a chronic disease. These causes are much too insignificant to develop a chronic disease in a healthy body, to keep it up for years and to aggravate year by year, and every year the problem is aggravating. Like we have also talked about it many times before also, that once a chronic disease starts, it keeps on increasing, it keeps on increasing until a right remedy is not given, it will keep on increasing. So year by year it is increasing, it is getting aggravated, it is there all the time. So those small things, those small affections which once happened, they cannot keep it up and keep it increasing every year. There has to be something more deeper than that, as is the case with all chronic diseases from developed sura. So Dr. Hahnemann, he gave this miasm the name of sura. This is the miasm from where everything is developing. Causes of a much more important character than these remembered noxious influences must lie at the root of the initiation and progress of a serious obstinate disease of long standing. because they are very obstinate diseases. Chronic diseases are very obstinate. The progress is a serious progress. They are progressing continuously from long time. So these assigned causes or these causes which the patient is telling about or the attendants are telling about, they don't make a sense for that thing. So the assigned causes could not only rouse into activity the latent chronic miasm. Like I told you, that if they can only just bring out the latent chronic miasm, but it was always there. It was ready to erupt. One small stimulus and it will erupt out. But that is not the cause. So we have to understand this thing. So when the above information has been gained, it still remains for the homeopathic physician to ascertain what kinds of allopathic treatment had up to that date been adopted for the chronic diseases, what perturbing medicines had been chiefly and most frequently employed, also what mineral baths had been used and what effects these had produced, in order to understand in some measure the degeneration of the disease from its original state. So once we have taken this information, now we are gathering the information, from where all these symptoms are coming in a chronic disease, whether they are from the psychotic miasm or the syphilitic miasm, or they purely belong to the psoric miasm, or they basically belong to the medicinal disease, which have been caused by the various treatments, various kind of the things which have been applied or employed by the patient. Okay? So we have to understand whether what kind of effects these medicines, the allopathic treatment, from how long the patient has been taking, what new symptoms came up after this medication. Patients usually know about this, that these symptom basically started when I started taking that medication. So they usually know until the symptoms are very subtle or they have not been come to the conscious part of the patient. Usually the patients, they know that these things happened after I started taking this or that medicine. So in order to understand in some measure the degeneration of the disease from its original state, and we also have to understand that how much the disease is more degenerated or more complicated from its original state. Okay, and where possible, to correct in part these pernicious artificial operations, and how we can make some changes to his medication, or how he takes or what he takes, whether, like, many a times, this pentoparazole, it is always given, some antacid is always given with the medications, or some kind of, uh, whenever a patient has blood pressure, some kind of statins, they are always prescribed. So we have to understand whether these medications, if even the patient has been taking from a long time, which of the medicines we should tell them not to use right now, or to enable him to avoid the employment of medicines. Okay, which medicines can be, removed from the is this medicinal diet. We call it medicinal diet because, you know, we, some people, they take medicines as if they are taking food. I was, like, recently a patient came. She was taking 18 different kind of medicines in a day. 18 medicines. So whatever was necessary, at that particular, because many times the patients, when they are taking medications from very 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 long time, the body has become dependent upon them. So suddenly we cannot tell them to stop. If it is of recent this thing, not very serious condition, usually we tell them, okay, you can stop this. We are giving the medicine and it will take care of it. But then when the patients, they are completely dependent upon that thing. Many patients who have interstitial lung disease, like recently I had a patient, that lady is completely dependent upon steroids. Even if one dose is missed, and the whole, this body will start getting swollen and she will start having difficulty in breathing. So in those cases we cannot say them to stop the medication immediately, but at least we can remove those medications which are not required from her, this part of the medicinal routine, so that the body can have less to fight against. Because at the end, the body has to fight against the disease. We are just helping the body, we are just helping the vital force with our medicines, but at the end, the vital force has to fight against that part. So the more pressure is put on the vital force by these kind of medicinal diseases, those kind of things which are not needed. So with our interception, we can basically do this thing is that decrease some medicines which are not required. So just we have to keep a note, make a note of what kind of medicine they have taken or have been taking, so that we can tell them how to uh, decrease the dose, or how they have to manage this thing. So the age of the patient, his mode of living and diet, his occupation, his domestic position, his social relation, and so forth must next be taken into consideration. So next we have to take into consideration is the age of the patient, what kind of age is of the patient is, whether that is somehow hindering or favoring the disease process, his mode of living, how he lives, what kind of diet he's having, what kind of occupation he's having. For example, if a patient is basically working in a factory or working in a place where there is too much of dust, and he has to put on the mask all the time, so we have to consider that thing, that that may be also a part or a small part of the causation which can be removed. We can tell them that with your conditions of this thing, don't do work there. His domestic position, how it is, how are his social relations, must next be taken into consideration in order to ascertain whether these things have tended to increase his malady. That something out of this, for example, if someone is in a relationship which is harming him, some kind of friend, some kind of boyfriend, girlfriend, some kind of relative, or some partner in the business where he has been taking a lot of hit, so we have to advise them accordingly. It is our duty as a physician to advise them that this thing is affecting you, make some amendments about it, get out of it, or do something else, or how in or in how far they may favor or hinder the treatment, and how those things may favor or hinder the treatment, that also we have to assess, that what he should do which can help the treatment, or what he should stop out of all this thing, some part of his occupation, some part of his diet, some part of how he has been living. Like the person is having a very sluggish routine, so we must advise him that go for some walk, you can go do some exercise, stretch yourself, so that it can favor that treatment. In like manner, the state of his disposition and mind must be attended to. So similarly, we have to also see what kind of state of mind he has been, whether he's anxious, whether he's sad, and what is making him anxious or sad or angry or depressed, how is he, or requires to be directed, encouraged, or modified. And we have to see also, assess also, whether his this mental state or disposition, rather we need to direct it or encourage it, whatever he is doing, or it should be directed to something else, or somehow we, if we can modify it. The pathological states of the mind, although it will come in the next aphorisms, that there are different kind of stages, and where we can intercept or interject it, or where we should not, everything will come in the coming aphorisms till aphorism 230, and we'll go through one by one. But there are some states of the mind or of the which have come as pathology, so there you cannot direct it. We have to understand this thing. For example, a patient who is suffering from autism, you cannot direct him or modify his behavior. He's not going to listen to you. On the contrary, we may aggravate the situation. The child, he or she will not, they will not listen to the advice, because they're in a some pathological state, some disease state. But then there are something which is happening because of the circumstances around us. You know, like for example, today a couple came to our clinic. Me and Dr. Vidya, we were there, my wife, and this couple, they were telling about the symptoms or the things which they are going through, and their, the personal thing about what was in their relation, that. So we gave them some advices. We gave them how they can, and when they were about to go, they were happy that okay, maybe this can help us, in getting better as a person, also as a couple, also. So when the circumstances are like that, then yes, your encouragement or this direction of the mind or the disposition, it will help. You encourage someone, you tell them that they can do this thing this way, it goes to the mind, they can take it and they can do as you have advised them to do, but not in a state of pathology. When we will be talking about the mental disease next, and I think maybe next week we will be talking about them. So there you will see that there no encouragement, no advice, nothing can help the patient. On the contrary, it will aggravate. So as a physician, that is also what we have to decide, that in which category this patient is. Whether the patient is basically suffering from a pure complete mental disease, a pathological mental disease, or just some emotional disease because of the circumstances, because of the part of the life which has been there. So after this is done, the physician should endeavor in repeated conversations with the patient to trace the picture of his disease as completely as possible according to the directions given above, in order to be able to elucidate the most striking and peculiar characteristic symptoms. So the physician, he should go into repeated conversations with the patient, take a complete picture, depending upon the miasms, depending upon some kind of medicinal disease, all the steps which have been told us during the case taking. So we have to ask again and again about these things, make it more confirmed, make it more particular, so that we can find some characteristic symptoms. Like now, you all have been going through all these aphorisms in these lectures. You can see how many times Dr. Hahnemann has used this word characteristic symptom, because it is very important and it will keep coming on again and again, because all this thing which we are doing, going through whole the case, asking about the history, asking about some kind of diseases which the patient had, asking about what kind of medicines he have taken, this all is to find the characteristic symptoms. That is the goal, that is the aim, that is the motive, in accordance with which he selects the first antisoric or other remedy. Because only this finding of the characteristic symptoms, it can help us in selecting which medicine we have to give, so that our medicine is symptomatically or homeopathic to the disease. Other remedy having the greatest symptomatic resemblance for the commencement of the treatment, and so forth. So aphorism 210, we will start from here, because from here the mental disease will start. The aphorisms on the mental diseases, how we have to understand them. From here they will start. So we will start it in next class. We will stop at 209 today. And again, just go through these aphorisms. I will also, although I have taken a lecture, if I don't know if it is present on YouTube, maybe if it is present, Dr. Rishabh, he will share that particular lecture with you in the group. But if it is not present on the YouTube, or if it is not present with us, then go through the chapter in Dr. Kent's philosophy. There are two chapters on Sora. I will also say that go with the psychosis and syphilis, but at least go with the Sora. What Dr. Kent there describes about Sora is a wonderful explanation. Dr. Henneman has given a wonderful explanation on the Sora. But that explanation has confused physicians because the physicians did not join it, the understanding of that surah, they didn't join it with the organon. If you join both the things, if you keep both the things and try to understand, then you will have a very good understanding what Dr. Hanuman wants to tell you. And that understanding is told by Dr. Kent when he tells about surah, because he has joined both the things, the organon and the chronic disease. When you see, look at both the things at a one single go, then you get a beautiful picture of what Dr. Hanuman wants to tell us about surah. But still, if before that, I will again tell you that go through that chapter of surah. There are two chapters of surah in Dr. Kent's philosophy. Okay, there is a question. I'll address to it later. So there are two chapters on Dr. Kent in Dr. Kent's philosophy on surah. Go through them. Try to understand each and every word what Dr. Kent wants to tell, and you will have a very beautiful understanding of surah what it is. If we can get that lecture, if it is present on YouTube, we will put it there. But still, if you listen to the lecture, if we find the lecture and you listen to it, still go through those two chapters in Dr. Kent's philosophy. So Vishwangi asks, can long-term grief, disappointment, vexation cause chronic disease? There is nothing like a long-term grief or disappointment. Just look at your life. There are life phases in the life when you are sad and you are happy. So we will not say that, for example, something happened at one particular time. With the passage of time, the emotion or the memory of that thing will decrease. It will never increase, first of all. For example, there was a sudden death in the family. With the passage of the time, yes, you will remember that person. You may cry sometimes, but the memory and the wound or the hurt, it decreases. That is the nature. That is the basic nature of everything which is universe. Okay, that nothing is steady. Even the pain is not steady. Even the grief is not steady. Even the disappointments are not steady. We move on. That is how we have been evolved. That is how we have been as an organism of this whole universe. So there is nothing like a long-term grief. Yes, things can add on to that grief, to that disappointment, to those vexations. Some new things can come up, which can make it more bigger. But again, it will not be a long-term thing. There are phases when you are happy. There are phases when you are sad. There are phases when you are successful. There are phases when you are disappointed. There are phases when you are angry. There are phases when you are happy. So that is all ups and downs of the life. But if we see that grief or an event in the life can cause a long term effect on us, then no, it cannot. One event cannot. Many events they can, but then there will be different kind of effects which will again be temporary, or this part becomes a state of disposition which we'll talk about in next this thing. If the sadness becomes a state of disposition, then yes, that sadness that can cause or become a part of the chronic disease, not cause the chronic disease, but it becomes a part of that chronic disease. Causation is somewhere else. Causation is not here. All these things they happen because a patient is suffering from sora. The state of mind, if it is into some kind of grief, disappointment, vexation, some lack of confidence, a patient has gone into that state, continuous state, that is because of the sora which has already been happening. That is why I am saying you just go and read that chapter on sora, or listen to the lecture if we find it. Then we, if you still have any question about it, any doubt about it, we can again talk. But first go through that. But yes, to the question that no, it cannot, because there are no long-term griefs or disappointments or vexations. State of minds are there, which we call as dispositions. But then again, that is a part of the disease, not the causation of the disease. What is disease cannot be the cause. So cause is again sura, and we have to understand what is sura, how it basically develops in us, and how it starts affecting the physical body. So with that, I will take your leave. Just go through these aphorisms once again, and from next Wednesday we will start with the mental diseases, because next Wednesday we will have this lecture, but then next when like week next to the next week we cannot be having, because I will be traveling at that time. So I think that next week we will try to do around 9 to 10 aphorisms, so that that one part of mental disease we can clear out, that what is the mental disease and how we have to proceed it, how we have to see it. So with that I will take your leave. Thank you. Good evening everyone. So after a long time we have gathered here again to continue our series on the organon. So the last time we were doing, or we were talking about the local diseases, the diseases which appear on the skin, why they appear, how they appear, and what should not be done in such cases, along with the homeopathic treatment which we have to do. We were talking about that. So today we will continue more about the same thing for few more aphorisms. Just a minute. Yes. So we will continue from, we have done up till aphorism 198, and we will continue from there with the aphorism 199, and we'll try to complete it till 205, where there will be this introduction to the miasms, uh, how the miasms they basically play a role in the continuity of the chronic diseases. We will talk about that thing also. Although we have talked about this thing in our previous lecture on Sora, we have talked in detail that how the Sora it basically progresses, how it starts taking the roots into a person, and how it makes the person sick, and how it is basically a root to the chronic diseases. We'll talk in brief about that today. So aphorism 199. If the remedy perfectly homeopathic to the disease had not yet been discovered, at the time when the local symptoms were destroyed by a corrosive or desiccative external remedy or by the knife, then the case becomes much more difficult on the account of the too indefinite, uncharacteristic, and inconstant appearance of the remaining symptoms. So, Dr. Henneman, he's trying to tell us that if we have not yet found a homeopathic remedy, like if the local symptoms they were destroyed by some kind of local treatment, or some kind of desiccation, or some kind of, the removal was done by the knife, or some kind of operation, if the local symptoms are disappeared and the homeopathic remedy is not find the perfect homeopathic remedy, then it is become this kind of case, it becomes very difficult. Then the case becomes much more difficult on account of the two indefinite uncharacteristic symptoms. As we have done understood it before and discussed it before also, that in such cases, the cases where the disease is local, where the disease is on the external sphere of the body, on the skin, that appearance or the characteristic of the lesion or the eruption, that is what basically defines which homeopathic remedy has to be given. So that symptom in itself is very important. So when that symptom is removed, because in most of the skin diseases, like if you see, if you have some patients who have some skin troubles from a very, very long time, like that skin trouble, it came as an initial disease, when the whole disease started, and it has never gone. So in such cases, although they have been taking too much of treatment, the symptom is still there, because the body, basically the vital force, it tries to keep the disease in a more external part, so that the disease does not develop internally. That is the way, that is a defense of the vital force. Where the vital force is of more resistance, is more strong, it will try to keep it in a more outer part. So in those cases, in those patients, you will also see that there is very less internal diseases or internal symptoms which have developed. You will rarely see such cases that they have developed some kind of diabetes or hypertension or some kind of internal ulcers or some other kind of, structural diseases inside. You will very rarely see in them. The people who have been having skin disease from beginning, and they still have, that it was not treated, it was not treated properly, it was, it was not suppressed by the local, you will see that their vital force has a strong resistance, that it has not let the disease travel inside. Dr. Henneman will speak about it in coming aphorisms. But when it is gone, like, if the vital force cannot produce much resistance, it gives into such kind of treatment and it is gone, then we are not left with anything, because homeopathic prescription basically depends upon the characteristics. Anything which makes the disease individual, that is where we have our remedies basically hidden. We have to find our remedy from that part. So when that characteristic part, which in such cases is in a form of local symptom, the kind of, like, and day before yesterday I had a patient, the lesions or the eruptions, they were of purplish kind. The color was purplish, the bluish reddish color was there. So that is a characteristic thing. If it would had been treated with some kind of local ointment and I would not have seen it, or it has been gone, then we will not be able to give a perfectly homeopathic remedy which can cure this thing. So similarly, in those cases where the homeopathic remedy was not found and the symptoms, they were destroyed by such kind of treatment, then the case becomes very, very difficult to prescribe upon, because there are no uncharacteristic symptoms. And the symptoms, even if some symptoms are there, they are of very inconstant appearance. They come sometimes, they are not there sometimes. So for what might have contributed most to determine the selection of the most suitable remedy and its internal employment until the disease, everywhere in the cases, in these aphorisms, where Dr. Hahnemann is talking about the local diseases, the diseases which come on the skin, he makes sure to tell the reader, to tell the physicians how the medicine is to be employed, the internal employment. The medicine has to be given internally, not externally, everywhere. So he has continuously told in the previous aphorisms not to use any kind of treatment externally. Why? He has told us. And on the contrary, he has told us in all the other aphorisms to give an internal remedy, which is most suitable, which is most homeopathic. And its internal employment until the disease have been completely annihilated, namely the external principal symptom. So this skin symptom, this local symptom, it was the principal symptom. It was the main symptom from where the entry to the case was done, from where we would have to make sure that which remedy is to be given. So when that principal symptom is destroyed, it becomes very difficult to prescribe in that case. So in such cases, then we have to wait for a long time for again a new set of symptoms to come up, so that we can decide upon our remedy. But during that time, during those 6 months, during that 1 year, 2 years, the disease has progressed a lot. So basically we have lost our chance to cure the patient where it can be cured very quickly, and we have given the time to the patient for the disease to develop. So aphorism 200, had it still been present to guide the internal treatment, if though a symptom was still present, if it was not destroyed, if it was not, removed by some kind of operation or some kind of, mechanical means, if that symptom would had been there, had it still been present to guide the internal treatment, if it had been present to search for the homeopathic remedy for the whole disease might have been discovered. So if that symptom would have been present and we would have discovered the homeopathic remedy, and has that been found, the persistence of the local affection during its internal employment would have shown that the cure was not yet completed. So if we have given a homeopathic remedy, if that symptom, now how that symptom guides us? It guides us in two ways. The one is to search for a homeopathic remedy. It becomes a characteristic symptom which helps us to find a homeopathic remedy. And in second, when the local affection is not going away, by giving an internal medicine, when we are giving an internal treatment and the local affection is not going away, it is persisting, then it shows that the cure is not yet completed. So in second instance, it also tells us the persistence of the local affection, the persistence of the local eruption or local malady, that the internal disease is still there. If we apply something on it and it disappears, we are not sure that the internal disease is gone or not, whether the sora has been cured or not, because then it will show in some other kind of symptoms. So even the presence of such a symptom, if it has been not cured, it can also tell us that the internal employment of the remedy, whichever we have given, it has not yet completely cured the patient. But were it cured, and if it is cured by the homeopathic remedy, by the internal treatment, on its seat, this would be a convincing proof that the disease was completely eradicated. Because we have not applied anything on it. It came from the internal disease, and when it goes away, that can be a convincing proof that the internal disease has also gone away. Because the internal disease was the causation for the occurrence of it and for the persistence of it. It occurred because of that internal infection and it persisted because of that internal infection. So when it is gone, it becomes a convincing proof that the disease is completely eradicated and the desired recovery from the entire disease was fully accomplished. An inestimable, indispensable advantage. So even if it is not getting cured, it gives us an advantage to know whether our remedy is right and wrong, towards which direction the cure is going on. So aphorism 201. It is evident that man's vital force, when encumbered with a chronic disease, which it is unable to overcome by its own powers. We have already established in the previous aphorisms where Dr. Hahnemann tells us about the vital force. That vital force, when in a healthy state, it provides health, a harmony to the body. But when it is weakened by some chronic disease, by some kind of acute disease, then it does not have the power to overcome it. It cannot overcome it, it cannot cure it. It will always need a physician which can help it to cure the patient. But on its own, whenever it is affected by some kind of chronic diseases, it is not able to overcome it. So the same thing is told here, that it is evident that man's vital force, when encumbered with a chronic disease which it is unable to overcome by its own powers, adopts the plan of developing a local melody on some external part. That is why, in any kind of miasmatic start of a chronic disease, the first symptom is always on the skin. In sora, that itch, it comes on the skin. In psychosis, that gonorrhea, it comes on the skin. And in syphilis, the chancre, the ulcer, it comes on the skin. Because whenever some chronic disease starts because of the miasm, because of the internal disease, the first, when the vital force is not able to repel that disease and that disease is becoming stronger, the first defense which the vital force produces is that it adopts the plan of developing a local malady There's a plan. There's a genetic plan inside the body that whenever it is attacked by a disease, the first symptom they will appear locally on the skin. That is how the vital force basically intercepts the development of the disease. Solely for this object, that by making and keeping in a diseased state this part, which is not indispensable to human life. Skin is, it is an important organ, very important organ, but it is not indispensable to the human life. It is not that whether if the disease comes on this part, that something danger or dangerous can happen to human life. Okay, it is not like this. We have more vital organs which are inside the body. So this is the most outer part. So the body, sorry, the vital force and the body, it basically tries to keep the this disease on the most outer part of the body, which otherwise threatens to destroy the vital organs. But if the vital force has not done what it is meant to be done, then the same disease can go more deeper and can threaten and destroy the vital organs on which our life depends, which are very vital for our life, and to deprive the patient of life, and that it may thereby, so to speak, transfer the internal disease to the vicarious local affection and, as it were, draw it thither. So what is this vital force? What does it do when it is attacked by the chronic miasms? That it tries to keep the disease on the external part, on the external this thing, because this disease, if it is let loose, if there is no control or no pressure is exerted by the vital force against it, against the attack, then it may destroy the life of the patient. It may become so dangerous that it can affect the vital organs and the life can be taken away from the patient. So the best way, according to the intelligence of the vital force, is that to keep it on the local part, to keep it in the outer part and just let it be there. That is why I was telling that there are many, you will see many patients. I have seen many patients, who are suffering from skin disease from past 30 years, 40 years of their life, 20 years of their life, and very few symptoms have developed inside. Although the outer one, the skin problem is not gone, like someone suffering from psoriasis, eczema, dermatitis from a long time. So their body, the defense has been so much persistent that it has not let it break through the skin. Although the new parts of the skin may have become affected, like it started from elbow, then it went on to the skin, then to the chest, then to the back. So that shows that that the disease has increased. But although with the disease increase of the disease, the vital force has kept it on the external part of the skin. Just think, if it would have spread into the internal part, how would it have spread? With how much force, with how much energy it would have spread inside if it was not kept outside on the local part. So the presence of the local affection thus silences for a time the internal disease. So this presence of local affection, what it does is it silences the internal disease. The progression of the internal disease is basically halted. Though without being able either to cure it or to diminish it materially. But the vital force, it does not have the power to cure it or to reduce it or to diminish it. The local affection, however, is never anything else than a part of the general disease. Like we were discussing last time also, when we had this thing, we had this class, that the local affection, the skin diseases, it is mostly sensed as something which does not belong to the internal part. It is something external. If we remove it, it is gone. Usually it is think of like that. But we have to understand, as a homeopath, as a physician, that it is not some different thing and should not be treated differently. It is the part of the whole. It is a small sign and symptom which the body is showing that it has started getting diseased. So we should not take it in a lighter way. We should give it more, very importance, because this is the first barrier. If it goes past that barrier, then it will start developing internally. So the local affection, however, is never anything else than a part of the general disease, but a part of it increased all in one direction by the organic vital force. So the vital force, what has it has done, that whatever the increase in disease has happened, it has thrown it out on the external part and transferred to a less dangerous external part of the body in order to allay the internal ailment. So to decrease the internal ailment, it has just thrown it out on the external part. But as has been said by this local symptom, that silences the internal disease. So that is why we say that suppression of some skin disease is a very dangerous thing. And in such cases where the suppression has been done and then some disease has progressed, and when you give a homeopathic remedy and that disease started getting better and the reappearance of some skin symptoms come, that is a very good thing. It is a very good sign. Today there's this lady who has been taking this treatment from me from past 1.5 year. She's a doctor herself, and she has been taking this medication for the gastric ulcers. She has a very strong dyspepsia and gastric ulcers, some problems with her urinary bladder, some problems with the menstruation, and another many small problems she had. And she has been getting better from past 1 year. She has been getting better. Some symptoms have gone, some old symptoms have come up. So today she sent me the picture that, doctor, I have started getting this eruptions and acne on my face. So I again asked that, like in the, like previously, did you used to have? She said that my whole problem started with this thing. That in my teenage, when this thing started, and I started taking treatment for it, then I started feeling this, this dyspepsia and my disturbance in menstruation. Said that at that time it used to be very bad, so I had to take many kind of treatments for it. And after that, I have started feeling that all these problems which I had has started. So when you see such cases and you go through the organon, you see the similarity. You see the same thing which is written happening in front of you. That yes, the patient has told this thing that, and we have seen, the patient has seen, we have seen, and then when they start getting better, the reappearance comes, the same kind of symptom coming up mean that it has never gone. It was never gone. It was always there. It was just in a suppressed state. The disease had just moved from a more superficial organ to more deeper organs. And when a right dose was given, it has come from a more deeper organ to the original state where it started. But as has been said, by this local symptom that silences the internal disease, so far from anything being gained by the vital force towards diminishing or curing the whole malady, the internal disease, on the contrary, continues in spite of it, gradually to increase, and nature is constrained to enlarge and aggravate the local symptom always more and more. So the same thing which we were talking about, that a local symptom, it keeps on getting enlarged and aggravated. It started from the elbow, went to the whole arm, then to the chest, then to the other arm, to the back, because the nature is trying to constrain the disease from going inside. So what it is doing is that increasing the symptoms more on the outer part, because the internal disease is also increasing. It is not curing, it is not diminishing. Although the vital force has established a defense, a buffer, that this disease should not come inside, but on the outer also it is increasing. It is becoming enlarged and aggravated, the local symptom always more and more, in order that it may still suffice as a substitute for the increased internal disease and may still keep it under. So it becomes a defense of the body, it becomes a defense of the vital force to keep the disease outside, although the whole body starts getting covered by that eczema, by that ulcers, or by any kind of local symptom which is being produced, but it does not let it come to the inside. That is a way how the body, how the vital force, it keeps a check that the internal organs or the inside of the body is protected. So old ulcers on the legs get worse as long as the internal sura is uncured. So here we have to understand that what is to be cured now in this case, in such cases, whether the local symptom is just a local symptom, the diseases, this eczema, this psoriasis, or any other kind of diseases which are persistent and from a long time, are they just local and can they be cured locally, or there is something else to it? So as a physician, we have to understand that it is the internal disease which is uncured and increasing. So as long as that is not cured, the outer symptoms of it are never going to go. And even if they go, they may go into more dangerous states. They can affect more vital organs then. The chancre enlarges as long as the internal syphilis remains uncured, just as general internal disease continues to increase as time goes on. So as the time goes on, the internal disease, it continues to increase, the local symptom, they will keep on increasing. So footnote to aphorism 201, the issues of the old school practitioners do something similar. As artificial ulcers on external parts, they silence some internal chronic disease. So in old school practitioners, the way the practice was at that time of Dr. Henneman, the physicians, the doctors, they used to produce some kind of artificial ulcers to let the blood out. So for that time when they used to produce that thing, some internal irritation will be worn out. So the patient will feel the relief in some kind of internal irritation, internal sensitivities, whichever they had at that time. So at that time it was thought as a treatment for such kind of diseases, but it was not a treatment. Artificially, a disease was produced on the external part, on the local part. So the body had to respond by decreasing the internal disease and focusing on the external one. But because it was not a natural thing, it was not a natural way of the vital force. So what will happen is that they will silence some internal chronic disease, but only for a very short time, without being able to cure them. They could not cure it. So it was just again a suppression of the internal disease in a vice versa way. But on the other hand, they weaken and destroy the general health by doing this, because whenever you are trying to uh, suppress something, go out of the way, go out of the natural way, what we will do is that we will weaken the patient more and more. So by that bloodletting, by making that artificial ulcer, the patient would become more weak, and it will destroy the general health much more than is done by the most of the metastasis affected by the instinctive vital force. So that will basically destroy the health or weaken the patient in a more faster way than the vital force could have done. So if the old school physician should now destroy the local symptom by the topical application of external remedies, under the belief that he thereby cures the whole disease, nature makes up for its loss by rousing the internal malady and the other symptom that previously existed in a latent state side by side with the local affection. Now, if the physician, he somehow destroys this local symptom, he is somehow able to do this thing with some kind of external remedies, with some kind of ointments, with some kind of something which is put on the local symptom from the external way. What happens is that this is a loss to the nature. Dr. Hahnemann uses that nature makes up for its loss. That it is a loss to the nature. Why it is a loss? Although the vital force or the nature cannot fight against the disease on its own, but still it has provided a very good defense so that it remains to one single part. So when we are trying to basically uh, break through that barrier, vital force has formed a barrier that okay, there is a disease but it will remain in the external part. I will not let it I will not allow it to come inside to the internal this thing. But when we are helping the disease by applying something local, by applying some external remedy to break that barrier, so it is a loss for the nature, it is a loss for the vital force, because otherwise the disease might not have been able to break that barrier, but the physician helped to break that barrier. And what has nature has to do is it has to make up for that loss. How it makes up for that loss is by rousing the internal mind. It has to increase the disease inside. That is the only way. Then it has to put it in some other organ, because now it has come inside. So as aphorism 74 tells us that nature of the vital force is always trying to maintain the life, so it will put into some organ, one of the organs, and try to keep it there until we do something else, until the uh, treatment again is given in a wrong way. So it will basically start increasing the symptoms which were latent, and now side by side with the local affection it will start increasing that also. The local affection will also remain and some symptom will start increasing. That is to say, she increases the internal disease, so the internal disease will start increasing. So the more we apply for this external symptoms, the more we apply some external remedies, the more the local affection will become better and the internal disease will become increased. So when this occurs, it is usual to say, though incorrectly, that the local affection has been driven back into the system. This is suppression. The word uses driven back into the system. So the local affection has been driven back into the system. So the body had put it outside. Now with the local or the external remedies, we have driven it back into the system or upon the nerves by the external remedies. So this is the aphorism which basically tells us these are the about the suppression from the layer of the skin and how it affects our internal disease or the internal body. So aphorism 203, every external treatment of such local symptoms. That is why we give a very, like when we are seeing the patients, we always tell them that be very careful. If something comes upon the skin after the treatment, don't apply anything on it. Don't apply anything which can basically drive it again back inside. And we have seen in many patients who have used something topical local on the skin and their older symptom they came back, the symptoms which are getting better. Even we have this one case in Thailand, the a male patient who has this problem with the hearing. His hearing started becoming better, and he applied something on the skin. I think I don't know, he had something, maybe he applied some balm or some this local painkillers or something he applied, and his hearing started diminishing again. So that also shows us a direct link between the skin and the nerves. And that is what is told by Dr. Hahnemann also here, you know that driven back into the system or upon the nerves by the external remedies. There's a direct relation, and you can see that in patient that when this kind of problems they start getting better, something will come upon the topical part, upon the external part. And if that is again, we do something again bad to it, we suppress it, it will go again to the internal part, or the symptoms will start increasing again. So it is very important to tell the patients beforehand that if you have anything, don't do anything about it. You can talk to us, you can come, you can show, but don't do anything about it. That is why, because many times that when we are seeing the patients, some doctors they are that why you give so much importance to this, and the local some symptoms if they come up. Why in every follow up you ask about them, that did you had any kind of some symptoms on the skin or not? This is why. This is the whole reason. So every external treatment of such local symptoms, the object of which is to remove them from the surface of the body, whilst the internal miasmatic disease is left uncured. So any kind of external treatment, any kind of treatment, whether it is done by some kind of homeopathic remedy or so-called homeopathic medicines, because nowadays many the stores or the pharmaceutical companies they are selling some arnica, some chamomilla to apply on the body, many kind of skin routines. I have seen recently that in many kind of skin routines, they have started using the this mother tinctures of homeopathy medicines to create some kind of creams. So any kind of that is why Dr. Hahnemann has said that every external treatment, any kind of, if you are using calendula, if you are using anything for external treatment of such local symptoms, if we are doing something, the object of which is to remove them from the surface of body, and the objective of such a treatment is to remove that local symptom, whilst the internal miasmatic disease is left uncured, and there is no focus on the internal miasmatic disease, and it is left uncured, incurred, because no internal anti-miasmatic medicine or any homeopathic medicine has been given to that patient, as for instance driving of the skin, the psoriatic eruption by all sorts of ointments, burning away the chancre by caustics, and destroying the condylomata on their seat by the knife, the ligature or the actual cautery. This pernicious external mode of treatment, hitherto so universally practiced, has been the most prolific source of all innumerable named or unnamed chronic maladies under which mankind groans. So Dr. Hahnemann is saying that all those diseases which have been named or even not unnamed, we don't even know about those diseases which are happening, we have not named them, under which the whole mankind is suffering. The reason, the source for that is because we have been curing the diseases from the external part, the psoriatic eruption by some kind of ointments, or some chancre by burning it by the caustics, or we are destroying the condylomata or the warts or by the knife or the cautery or the ligature. And this has become, this kind of dangerous mode of treatment has become the source for all the diseases which are developing inside the body, all the chronic diseases. It is one of the most criminal procedures the medical world can be guilty of, and yet it has hitherto been the one generally adopted. Dr. Hahnemann is saying that it is happening in front of us, that when we are doing such treatment, the internal symptoms they start developing. We can see that the symptoms they have become more profound after such kind of treatments. But still, it is a generally adopted treatment. Still, it is the thing which is done and taught from the professional chairs as the only one. And from the professional chairs, it is taught that this is the only way. This is the only treatment. So Dr. Hahnemann calls it the most criminal procedure. Why criminal? Because we are pushing someone towards a more hastened death. Death is going to come. One is the person will die naturally, maybe in a healthy stage, maybe in a less diseased state. Okay? But when we are hastening the process, we are uh, making the process more rapid by some kind of procedures, then definitely it should be called criminal. So he's saying that this is most of the criminal, one of the most criminal procedures the medical world can be guilty of. So the whole medical world has to come up, see what is happening in front of our eyes. Okay, you know, maybe, although it is not, but maybe the aphorism is wrong. But we can see what is happening in front of our eyes. And when we see more faithfully in the truth what is happening, all these aphorisms will come true. They will, you will see that every word which is written here is a very truthful thing, and this is happening. It happens in this way. So footnote to aphorism 203. For any medicine that might at the same time be given internally, served, but to aggravate the malady, as these remedies possessed no specific kind of curing the whole disease. So now many medicines are given internally, but they will aggravate the remedy if they do not have the power to cure the whole disease. If they are not given in a homeopathic way, because many times, when some of the physicians they started observing this thing, they started giving the same medicine internally. Sulfur applied externally, okay, no, we will give sulfur internally. But if it is not homeopathic, then it will again aggravate the disease. If it is not given in a homeopathic way, because as these remedies possessed no specific power of curing the whole disease, but assailed the organism, weakened it, and inflicted on it, in addition, other chronic medicinal diseases. For example, a patient is suffering from fungal infection on the skin, and some antifungals are given inside. They cannot uh, cure the whole malady. So that will all again aggravate the disease. Because we have to understand, we have to cure that internal disease which is going on in the whole body, not on some local part, not on some toenails, not on some foot, not on the hand, because hand is not the man. And the medicine should be given for the man, not for the hand, not for some local part, not for the skin. So aphorism 204. If we deduct all the chronic affections, ailments, and diseases that depend on a persistent, unhealthy mode of living. So Dr. Haniman says if we just deduct, if we remove, if we just keep them aside, all those chronic affections, which basically depend from the unhealthy mode of living, the way we are living. It is more given in the aphorism 77. We can refer to that thing also. So all those diseases which are dependent on the unhealthy mode of living, as also those innumerable medicinal maladies, and all the diseases which are basically produced by the medicines. Aphorism 74. Okay, the medical dyscrasia, if we just keep that aside, and all the diseases which are basically produced by the unhealthy mode of living, caused by the irrational, persistent, harassing, and pernicious treatment of diseases, often only of trivial character, by a physician of the old school. So, all those, if diseases are kept aside, the medicinal diseases and the diseases which are dependent on the unhealthy mode of living, all the remainder, whatever the remainder is there, without exception, result from the development of these three chronic miasms. So all the diseases which are remaining, they all develop from these three chronic miasms. The internal syphilis, internal psychosis, but chiefly and in infinitely greater proportion, internal sora. Each of which was already in possession of the whole organism and had penetrated it in all directions before the appearance of the primary vicarious local symptom of each of them. So when the primary symptom comes, the symptom on the local part comes, on the skin comes, before that these miasms have already be possessed the whole organism. They have already seeped in, they have already penetrated in all the directions, and long after that penetration, long after that possession, the primary local symptom comes. Now, how we can understand whether they have penetrated, that is a very long discussion. I will not go into that. I have already taken this one class on the sora and the miasms. So I don't know if we have put it on online or not. I will talk with Dr. Rishabh. And I have also spoken about sora in Thailand and Brazil also in the different workshops. So that is also a very detailed thing. So maybe if we can go about it on some other day, but we have to understand that this local symptom has come long after that seeping, long after that penetration. And in the case of Sora, the scabious eruption, in syphilis, the chancre or the bubo, and in psychosis, the condylomata. So these are the three basic local eruptions which come in these three basic miasms. There can be different kinds to that also again, but these are the three basic eruptions which come that prevented their outburst. So this local symptom basically prevented their outburst. Although it has seeped in, although it has possessed the whole organism and penetrated in all directions, but this local symptom has basically prevented the outburst. And these chronic miasmatic diseases, if deprived of their local symptom, are inevitably destined by mighty nature sooner or later to become developed. And if this local symptom is taken away, it is maltreated, it is suppressed, then that it is inevitable that we can stop the development of the miasms and to burst forth and thereby propagate all the nameless misery, the incredible number of chronic diseases which have plagued mankind for hundreds and thousands of years. So this is not something new. This is not something new which has happened to the humankind for the first time. Aphorism 81, we can go there and we can again read it. Aphorism 81, that it has passed on from generation to generations, from thousands of years, none of which would so frequently have come into existence had physicians striven in a rational manner to cure radically and to extinguish in organism these three miasms. So Dr. Hahnemann is also saying that if physicians have striven in a rational manner, if they have uh, this understood the relation between this local symptom and the whole disease, the miasmatic disease, then the organism, or from thousands of years, the humanity would not have striven, would not have, been succumbed to these kind of diseases. And if they would have worked to extinguish in organism these three miasms by internal homeopathic medicine suited for each of them, without employing topical remedies for their external symptoms. So he's saying that we would not have seen such kind of development of these miasms if some homeopathic medicine suited for them was given internally and the external symptoms were not destroyed by some topical remedies. So we would not have we would not have seen this kind of development of diseases which we are seeing today. Aphorism 205, the homeopathic physician. So for a homeopathic physician, now this is a pointer that the homeopathic physician never treats one of these primary symptoms of chronic miasms. So we, like I told you, that homeopathic physician does not cure the skin. He does not cure the ulcer. He does not cure the scabies or the condylomata. His focus should not be there, because I have spoken already about this thing, that the way you are going to cure the patient or treat the patient, it depends completely on your focus. What are you have we have to ask ourselves, what I am going to cure in this patient. This is a practice which we have to come up with, that okay, this is the whole case history. After taking the case history, now whether I will focus on his diabetes or hypertension or his ulcers or his psoriasis, or should I focus on him in my follow-up, should I ask about him or should I ask about the primary symptoms or the secondary symptoms of the miasm. So in 205, Dr. Hahnemann very clearly says the homeopathic physician never treats one of these primary symptoms of chronic miasms, nor yet one of their secondary affections that result from their further development. So after the local disease is suppressed or maltreated, the symptoms which develop afterward, they are called as the secondary symptoms, secondary affections. The primary symptoms are the local disease. So we are not even curing the local disease, the primary symptom or the secondary symptoms. That should be our approach. The whole organon is to set the approach of the physician. That is why the physicians they become successful if they can go with the approach, and that is why the physicians they basically somewhere do not get the desired results because the approach has not been set. So we have to set our approach, we have to set our focus that as a homeopathic physician, what I should do. So I will not go after those primary symptoms. I am not going to treat the secondary symptoms by local remedies, neither by those external agents that act dynamically, nor yet by those that act mechanically. So I am not going to use any local agents, any external agents, any mechanical agents, but he cures in cases where the one or the other appears, where the primary or secondary symptoms they appear. He cures only the great miasm on which they depend, whereupon its primary and also the secondary symptoms disappear spontaneously. So his focus is to cure that miasm, cure the whole process which is going on inside the body, because he knows that the primary and the secondary symptoms basically depend on this great miasm. So my focus is to cure that miasm. Once that miasm is cured, once it is gone, everything which is dependent on it will be gone. But as this was not the mode pursued by the old school practitioners who preceded him in the treatment of the case, the homeopathic physician generally alas finds that the primary symptoms have already been destroyed by them by the means of external remedies. So this happens with the homeopaths most of the time, that the patient they come in more advanced stages of the chronic diseases. They are not coming when it started at that local symptom part. And many they have forgotten about it also. Many patients they have forgotten about, if someone used to have some boils or eruptions as a child, they have all completely forgotten until and unless they reappear. Then it strikes to them, like the patient I told you, that when the acne they came back, then it struck her. Otherwise in the history in her past diseases she has not mentioned it. Then it struck her that okay, this kind of same kind of symptoms I used to have. So for a homeopathic physician, that is why Dr. Hahnemann has written the word alas, that you know unfortunately what happens is that those primary symptoms have been already been destroyed by means of external remedies, and that he has now to do more with the secondary ones, that is the affections resulting from the breaking forth and development of these inherent miasms, but especially with the chronic diseases evolved from internal sora. So all these symptoms which are developed after that suppression, after the destruction of the local symptom, the destruction of the primary symptoms, and we have to deal with that. The internal treatment of which, as far as a single physician can elucidate it by many years of reflection, observation, and experience, I have endeavored to point out in my work on chronic diseases, to which I must refer the reader. So how we have to go through with it? He's saying that I have written in the chronic diseases, I have put many years to it, how to understand, how to, work with that thing, with those secondary or tertiary symptoms of the development of these miasms. So footnote to aphorism 2054, I cannot therefore advise for the same reason which have been going on, that he's saying that I cannot therefore advise. I will never advise, and I cannot advise, for instance, the local extirpation of the so-called cancer of the lips and face by means of the arsenical remedy of Frere Cosme. He's saying that I will never advise that even if there is cancer on the lips or the face, that it should be extirpated, removed locally by some remedy which might be commonly given at that time, that Frere Cosme. Not only because it is excessively painful, it is very painful and often fails, but more for this reason, because if this dynamic remedy should indeed succeed in freeing the affected part of the body from the malignant ulcer locally, the basic malady is thereby not diminished in the slightest. The preserving vital force is therefore necessitated to transfer the field of operation of the great internal melody to some more important part. So he says that even in the case of some kind of cancer which is external on the squamous epithelium, some lips of the face or the face, he said that I will not advise to remove that thing with some kind of remedy, with some kind of mechanical means. He said, now, although that is painful and it often fails also, we have seen many cases of the squamous cell epitheliomas which have failed after the removal. I have seen many with that problem when it was on the tongue or on the face, that they have failed. Um, at least the cases which I have seen, uh, it always metastasized, it always increased. So he's saying that the reason for that is that why I will not advise is for the same reason. Because once, although it is very dangerous thing, although it is a more ulcerative thing, but even if you will remove the vital force as is basically the vital force is a programmed thing. So according to its program, whenever this will be removed, it has to basically transfer the field of operation internally, as it does in every case of metaschematism. There is a very big schematic, very big programming to it, and because of that schematism, it will basically move the disease inside, and the consequences: blindness, deafness, insanity, suffocative asthma, dropsy, apoplexy, etc. So the diseases will come more dangerously in a more violent manner. But this ambiguous local liberation of the part from the malignant ulcer, that is why many times when some patients they come to me for advice, when they have accidentally found some kind of tumor, some kind of this thing, although even if they don't want to take the homeopathic remedy, my advice, if there are no violent symptoms or this thing, some kind of this thing, the advice is to just wait, because you have found it accidentally. So you didn't had any more important symptoms or any symptom which showed this thing, some kind of fibroids or fibroadenomas which were found, because once you remove it, although in an anticipatory manner, it will start going somewhere. That is a programmed thing in the body. We have to understand the programming of the body. It is the biology. It is programmed in our genes, the way the vital force has to work. So in those cases where the ulcer has not yet attained any great size, and when the vital force is still very energetic, but it is just in such a state of things that the complete internal cure of the whole original disease is also still practicable. So saying that with the homeopathic medicines, even in such cases, the internal cure is still practicable. We must proceed with that thing. The result is same when the cancer of the face or breast is removed by the knife alone, and when cystic tumors are enucleated. When some kind of tumors they are removed, or some cancer of the breast or face is removed, the same result will come. Something worse ensues, or at any rate death is hastened. The problem is, it is not that I have, like recently I had a case of cancer with, there was metastasis of the cancer. So because they have been taking medicine from the family, other members of the family, they were taking medicine from me for a long time, and they have get better in many kind of diseases, from many kind of diseases. So they had this faith in me. So when they came for the advice, I told them according to this thing, because we have seen practically, I have seen in some of my relatives also this thing happening. In many cases, when you suddenly find out about the cancer and some kind of treatment is given, the patient becomes weak very rapidly. I have seen patients who went to the hospital walking on their legs, but they never came back. They became so weak. So here also Dr. Hahnemann is saying that even that rate of death, it becomes hastened. If a patient with metastasis had only 6 months, with the treatment he sometimes only lives for 20 days, 30 days at the max, which he could have lived for 6 months. Like I told you, death is something which is inevitably going to come. When a person was born, on the same day, it was very much, written that he's going to die someday. So death is inevitable. We cannot make anyone immortal with medications. Yes, but what we can do is we can basically decrease the speed of death, decrease the speed at which a patient is going toward. We can give a more quality to the life. We can make sure that the patient does not suffer much in such cases, does not suffer much from the pains, from some kind of, that he does not become dependent upon others. We can do such things. And I have seen many patients, especially in the metastasis of cancer, like the same case which I was telling you about, that the family, the recently he died. He was diagnosed around 1.5 year back with the CA of spine, and which was metastasized to lungs also, and to the abdominal part, the peritoneal cavity. So the attendants, the son of the patient was also 76, 77 years old. So the son, he told me that, doctor, I have seen many patients of cancer in our relatives, and I was very afraid when I got to know that my father is suffering from the cancer. I was very afraid that he will suffer a lot, because I have seen patients suffering. The pains, the kind of weakness, and the loss of appetite, and how the body is growing thin, and all those things I have seen happening to them. But he said that they didn't went for, they were taking the homeopathic medicine, and he said that the most, the satisfactory thing for me was that my father didn't suffer. He was talking with us till the final day, and when his time came, he said, okay, I just want to say goodbye to everyone, because now my time has come. He said that I have seen many of my relatives who have been in ventilator from 1 year, sorry, 1 month, 15 days. No one can go in, no one. So he was with us. He died in front of us, and we were satisfied that he didn't had any pain. He didn't even did, like in his word, he didn't even did this thing. So like, uh, you know, we can help with homeopathy in such cases also. See, like Dr. Hahnemann has told us, even Dr. Kent in his 12 observation, he has described about the incurable cases. Although when we approach any patient, like even such a case, when we approach, the approach is that this is a curable case. The approach, the mindset is like that. Whether it will get cured or not cured, it depends upon lot of other things, and we will leave it to that thing. We will not try to go with that thing. Yes, our approach is that we want to cure this patient, but still, if the case is some kind of an incurable case, we can still help, with decreasing that rate, the speed at which the death will go on, and giving them relief in many other symptoms. So what we have to understand from this aphorism, footnote to aphorism 205 is, and he specifically saying, he had taken the example of cancer, because it is seen in such cases, because the disease has become very violent at that time. There's a violence to the disease, and we know that it is a worst thing which has happened at that time. So what should we do? So this has been the case time without number, but the old school still goes blindly on in the same way in every new case with the same disastrous results. So we have to understand that removal of local symptoms, the symptoms which are on the local part, either it is some small eruption or a boil or some wart or some ulcer or some kind of cancer, it will always result in something which will be more dangerous than what it is. So as a physician, as a homeopathic physician, physician in general, homeopathic physician in particular, we have to keep in mind that these local infections which are coming, we have to educate the patients about it. We have to understand this thing, and then educate the patient also about this thing, that whatever will happen after the removal of this, if it is removed externally, by external means, by some kind of operations, by some kind of medicines, it will result in more bad thing. The reason is this, which is given in these aphorisms, and what we see in our clinics, in our cases, in our patient. We all have seen this thing. Whoever have seen such cases carefully would have noticed this thing without any doubt that this has happened. So with that, we will stop today's class here. There is something in the chat. Yep. Okay. Yeah, he applied some local, that patient in Thailand, he applied some local balm for knee pain, which I was telling you that he was. So Dr. Jonkol, she shared this message. So we have to understand this thing. So I will urge you again. I although already requested on the group to go through the last videos. Again, I will urge that go through these videos on the local symptoms, so that it can get inside us. This thing can get inside us in our approach, that how we have to approach this thing. Many patients, they have local diseases from long time, and they want an immediate relief. We can relieve them, we can get them better, but there we have to make them understand also that sometimes it might take time. So we have to approach these cases in the same manner, that we have to understand that we have to remove the internal miasm. We have to look for the characteristics of the whole case. If the symptoms are there, look for them, some characteristics in those local symptoms, if they are unchanged from a long time of treatment. Okay, and with this approach we can give the patients a chance to get cured completely, because the local application is never going to cure the patient. It is more it will, the disease is more going to go more deeper and deeper with that kind of treatment. And we should not, at least after this info, we should not do it. We should not do it. We should not tell anyone to do it. That if, okay, if you are not getting you know relief, then go use some ointment. No, that is a very like Dr. Hahnemann has told, that it is the most common criminal thing which the medical world has done. So we should not add into that. So with that, I will take your leave. Thank you. Thank you very much, and a good night. A very good evening to all of you. So today again, we will continue from where we left last time, the part of the organon. We have done till aphorism 190, and we will continue from there on. So we were talking about the one-sided diseases, and in this particular part of the organon, we are talking about the one-sided diseases which are local diseases, means which have symptoms on the skin. So we have done till aphorism 190, and we will start with aphorism 191. This is confirmed in the most unambiguous manner by experience, which shows in all cases that every powerful internal medicine immediately after its injection causes important changes in the general health of such a patient. So the experience, it tells us in that any internal medicine, when it is taken, when it is powerful enough, it always causes some important changes in the general health of a patient. and particularly in the affected external parts and also in the affected external parts. So like we were talking last time, that it was, in our mind, in doctors' minds also, the skin was something which was external. It was not something which was related to the internal part, and it was always sought out that whenever the skin has to be treated, it should be treated with some topical ointment, something which should be applied externally. So in these aphorisms, Dr. Hahnemann is telling that, even the external part, although the skin is the external part, but it is still the part of the same body and under the influence of the same vital force. So even those changes which are coming on the external part of the body, which are not coming from some kind of injuries from the outside, but which are coming from the internally, this disease, so they should always be cured or treated with the medicines which can act internally. So and particularly in the affected external parts which the ordinary medical school regards as quite isolated. Even today, we regard the skin as an isolated organ of the body, and we treat it in the same way, and that is the biggest mistake in treating the skin diseases, that we have never thought of that from where the disease is quite coming. Even in a so-called local disease of the most external parts of the body, and the change it produces is most salutary, being the restoration to the health of the entire body along with the disappearance of the external affection. So when a medicine is given which is homeopathic in nature and it is given internally, along with the curing or along with the improvement of the rest of the disease, it will also help in the disappearance of this external affection, because it is coming from the internal malady which is already going on inside the body without the aid of any external remedy, provided the internal remedy directed towards the whole state was suitable, chosen in a homeopathic sense. So when it is chosen homeopathically, when it is a similar medicine, it is a similar medicine, along with the curing of the internal state, it will also cure the external affection which it has produced. So this is best affected when in the investigation of the case of disease along with the exact character of the local affection. So the first point when analyzing the case is understanding the exact character of the local affection. What kind or what is the character? The kind or character does not mean the pathologically, like the name of the, whether it is a psoriasis or a dermatitis or some erysipelas or some herpes. No, not the name, but what is the characteristics of that? And in this, I will add that the aggravating and ameliorating factors, the modalities, they play a big role in characterizing the local affections. What are the things which are aggravating the symptoms or ameliorating the particular symptoms of the skin? They play a big role in deciding the remedy which helps in the curing of these affections. So in this character, we have to see what kind of, what is the shape, what is the color of the eruption. We have to see whether it is an ulcer, what kind of ulcer it is, what kind of the edges are, any kind of secretions, very characteristic secretions. Okay. The itching, if there is, then exactly the character of the itching, when it starts, any kind of time modalities, any kind of any other things which basically start or basically aggravate the itching part. So all these things will characterize the local affection. So along with the exact character of the local affection, all the changes, sufferings and symptoms observable in the patient's health. So, but the remedy should not only be dependent upon those characters, but also the other sufferings or the symptoms which are observable in the patient's health. For example, if there is general disturbance in some kind of sleep, if there is some disturbance in the appetite part, if there is some disturbance in the thirst part or the thermal part, or some general disturbances which the patient is feeling and which may have been previously noticed when no medicine had been used, and these symptoms, they were also present even before this local affection. They might be in the form of some kind of accessory symptom. They were there always, but not very pronounced. So the patient didn't care about those symptoms. The patient didn't sorted any medicine for those symptoms, but they were there, are taken in conjunction to form a complete picture of the disease. So all these things we have to understand, we have to note down, and then we make a complete picture of the disease before searching among the medicines whose peculiar pathogenetic effects are known for a remedy corresponding to the totality of the symptoms, so that the selection may be truly homeopathic. So this is how we select a homeopathic remedy in these kind of cases. The first is the character of the local affection. We have to characterize it. We have already done this, I think in Thailand also, in India also, and in Brazil also. I have taken this lecture of how to characterize the symptoms, the characterizing of the symptoms. So once we have characterized the symptoms and we have taken other sufferings or the symptoms which are observable in the patient's health, we can make a complete picture of the disease, and we have to find a remedy which basically corresponds this totality of the symptoms. So by means of this medicine employed only internally, so it has to be employed only internally, and if the disease be but of recent origin, often by the very first dose of it, the general morbid state of the body is removed along with the local affection. So when you give the medicine in this way, when you select the medicine in this way, and you give it internally, so the internal affection will be gone along with the local affection which was produced as a result of that internal morbid state, internal disease state. And the latter is cured at the same time as the former, and the both things will be cured at the same time, proving that the local affection depended solely on a disease of the rest of the body. So that is also kind of evidence which we see that this whole disease, the external disease which was uh, in appearance external to us, but it was actually depending on the disease which was going inside, proving that the local affection depended solely on a disease of the rest of the body and should only be regarded as an inseparable part of the whole, as one of the most considerable and striking symptoms of the whole disease. So it was in these kind of cases, they are the striking symptoms of the whole disease. So they should never be ignored when they're even, for example, if patient is suffering from some kind of symptoms and they have some skin diseases which are coming again and again, for example some boils which are coming again and again, the characteristic of those boils or of those eruptions should be given importance, because they are showing you something about the internal disease which is going on. They are a part of that disease, so they should never be ignored. Their characteristics should never be ignored. Their modalities, their aggravating factors, they should never be ignored. It is not useful either in acute local diseases of recent origin or in local affections that have already been a long time to rub in or apply externally to the spot an external remedy, even though it be the specific, and when used internally, salutary by the reason of its homeopathicity, even although it should be at the same time administered internally. So Dr. Henneman is saying that this is not advisable and not useful also, that when there is some either an acute local disease or a chronic one which is going from a long time, to apply any external remedy although you find it homeopathic. For example, you have chosen sulfur as a homeopathic remedy. So while giving internally and you start applying it externally, it is not advisable and it is not reasonable also. Why? He is going to tell us about that thing. Because this have been even nowadays many homeopaths, they suggest that it is better to apply the remedy, the homeopathic remedy, and there have been some ointments in the name of homeopathy which have been made and used to apply on the lesions, but that is not advisable. And why it is not advisable, here is the reason for that. For the acute topical affections, for example inflammations of individual parts, erysipelas, etc., which have not been caused by external injury of proportionate violence, but by dynamic or internal causes yield mostly surely to internal remedies homeopathical. So he's saying that acute some local diseases coming, some acute rashes are coming or erysipelas are coming. So once you give an internal remedy, they yield very easily when the medicine is homeopathic, when the medicine is similar, adapted to the perceptible state of the health present in the exterior and interior, selected from the general store of proved medicines and generally without any other aid. So you don't need any other aid, not to apply anything, not to give anything. Some disease of acute character, you give a correct remedy, a homeopathic remedy, and it just goes away very easily. But if these diseases do not yield to them completely, and if there still remains in the affected spot and in the whole state, notwithstanding good regimen, a relic of disease which the vital force is not competent to restore to the normal state, then the acute disease was, as not frequently happens, the product of sora, which had hitherto remained latent in the interior, but has now burst forth and is on the point of developing into a palpable chronic disease. So he is telling about the regarding the acute local disease, that if a local acute local disease, when you give the medicine and it does not yield immediately, then it is due to the product of the sora. Okay, there has been some sora, internal latent sora, which has been going on, and it might basically develop into a kind of chronic disease in the coming time. So it is an indication when some acute local disease is not going away easily, that it is basically a product of the sora, and a soric remedy, an anti-soric remedy should be selected, a constitutional simillimum should be selected and given accordingly. So in order to effect a radical cure in such cases, okay, in the chronic cases, in order to effect a radical cure, which are by no means rare after the acute state has pretty well subsided, an appropriate anti-soric treatment, as is taught in my work on chronic diseases, must be then directed against the symptoms that still remain and the morbid state of health to which the patient was previously subject. So he's saying that after this acute stage has gone, after those acute eruptions have gone, an antisoric treatment should be given, and it is everywhere. Dr. Hahnemann will basically advise us to do that, even in the coming cases where the mental diseases which are coming acutely. There also he will say, or other acutes which have happened because of the sporadic diseases or the intermittent fevers. He will always advise that after that acute stage has gone, give an anti-soric remedy, because this acute stage was product of the latent sora. So don't just let it be at that time. In chronic local maladies that are not obviously venereal, the anti-soric internal treatment is moreover alone requisite. So when the local maladies or the local diseases or the skin diseases, they are of not venereal character, of the they are not coming from the gonorrhea or the chancre, then the only antisoric treatment or only a constitutional remedy is what is needed. So it might indeed seem as though the cure of the such diseases would be hastened by employing the medicine substance, which is known to be truly homeopathic, to the totality of the symptoms, not only internally but also externally, because the action of a medicine applied to the seat of the local affection might affect a more rapid change in it. When I was in college, so because my father was a homeopath, so I had listened to his lectures, and but I was very new to everything, which was happening around. So one day, one of our teachers, sorry, so one day one of our teachers, he was talking about the medicine, some of his cases, that how he has applied some remedy on the skin part and it has gone better. I knew that this was a wrong thing. I asked that the teacher whether it is the right thing to do or not. He said that you can see that practically it is a very good thing. And he showed me the aphorism 196. This aphorism, he told us to read it. And we read it, and I was shocked because, in my understanding, it was, that this should not be done, because I have heard my father and saying that, you should not apply it locally. But when I read this, that it might indeed seem as though the cure of such diseases would be hastened So he said that, like Dr. Hahnemann is saying that the cure is hastened when you apply the remedy outside and when you give the same remedy internally. So when you read at this aphorism, it seems, that it comes to the mind, okay, that Dr. Hahnemann is basically advocating the use of a remedy which is homeopathic, that it should be used internally and externally also, so that the cure can be hastened. It can be, the rapid change can be become. But the main part here is this word, seem. If you don't give importance to this word, the whole meaning will change. It might indeed seem. It might seem to us, it might, in our imagination, this thought would come that when you give a true homeopathic remedy, which is completely similar to all the symptoms, when you give it internally and you give it externally, then it will cure it in a more rapid way. And in some cases, it does also. Okay, it does also, but I will go to that point, that why, what is, that what happens. So when I read about it, when I talked about it, so my father said that, okay, you have read the 196, now go read 197 and never do this mistake again. So in 197, this treatment, however, is quite inadmissible. This should not be done because it seems to you, but the experience tells quite the otherwise. This treatment, however, is quite inadmissible not only for the local symptom arising from the miasm of Sora, but also and especially for those originating in the miasm of syphilis or psychosis, for the simultaneous local application along with the internal employment of the remedy in diseases whose chief symptom is a constant local affection, has this great disadvantage that by such a topical application, this chief symptom, local affection, will usually be annihilated sooner than the internal disease. So, why it is not advisable, either in any kind of miasm, whether it is of syphilis, sora, or psychosis, any symptoms, local symptoms, which are coming up, and you have given the internal medicines, but then this thought comes to the mind that why not apply this externally also? Because in such cases there is a great disadvantage. The disadvantage is that this external um, symptom, the local affection, what happens is it gets annihilated, it gets diminished sooner than the internal disease. So when the local affection is getting better and the internal affection is getting better, what should be done is, as we have read in the aphorism 190, that both will be cured at the same time. The morbid state of the body is removed along with the local affection, and the latter is cured at the same time as the former. The local affection is cured at the same time when the morbid state is cured. Internal morbid state is cured. So, what is happening here is that the external affection is basically getting better sooner than the internal disease, and we shall now be deceived by the semblance of a perfect cure. We will be deceived by this semblance, by this outward appearance of a perfect cure. The perfect cure no has not happened because the internal disease has gone gain to the latent sura stage, and it might come out in the some other form because it has not got cured, or at least it will be difficult and in some cases impossible to determine from the premature disappearance of the local symptom if the general disease is destroyed by the simultaneous employment of the internal medicine. And we will not be sure, and it cannot be determined whether the internal malady has disappeared or not. And the most of the times it has gone to the latent sora stage again. Whenever you will apply externally, the symptom is gone, it has gone to the internal sora, it has gone to the latent sora, and it will come up with some other more dangerous symptoms which will be more violent than the skin problem which has just been treated. So that is why it should never be done. It is inadmissible. The mere topical employment of medicines that are powerful for cure when given internally to the local symptoms of chronic miasmatic diseases is for the same reason quite inadmissible. So similarly, applying some other medicines for the mere topical employment, for example, you're giving some medicine internally and applying some allopathic medicine or some other things in the topical part, in the external part, that is also quite inadmissible for the same reason. For if the local affection of the chronic disease be only removed locally and in a one-sided manner, the internal treatment indispensable for the complete restoration of the health remains in dubious obscurity. If the outer symptoms go away, we will never be able to cure the patient or restore the health in him completely. The chief symptom, the local affection, is gone. Because in these cases, these one sided skin diseases, cases of the local diseases, the skin symptom, the local symptom, the symptom of the external part of the body is the chief symptom. And when it is gone, what are we going to prescribe upon? And there remain only the other less distinguishable symptoms, which are less constant and less persistent than the local affection, and frequently not sufficiently peculiar and too slightly characteristic to display after that a picture of the disease in a clear peculiar outline. So we are left with very less persistent and less peculiar symptoms on which we cannot base our medicines, and then we have to wait for the symptoms to come up again in some other form. Until then we have to wait. Our hands are tied, we cannot give any medicine which can cure the patient, which can recover the patient back to the health. Okay. So we will do till 198, or we will start from 199 in the next lecture. So these two things which we have to understand is that the first, the thing is, we have to understand that this local symptoms are basically coming from the internal malady, from the internal disease, and they are not something which are coming in the isolated parts, or the skin is the isolated part and it can be treated with. That is why the topical applications, or that is why this external applications on the skin diseases, they should be avoided, because once it has gone, and once we are left, because the latent sora is a stage where the disease can go anyway. That is a very dangerous stage. We will talk about latent sora someday, because in the latent sora, when the vital force is not expressing the disease in the form of physical symptoms, it is not that disease is gone or it is not developing. It is developing in the silent organ of the mind. You will see that in that latent sora part, the behaviors, the characteristics of the moods, they will start developing, they will start changing. So that will become more dangerous, because when it will be expressed, then it will be expressed in a more violent way as compared to the primary symptom of the skin. So we have to understand this thing, that this skin symptoms, they are basically a part of the internal dyscrasia, the part of the internal miasm which is already going on, and they should not be applied with any kind of topical medicine, either homeopathic or allopathic or of any other character. Because if this thing gets better and the internal disease is not getting better, then the secondary symptoms of the sora, or the tertiary symptoms of the sora, they will start appearing after uh, some time, and it will take more time to cure the disease, to bring the patient back to health, as it could have been done in the earlier stage. So this is a very important thing to note. And the third part is that never read an aphorism, isolatedly. Because if you read 196 isolatedly, it might appear to us that okay, it is okay. And many doctors have, like I told you, one of my teachers in the college also, he might have read it in that way, and or someone has might have told him also in that way. Because many times when we are listening to some doctors or some teachers, then in our mind we take it for surety. So The thing is your own experience and what you are reading. So what, but when you read it with, in connection with 197, in connection with 195, then the whole meaning change. So we will continue with aphorism 199 in our next meeting. And till then, just go through these aphorisms, try to understand what Dr. Hahnemann is trying to tell us, and how we have to direct our treatment in such cases. And once you start understanding, you can do one thing, that go in this 1 week, just go through the medicines and see the skin symptoms, see what kind of symptoms the skin, on the skin they can be produced, and you will try, and you will start understanding the characteristics, the things which are common, which happens in the skin diseases, and which are uncommon. So those uncommon characteristics, whenever you find them in such cases, they will help you a lot in finding the remedy, in understanding the process which is going on, and in finding the right remedy which is homeopathic to that particular state and to the internal disease which is already going on. And when you give it that way, you will be amazed to see that how the remedy, when given, the disease just vanishes, never to appear again. Okay. So with that, I will take your leave. Thank you, and a very good night to all of you. A very good evening to all of you. So today we are again here for the organon class. So today we have done till aphorism 184. So today we'll start with aphorism 185, and we will go up to 190. Today we'll do 6 aphorisms. Today we will be talking about local diseases, the diseases which are related to the skin. So what are the diseases which we call as local diseases? How they are one-sided? Because now we are under the subsection of one-sided diseases. So first we have done one-sided diseases, how to see them, how to tackle with them, what is one-sided diseases. Now the sub part of one-sided disease is the local diseases. So among the one-sided diseases, an important place is occupied with the so-called local maladies, by which term is signified those changes and ailments that appear on the was that these parts are alone morbidly affected. Not up to the time of Dr. Hahnemann, but even today also, this idea is still there in the mind, that the outer part, the skin part, is not the connected with the inside. If something is happening on the outer part, on the skin, then skin is basically diseased. The person or the internal part is not diseased. This idea is still there, and that is why we have so many ointments, so many medicated creams which are being given even for day to day things, like for example the acne. There are acne tapes, there are acne creams, corn tapes, very, and they are being sold. The people are using them. Even the people, when some patient with skin disease, it comes to you as a to a homeopath, and when a homeopath starts telling them, that this is something which is coming from inside, you can never cure it by applying anything on the outside. It is related with the inside. Even the patients, they become very surprised that that is it a disease, how is it related to my insides, how is it related to my rest of the body, because that have been feeded to us that when a skin is diseased, is the local part which is affected, and you just do something on it. If there is some dryness, apply some oil. If there is some rash, apply some cream. If there is some burn, apply something on it and it will get better. But the connection between the sora or the miasm or the inside or the vital force, they we never see that. And that is the most biggest of the blunder which a physician can do. Dr. Hahnemann will say the same thing when we go forward. That it is a blunder because this is from where it all starts. Skin is a very important part of human body. uh, we'll just go off the organ. We'll just try to understand the skin. What is skin basically? If you try to go a little deep inside the study of the skin, what is basically skin? Skin is the oldest mental part of our body. If you think about it, when there was a single celled organism, even now, if you take a cell, the nucleus is not the brain or the main part of the body. It has been told to us nucleus just um, keeps a control over the DNA and RNA, but it is not the brain. The membrane is the brain of the cell, the outer membrane. And there have been these experiments where they have done that. In a cell, they took a cell and they took out a nucleus of the cell, and the cell was able to survive for a longer period of time. It was not able to do because of the absence of DNA or RNA. The cell was not able to repair itself, so it died a slow death. But it was not something sudden. It was not something that it was not able to do its functions without the absence of the nucleus. But then in a cell, when they took out the cellular membrane, the cell immediately died. It immediately collapsed. Because the membrane, we have an inner world behind this skin, and then we have an outer world on this part of the skin. The skin is the part which basically joins the both. Even our other senses, the eyes, the ears, our nerves of the hearing, our nerves of the smell, our nerves of the taste, they have all originated from the skin. You can say that those are the super special senses which have arisen out of the skin. So they have the similar function. It basically connects your outer world to your inner world. Now, if we go more deeply, we have talked about skin earlier also, because when we go into the GNM, that German New Medicine part, it gives it that they give it as a separation conflict, which basically starts affecting the skin. But over a period of time, although I have talked about that thing in my workshops or lectures, over a period of time, when I have started understanding it more deeply, it is more deeper than a separation conflict. It is more deeper. If you try to understand, this part is basically forming your reality. Whatever you are feeling, these senses, they are basically forming your realities. Whatever I am feeling, whatever I am watching for, inside me, I don't have any problem. If I close my eyes, if I close my ears, if I uh, just take off my this sense of smell, or I when I'm not connected with the world, I don't have any problems. You just close yourself in a room where nobody can disturb you, where nobody can come, and you just close your eyes and you go more deep inside. After a while, you will, after 10 or 15 minutes of that state, you will start even forgetting yourself, where you are sitting, who you are, and you will be into a different kind of bliss. The people who meditate, they can relate with that thing. And that is what is the meditation, just taking yourself away from this reality which we have formed, which we call as the mind. The whole formation of the mind is because my eyes are open and my skin is exposed and my senses are exposed to this outer world. From there, my mind is being developed. So this first part, the skin part, is the first part of our sensorium, of our reality, of our perceptive brain, of our perceptive mind, whatever perceptions I am keeping. So when you see from this point of view, all the hurts, all the sensitivities, everything is because of this organ. So obviously it should be the first part which will be getting affected. That is why sora, psychosis, syphilis, all the three miasms, when they start from the skin. That is our first defense. That is my first part which is getting affected by the outer world, because in my inner world I don't have any problem. Whatever I am getting the impressions, they are the impressions of the outer world. If I'm getting humiliated, insulted, if I'm getting anxiety, fear, they are all coming from my perceptions. Inside me, I don't have anything. If a child is afraid of dark, he has somewhere picked up that something is there in dark which can hurt him. If a person is afraid of talking in the front of public, or talking in a class, or giving an interview, he has sensed something, he has taken some impression that during an interview or talking, he might get humiliated or something, might be asked which he will not be able to answer. He has picked it from the outside world. So this connection which we have, it is more deeper than the separation conflicts. So if we understand in that way, we can see that this is the first mental organ which we have. This is the first organ which is directly connected with my mind. This is the part from where my learning mind basically develops. All that I have learned, whether right or wrong, it has been because of this part. It is always there. And that is why it is very commonly affected part, the skin part. No one in the world can say that somewhere in their life they have not gotten any kind of skin problems, even for a little time, even for a smaller time. They always had, because without affections on the skin, the chronic disease cannot start appearing. They cannot come. The sora cannot develop, the psychosis cannot develop, the syphilis cannot develop. So whenever we are uh, looking at the patients who are suffering from skin disease from a longer time, we have to see more deeply that how this connection with the world, the internal and external connection, how it is basically getting affected. We'll talk about when I'll give you a few examples also, and we will talk about that thing when we will go into the this how to cure the, because that will start from 190 onwards. Today we are more into understanding of what the local melodies are. I wanted to give this impression about the organ of the skin, this understanding of the skin, that how it is a very primitive organ also, and very important till now. Even now, it is the most important of the organs. Although we have many vital organs on where our uh, life depends, like our lungs, our heart, our liver, kidney. But I think skin is the organ, or our senses are the organs from where we are connected with whatever we are connected with. Without that, we cannot be connected. So till now, the idea prevalent in the schools was that these parts were alone morbidly affected. Now you try to analyze that whether whenever the skin is affected, only skin is affected or the whole should be affected. Now you can get the idea that how without the affection of the whole, the skin can get affected. So now that idea will look more prevalent, more absurd, that how it can happen, because the skin is basically related with the whole, and that the rest of the body did not participate in the disease, a theoretical absurd doctrine which has led to the most disastrous medical treatment. And because of this idea, the treatments were invented which proved to be very disastrous for the human being. Because until and unless we understand this relation with the hole and the skin, and we take it inside, we feel that thing inside, this kind of treatment, then it starts looking that this is a very wrong treatment. If we need to cure the skin, the hole needs to be cured, because without the involvement of the hole, the skin cannot get affected. Aphorism 186. Those so-called local maladies which have been produced a short time previously solely by an external lesion still appear at first sight to deserve the name of a local disease. So some local maladies which have just recently started, it might appear that uh, right, it might appear right to call them local. For example, a mosquito bite, we will say okay, it is a local disease, it will heal on its own. But then the lesion might be very trivial. So in that case, the lesion might be very trivial, it might be a lesion which will heal on itself, and in that case it would be of no great moment, it will be not a very great characteristic when we call it that. For in the case of injuries, but when there are cases of injuries, now that is the second scenario of the local diseases, because when there is some blunt trauma or like insect bite also, or any other kind of injury which is happening from the outside, accruing to the body from without, it is happening from the outside, the injury, if they be at all severe, the whole living organism sympathizes. But in that case also, if the injury is very um, deep, for example, there has been some blunt trauma, so it is not the only skin that is painful, the whole body, the whole organism feels that pain, it sympathizes with that, it feels that pain. There might even occur fever, for example. The fever, now fever is something which the whole body is feeling, it is not only that particular organ or that particular part which is feeling. So the treatment of such disease is relegated to surgery. So if there is some injury where a surgery is needed, for example, there has been some fracture or some breaking of the skin has happened, which is beyond the scope of some medicine, like some stitches are needed or something, where the lips have to be brought, the skin has to be brought close. So those treatments must be done at that time. Okay. So the treatment of such diseases is relegated to surgery, but this is right only in so far. Now, Dr. Hahnemann has given this thing here, okay, that it falls under the surgical part, but there are few conditions where you have to look only for surgery. And he is saying what this is right only in so far as the affected parts require mechanical aid, whereby the external obstacles to the cure, which can only be expected to take place by the agency of vital force, may be removed by mechanical means. So the surgery should also be done as an, so that there is no obstacle to cure, because the actual, if there is something which has happened, for example some fever has happened, for example after that some, so that fever has to be cured by an agency, by a medicine which can act on the vital force. So we have to give a homeopathic medicine for that. But to cure that, if there is something which requires to be done in the form of surgery, that should be done first, and then a homeopathic medicine should be given so that it can take care of the whole. For example, by the reduction of dislocation, if there has been some dislocation, for example there has a fall and the shoulder was dislocated, so it has to be done surgically, the dislocation should be reduced by bandages to bring together the lips of the wounds. If there has been some cut, some wound, and the skin has opened a bit, then some stitches or some bandages should be used so that the lips of the wounds, they can be bring together, they can be closed by the extraction of foreign bodies that have penetrated into the living parts. If some child he has taken in the coin, or some injury was there, and some iron, piece of iron or something has gone inside, it has to be removed, some foreign bodies, they have to be removed by making an opening into a cavity of the body in order to remove an irritating substance. If some irritating substance has gone inside, so some cavity, if there need to be make some cavity, if there is need to make some to do some surgery to remove that, that should be done. But something is going from outside inside, or to procure the evacuations of effusions of collection of fluids after some injury or after this some kind of fracture. If there is some effusions, very prominent effusions which have happened, we have to evacuate them at that time. But now we have to see this. Dr. Hanuman has not told this thing in the this diseases which are coming from inside, for example ascites or pleurisy. He's not talking about that, that those effusions need to, they, this is because of the injury from the outside. Some mechanical injury has happened, after which the this effusions, for example some injury from outside to the chest, and then it has happened by bringing into the apposition the broken extremities. If there are broken extremities, we have to bring them together, we have to place them back, and retaining them in exact contact by an appropriate bandage, etc. But when in such injuries, the whole living organism requires, as it always does, active dynamic aid to put it in a position to accomplish the work of healing. For example, when the violent fever resulting from extensive contusions, lacerated muscles, tendons, and blood vessels require to be removed by medicine given internally, or when the external pain of scalded or burnt parts needs to be homeopathically subdued, then the services of the dynamic physician and his helpful homeopathy come into requisition. So whenever such kind of great injuries, match injuries happen, the whole gets affected. There might be some kind of fevers which are coming. There might be some strong pains which need to be cured, and the whole living organism is affected by it. So it needs some dynamic aid to get that thing cured, because whenever we go into state of injury, such injury, the shock of the injury to the body, it affects a lot. I've seen so many cases where the injury on a particular part has not affected that much, but the whole got affected because of that shock of the injury. There was this lady who was working, and suddenly, because of some error in her movement, the boiling water, it was she it fell on her from the vessel, and the whole body was scalded. So they took her to the hospital, and they were doing something, like they gave some first aid and everything. But that lady, she started going into spells of fainting. She would faint, she would become conscious, then she would faint again, then she would become conscious, then she would faint again, then become conscious. And for then she started having fever, and then delirium came, and even in delirium she would faint and become conscious, faint and then become conscious. This was going on for 3-4 days. And then they contacted me, we talked about her, I saw her video, and I think we gave her camphor. I think, and she started getting better after camphor. She got so better that even her skin, the doctors were, they were amazed at how these scars are becoming better so quickly, that we have never seen it become so quick. And I have seen so many cases. There was another lady whose this fingers, she was doing something with the grinder, and her fingers, they got into the grinder, and she started having this delirious fever afterwards, and she got cured by one of the medicines. I think she was given opium, I think. So many cases where an injury, and injury can never happen if a injury is strong, it can never happen that the whole does not get affected by it. So there you will always need a homeopathic remedy, so that the rest of the part can get, after the surgical part, after they have done some stitches, after they have done some and the first aid has been given, you will always require some homeopathic remedy if the injury has affected the whole organism. So this is the first part of the local disease. Now the second part. But those affections, alterations and ailments appearing on the external parts that do not arise from any external injury, or that have only some slight external wound for their immediate sighting cause, are produced in quite another manner. But those things which are not produced by the external injuries, or there was a very small external injury but it became into a chronic local disease, those things they happen in completely another manner. You will see that some internal malady, some internal miasm is behind their origin. Their source lies in some internal malady. To consider them as mere local affection at the same time, to treat them only or almost only as it were surgically with topical applications, as the old school have done from the remotest ages, is as absurd as it is pernicious in its results. So Dr. Hahnemann says that to treat them in that manner, even the first one, the first local disease where the injury is happening from the outside, okay, we definitely know that the causation is from the outside, but still the whole is affected. The whole organism got affected by it. So where the cause is also internal, where the skin disease is coming from, cause which is going on internally, from where there the skin disease is coming. So there we cannot even expect that a simple local remedy or some single local topical applications they can cure that disease, because here the cause is also internal. We have to give some medicine which can cure that external internal cause, and that is why you know uh, the skin diseases, they are the most difficult ones to cure. There is this some doctor, he told me this thing long back, some that where that when some colleague's child, he wanted to do some specialization. So one of the doctors, he was telling that be a skin doctor, because once a patient comes to you, for whole life he will be your patient, because they are so tough diseases that they will not get cured by this kind of treatment. They will always remain like this. And I have seen so many I recently I had and quite the other ways in with the homeopathy. I recently we had this woman who was working for us, and she got talking to my wife, Dr. Vidya, that she has been having this abscesses from 8 9 years around her thigh region, and they have never got cured. She has used so many ointments, so many creams. She also took some kind of injections, some steroidal creams, and even now she was using some, because it happened in the inner part of the thigh, and they would become quite painful, and she could not work, she could not walk, it was very difficult for her. And after taking her case, Dr. Vidya, my wife, she gave her Natrum self, and she was astonished to see that within I think 12 or 15 days the whole thing got cured. First, she's reported after 5 or 6 days that now there is no pain. They were so painful and itchy. Now there is no pain. There is still some swelling which has decreased, but now there is no pain. And after more 5 or 7 days, it was completely gone. And now I think it has been 3 or 4 months. The blackishness, the blackness of the skin, it is also getting better. The skin is becoming healthy, because the main thing to see in the homeopathic cure when we take the follow up is that it should not be you know that it has suppressed for some time. It should not be there. We have to see. So the best way to see that skin is becoming of normal color. When the skin starts becoming of normal color, we get a surety that okay, now the disease is getting going away. Because in most of the suppressions, or most of the temporary ameliorations, what will happen is that the inflammatory part will get better, but the skin color, it remains same. Like if it is blackish, it will remain blackish, and if it is hard, it will remain hard. So once the texture and the color of the skin starts becoming, then we know that the real cure is getting going on, because then the part is becoming healthy. Only not only the disease is gone, but the part is also becoming healthy. So she was also surprised. She was thankful also that, I have been suffering from this thing from 8 to 9 years, and I could not imagine that any medicine can cure it so fast. That earlier also it would get better, but it never got better in this way, where patient, they can judge the difference, the amelioration which was temporary and the amelioration or the cure which is going on a more permanent level, because the whole is getting better. So the patient can basically see the change. And she then again told that, for the first time, like in this 1 week, the last 1 week which she was getting better, that for the 1 week I have not been angry on anyone. I don't know, I am more happy, I am more energetic, and I could not find any reason to be angry. So when the cure is going on, when a right remedy is given, you can see the minute changes. The patient can also feel that I was getting angry on people. So the whole starts becoming better because the disease is coming from that hole. So when we consider, using some topical application, some, now that is why Dr. Haniman has used absurd, that it does not make any sense to use such kind of treatment. And the pernicious, because once the disease starts getting suppressed from this part, or once it is maltreated from this part, the only way to get affected, or the only part which will start getting affected, is the inside parts, the internal membranes, the internal organs. So it is pernicious, it is dangerous in its results. Many times the skin diseases, they change from the more simpler forms to the more complex forms. uh, Recently I had this lady who is suffering from psoriasis from past 20-25 years, I think. So now when her psoriasis is becoming better, her old kind of eruption, she had used to have small eruptions, very vesicles, very small vesicles, she started having them back. So when I asked her that, and are they, are these problem, this is more problematic, or the psoriasis was more problematic? She said, she immediately said, oh, this I can bear with. This is not giving me any problem. They are very slightly itchy, and they are not causing me trouble whole day. It is just some part of the day that they itch. I just itch it a little bit for a few seconds, and that itch is gone. So even the patient can make that this is something else. It is not the that disease which I was suffering from, which was more violent. So coming to aphorism 188, these affections were considered to be the merely topical and were therefore called local disease. So Dr. Hahnemann wants to, through these aphorisms, he wants to tell a homeopath, he wants to tell a physician, that you have to get separated from this old learning, from this old thinking, where we have always thought of these affections to be local and not connected to the whole. Because on the contrary, when you see it more carefully, that this, whenever the skin gets affected either from internal cause or from the external cause, the whole is always affected. It is always affected. When a person is itching on a part and is a very violent itching, the whole person is affected. It is not only this part of the wrist or the hand. This boy who he came to me, and he stays in England, and he had come to India. Both the brothers, they had skin diseases. So the mother was telling about this boy, around 15-16 years old boy. He cannot sleep in night. Sometimes it is whole week that he cannot sleep. So how I can say, or how someone can say that this is just a mere local disease? It is not affecting the patient, it is just on the skin. His sleep is getting disturbed, his day to day routine is getting disturbed. How can it and only be called a local disease? So Dr. Hanneman wants us to, get away from that kind of thinking and start understanding that these local diseases are part of the whole. They are not something separate from the whole, so that we do not go again doing the same mistake of treating them some different disease and not affecting the organism, as if they were maladies exclusively limited to those parts wherein the organism took little or no part, or affections of these particular visible parts of which the rest of the living organism, so to speak, knew nothing. So he said that these kind of diseases, these local diseases, these skin diseases are being treated as if the rest of the organism does not know about that part or that disease, that they are just visible outside and it has nothing to do with the inside. So here he says in the footnote that it is one of the many great and pernicious blunders of the old school. And yet, very little reflection will suffice to convince us that no external malady, not occasioned by some important injury from without, can arise, persist, or even grow worse without some internal cause. So he says that just a little thinking, you just sit back and you start thinking about this part, that from what is the function of the skin, how it is related to my inside, and you can come to this thing that without the disturbance of the inside, without some internal cause, this part or this external disease or this skin disease, it cannot come without some internal cause, without the cooperation of the whole organism, which must consequently be in a diseased state. So when skin is getting diseased, that means the whole organism is basically in a diseased state. It could not make its appearance at all without the consent of the whole of the rest of the health, and without the participation of the rest of the living whole. So the skin disease or some appearance, even a smallest of the rash or eruption, which coming which is coming from no external cause, it cannot make its appearance until and unless the whole agrees with that thing, until and unless that state of health agrees that we need this kind of rash or this has to be produced of the vital force that pervades all the other sensitive and irritable parts of the organism. Indeed, it is impossible to conceive its production without the instrumentality of the whole deranged life. Whenever the life is in a state of derangement, I just love few words which Dr. Henneman uses, the deranged life, whole deranged life. When the life is in a state of derangement, when uh, there are some things, not my life, but the life around me also and mine also, because the life is interconnected. Life is not a singular, some different entities, it is a singular thing. We all are interconnected. For example, if someone is sick in our home, that thing is basically rearranging the life around that person also, the person who care about that person, the person and the people who are in any kind of connection at different levels, they feel that derangement. So when the life is deranged, when we are taking in things from the outer world which are basically deranging that flow of life, we all have that healthy flow of life, and when that gets deranged, when we pick up the things, when we take in the things which we are sensitized to, from there these kind of things they start, and it is impossible to understand, it is impossible to, to get that thing, that the skin disease or these kind of eruptions or the some rashes, they will erupt without the whole deranged life, without the life, the whole organism getting deranged. So intimately are all parts of the organism connected together, all the parts of the organism are interconnected, and we call that as whole. They are so interconnected together to form an indivisible whole in sensations and functions. So we are whole in our sensation and function. It is inconceivable, it is impracticable to think that one part is getting sick and the other parts don't know about it. It is very impractical thing to think. If someone pinches me here and my other parts don't feel that pinch, how this can happen? When someone pinches you, with a more force, your lips and your vocal cords act and ah, we say that thing. So the information went to my vocal cords, the information went to my tongue to bring out that I am not feeling good about this thing. If some mosquito bites, the other hand will come and slap there. So this is not a local problem, it is affecting the whole part. If my right hand didn't knew what is happening on my left hand, how it will come in the defense of the left hand? So we are whole, and we have to understand that before going more further into how to cure local diseases, we have to understand this thing. Because many times, for rashes, we are giving just sulfur or some other medicine which has action, some silicea, for calcarea sulfur for the boils or this thing. That is not going to do any improvement for a long time in the patients. We have to go inside, we have to see what is basically affecting this thing, how this patient is sensitized. We'll go into more further details when we go in the next class. So no eruption on the lips, no whitlow can occur without previous and simultaneous internal ill health. Even the smallest of eruptions, some white discoloration, some whitlow, it can never come without previous, or at that time also there is patient or organism is having internal ill health. The signs or symptoms may be slightly visible, may not be visible, but there is something going on which we have to find out. All true medical treatment of a disease on the external parts of the body that has occurred from little or no injury from without must therefore be directed against the whole. So when some disease is coming on the external parts, not due to some injury, whenever some disease is coming from internally, so the whole treatment, the whole medical treatment should be directed to that whole internal disease, must affect the annihilation and cure of the general malady by means of internal remedies, not external remedies. We have to give internal remedies. We have to give medicines which cure from the inside. If it is wished that the treatment should be judicious, sure, efficacious, and radical. So, if we need a treatment which is sure, which is efficacious, which is justified, and which is prompt, which is fast, we have to cure the patients like this. There is no other way. So with that, we will stop today's this class on organ. So just go back when during this 1 week, think about the skin, because it is very important. What do you feel from your skin? The temperatures, the pressures, the proximity, the spatial recognition, whatever you feel, whatever you sense, you feel through your skin, through your senses. Then you can go more deep on your senses, on with your eyes. 60 to 70% information which we get from our skin and eyes, these two organs. Okay, the unconscious information is coming from the skin part. For right now, for example, I'm sitting in this air conditioned room, I can feel on my skin that coldness which is being produced. My body is getting that information and reacting in the way that it is feeling, little cold or little this thing. And then the eyes, just you close your eyes and you get relieved from around 40 to 50% of the problems in your life. You see someone you don't like, you see something you don't like, you see there are so many things to be done, you see so many problems in front of you, you just close your eyes and you are relieved. So that is the part which is affecting us. So if we need to understand how the patient is getting affected, we have to see that how my skin and my senses are basically in a way affecting me also. They are very important part of our life. They are very important, but they are being misused by the learned intellect. Most of the time we say these things. I cannot see this happening. So when some information is going inside me through my eyes, through my skin, which I am not liking, so obviously it is going to, you know, create some turmoil inside. It is going to create some problem inside me. So the whole will agree with that thing that yes, not only the eyes, not only the brain, but the whole body does not like this thing happening. You will start feeling something around your stomach. You will start feeling some jitteriness, some anxiety in your body. If it is thing to be produced, anger must be produced, then you will see, for example, the children, they have, not kept books properly or the clothes properly. The mother comes, she sees that thing, she starts feeling in her whole body that anger. So the eyes are not getting angry, the brain is not getting angry, the anger is felt in the whole body. But from where the information came? From the eyes. The eyes played a role, the skin played a role in that part. So it gets more deeper than the separation thing. It is more about how I am percepting my reality through my these senses. And that is the cause for why this part it starts getting affected. Why our senses get affected, why skin gets affected, why the eyes get affected. So we'll try to go more deeper into this part in our next class, and how to cure that thing, how we have to understand it, and how to go more deep into that understanding so that we can come up with a medicine which can cure these local diseases. And then you will be very surprised to see that after the local diseases, mean skin diseases, the next one sided diseases are the mental diseases. So very connected, because mental diseases are again the diseases where the reality is compromised, where I am perceiving completely different things, some schizophrenia, some bipolar manias. Again the whole reality is compromised. I'm not seeing, feeling, hearing, looking at the things as they are. So we'll go. It is very interesting part of this organ. The whole organ is interesting, but here, because when we are talking about how to cure them, it becomes more practical. So I will take your leave now. We will see each other next Wednesday, and then we will more discuss about this thing. Thank you. Thank you so much.